1. Understanding ADHD. 1.1 What is ADHD? Attention Deficit Hyperactivity Disorder (ADHD) is a neurodevelopmental disorder that affects both children and adults. It is characterized by persistent patterns of inattention, hyperactivity, and impulsivity that can significantly impact daily functioning and quality of life. ADHD is one of the most common mental health disorders, affecting approximately 5 to 10% of children and 2–5% of adults worldwide. 1.1.1 Understanding the symptoms. ADHD is typically diagnosed based on the presence of specific symptoms that persist over time and across different settings. The symptoms can be categorized into three main types: inattentive, hyperactive, impulsive, or a combination of both. Inattentive symptoms. Individuals with inattentive symptoms often struggle with maintaining focus and paying attention to details. They may have difficulty following instructions, organizing tasks, and completing assignments. They may also frequently lose or misplace items and appear forgetful or easily distracted. Hyperactive symptoms. Hyperactive symptoms manifest as excessive and uncontrollable levels of physical activity. People with hyperactivity may have difficulty sitting still, constantly fidget or squirm, and have a strong urge to move around. They may also talk excessively and have difficulty engaging in activities quietly. Impulsive symptoms. Impulsivity refers to acting without thinking about the consequences. Individuals with impulsive symptoms may interrupt others, have difficulty waiting their turn, and engage in risky behaviors without considering the potential outcomes. They may also struggle with impulse control, leading to impulsive spending, decision-making, or emotional outbursts. 1.1.2 Onset and duration. ADHD symptoms often appear in early childhood, with most individuals being diagnosed before the age of 12. However, it is not uncommon for symptoms to persist into adolescence and adulthood. In some cases, ADHD may go undiagnosed until adulthood, as individuals may develop coping mechanisms or have milder symptoms that are less noticeable. 1.1.3 Impact on daily life. ADHD can significantly impact various aspects of an individual's life, including academic performance, work productivity, relationships, and overall well-being. Children with ADHD may struggle academically, have difficulty following instructions, and experience challenges with social interactions. Adults with ADHD may face difficulties in maintaining employment, managing finances, and maintaining healthy relationships. 1.1.4 Coexisting conditions. ADHD often coexists with other mental health conditions, such as anxiety disorders, depression, learning disabilities, and substance abuse. These coexisting conditions can further complicate the management of ADHD symptoms and may require additional treatment and support. 1.1.5 Gender differences. ADHD is more commonly diagnosed in boys than girls, but this may be due to differences in symptom presentation. Boys with ADHD tend to display more hyperactive and impulsive behaviors, while girls may exhibit more inattentive symptoms. It is important to recognize that ADHD can affect individuals of all genders and that symptoms may vary. 1.1.6 Lifelong condition. ADHD is a chronic condition that often persists into adulthood. However, the symptoms and their impact can change over time. While some individuals may experience a reduction in symptoms as they mature, others may continue to struggle with ADHD-related challenges throughout their lives. It is crucial to understand that ADHD is not a result of laziness or a lack of intelligence but rather a neurobiological condition that requires appropriate management and support. In the following chapters, we will explore various strategies and techniques to manage ADHD symptoms effectively, improve daily functioning, and enhance overall well-being. By understanding the nature of ADHD and implementing appropriate interventions, individuals with ADHD can thrive and lead fulfilling lives. 1.2 Causes and risk factors. ADHD, or Attention Deficit Hyperactivity Disorder, is a neurodevelopmental disorder that affects both children and adults. While the exact cause of ADHD is still not fully understood, research suggests that it is a complex condition influenced by a combination of genetic, environmental, and neurological factors. In this section, we will explore the various causes and risk factors associated with ADHD. 1.2.1 Genetic factors. Research has shown that genetics play a significant role in the development of ADHD. Studies have found that ADHD tends to run in families, with a higher likelihood of having the disorder if a close relative, such as a parent or sibling, also has ADHD. Twin studies have further supported the genetic link, showing a higher concordance rate for ADHD in identical twins compared to fraternal twins. Several genes have been identified as potential contributors to ADHD. These genes are involved in the regulation of neurotransmitters, such as dopamine and norepinephrine, which play a crucial role in attention, impulse control, and hyperactivity. Variations in these genes may affect the functioning of these neurotransmitters, leading to the symptoms associated with ADHD. 1.2.2 Neurological factors. Neurological factors also play a role in the development of ADHD. Studies using brain imaging techniques have revealed differences in the structure and functioning of certain brain regions in individuals with ADHD. These differences primarily involve the prefrontal cortex, which is responsible for executive functions such as attention, impulse control, and decision-making. In individuals with ADHD, the prefrontal cortex may be smaller in size or exhibit abnormal patterns of activation. This can lead to difficulties in regulating attention, inhibiting impulsive behaviors, and maintaining focus. Additionally, there may be imbalances in the levels of neurotransmitters in the brain, particularly dopamine and norepinephrine, which can further contribute to the symptoms of ADHD. 1.2.3 Environmental factors. While genetics and neurological factors play a significant role in ADHD, environmental factors can also influence the development and severity of the disorder. Certain prenatal and early life factors have been associated with an increased risk of ADHD. Exposure to substances during pregnancy, such as tobacco smoke, alcohol, or illicit drugs, has been linked to an increased risk of ADHD in children. Maternal stress during pregnancy and complications during childbirth, such as premature birth or low birth weight, have also been identified as potential risk factors. Early exposure to environmental toxins, such as lead or pesticides, has been associated with an increased risk of ADHD. Additionally, growing up in an environment with high levels of chaos, family conflict, or neglect can contribute to the development of ADHD symptoms. 1.2.4 Other risk factors. In addition to genetic, neurological, and environmental factors, several other risk factors have been identified in relation to ADHD. Gender. Boys are more commonly diagnosed with ADHD than girls, with estimates suggesting a ratio of 3:1. However, it is important to note that ADHD can occur in both males and females. Premature birth. Children born prematurely, particularly those with very low birth weight, have a higher risk of developing ADHD. Family factors. Certain family factors, such as low socioeconomic status, parental psychopathology, and family dysfunction, have been associated with an increased risk of ADHD. Chronic medical conditions. Children with chronic medical conditions, such as epilepsy or asthma, have a higher likelihood of also having ADHD. Conclusion. ADHD is a complex disorder with multiple causes and risk factors. While genetics and neurological factors play a significant role, environmental factors and other risk factors also contribute to the development and severity of ADHD. Understanding these causes and risk factors can help individuals and families affected by ADHD to better navigate the challenges associated with the disorder. In the next section, we will explore the process of diagnosing and assessing ADHD. 1.3 Diagnosis and assessment. Diagnosing and assessing ADHD is a crucial step in understanding and managing the condition. It involves a comprehensive evaluation of a person's symptoms, behaviors, and medical history. This process helps to determine whether an individual meets the criteria for ADHD and to rule out other possible causes for their symptoms. In this section, we will explore the diagnosis and assessment process for ADHD, including the various tools and methods used by healthcare professionals. 1.3.1 Clinical interviews. One of the primary methods used in diagnosing ADHD is through clinical interviews. These interviews involve gathering information from the individual, as well as their parents, teachers, and other significant individuals in their life. The purpose of these interviews is to gain a comprehensive understanding of the individual's symptoms, behaviors, and functioning in different settings. The information collected during these interviews helps to assess the presence and severity of ADHD symptoms and their impact on daily life. During the clinical interview, the healthcare professional will ask questions about the individual's developmental history, academic performance, social interactions, and emotional well-being. They will also inquire about the presence of symptoms such as inattention, hyperactivity, and impulsivity. The information gathered from these interviews provides valuable insights into the individual's experiences and helps to form a diagnosis. 1.3.2 Rating scales and questionnaires. Rating scales and questionnaires are commonly used tools in the diagnosis and assessment of ADHD. These self-report measures are designed to gather information about an individual's symptoms, behaviors, and functioning. They are typically completed by the individual themselves, as well as their parents, teachers, and other caregivers. The most widely used rating scale for ADHD is the ADHD rating scale, which assesses symptoms of inattention, hyperactivity, and impulsivity. Other commonly used scales include the Conners rating scales and the Vanderbilt assessment scales. These scales provide standardized measures of ADHD symptoms and help to quantify the severity of the condition. Questionnaires may also be used to assess other aspects of the individual's functioning, such as emotional well-being, social skills, and academic performance. These questionnaires provide additional information that can contribute to a comprehensive assessment of the individual's needs and challenges. 1.3.3 Neuropsychological testing. Neuropsychological testing is another valuable tool in the diagnosis and assessment of ADHD. These tests are designed to evaluate an individual's cognitive abilities, including attention, memory, executive functioning, and processing speed. By assessing these cognitive domains, healthcare professionals can gain a better understanding of the individual's strengths and weaknesses and how they may be impacted by ADHD. Neuropsychological testing typically involves a series of standardized tasks and measures. These tasks may include tests of sustained attention, working memory, response inhibition, and cognitive flexibility. The results of these tests provide objective data about the individual's cognitive functioning and can help to inform treatment planning and intervention strategies. 1.3.4 Medical Evaluation. In addition to the above methods, a medical evaluation is an essential component of the diagnosis and assessment process for ADHD. This evaluation involves a thorough examination of the individual's medical history, physical health, and any potential underlying medical conditions that may contribute to their symptoms. During the medical evaluation, the healthcare professional may conduct a physical examination, review the individual's medical records, and order laboratory tests if necessary. This evaluation helps to rule out other medical conditions that may mimic or coexist with ADHD symptoms, such as thyroid disorders, sleep disorders, or hearing and vision problems. 1.3.5 Diagnostic Criteria. To receive a formal diagnosis of ADHD, an individual must meet the criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders (DSM-5) published by the American Psychiatric Association. The DSM-5 provides specific criteria for diagnosing ADHD based on the presence and severity of symptoms, the age of onset, and the impact of symptoms on daily functioning. According to the DSM-5, there are three subtypes of ADHD: predominantly inattentive presentation, predominantly hyperactive impulsive presentation, and combined presentation. The specific subtype is determined based on the predominant symptoms exhibited by the individual. It is important to note that the diagnosis of ADHD should be made by a qualified healthcare professional, such as a psychiatrist, psychologist, or pediatrician, who has expertise in assessing and diagnosing neurodevelopmental disorders. Conclusion. The diagnosis and assessment of ADHD involve a comprehensive evaluation of an individual's symptoms, behaviors, and functioning. Through clinical interviews, rating scales, questionnaires, neuropsychological testing, and medical evaluation, healthcare professionals can gather the necessary information to make an accurate diagnosis. Understanding the diagnostic process is essential for individuals with ADHD and their families, as it provides a foundation for developing effective treatment plans and strategies to manage the condition. 1.4 Types of ADHD. ADHD, or Attention Deficit Hyperactivity Disorder, is a neurodevelopmental disorder that affects both children and adults. While ADHD is commonly associated with symptoms of inattention, hyperactivity, and impulsivity, it is important to note that there are different types of ADHD that individuals may experience. Understanding the different types of ADHD can help individuals and their loved ones better navigate the challenges and develop appropriate strategies for managing the disorder. 1.4.1 Predominantly Inattentive Presentation. One type of ADHD is the predominantly inattentive presentation, also known as ADHD-PI. Individuals with this type of ADHD primarily struggle with inattention and have difficulty sustaining focus and attention on tasks or activities. They may often appear forgetful, easily distracted, and have trouble organizing and completing tasks. People with ADHD-PI may also have difficulty following instructions and may seem disorganized or scatterbrained. 1.4.2 Predominantly Hyperactive Impulsive Presentation. Another type of ADHD is the predominantly hyperactive impulsive presentation, also known as ADHD-high. Individuals with this type of ADHD exhibit more hyperactive and impulsive behaviors compared to inattentiveness. They may have difficulty sitting still, constantly fidget, and have a strong need for movement. People with ADHD-high may also struggle with impulsivity, acting without thinking, interrupting others, and having difficulty waiting their turn. 1.4.3 Combined Presentation. The most common type of ADHD is the combined presentation, also known as ADHD-C. Individuals with this type of ADHD experience symptoms of both inattention and hyperactivity impulsivity. They may have difficulty focusing, be easily distracted, exhibit hyperactive behaviors, and struggle with impulsivity. ADHD-C is often the most challenging type of ADHD to manage, as individuals may experience a wide range of symptoms that can significantly impact their daily lives. 1.4.4 Other Specified and Unspecified ADHD. In addition to the three main types of ADHD, there are also two other categories: Other Specified ADHD and Unspecified ADHD. Other Specified ADHD is used when an individual's symptoms do not meet the criteria for any of the specific types but still experience significant impairment. Unspecified ADHD is used when there is not enough information available to determine the specific type of ADHD. It is important to note that ADHD is a complex disorder, and individuals may experience symptoms that vary in severity and presentation. Some individuals may exhibit symptoms that do not fit neatly into one specific type, and their symptoms may change over time. It is also possible for individuals to have comorbid conditions, such as anxiety or learning disabilities, which can further complicate the diagnosis and management of ADHD. Understanding the different types of ADHD can help individuals and their loved ones better tailor their approach to managing the disorder. Treatment plans, coping strategies, and interventions may vary depending on the specific type of ADHD an individual has. It is essential to work closely with healthcare professionals, such as doctors, therapists, and educators, to develop an individualized plan that addresses the unique needs and challenges associated with each type of ADHD. By gaining a deeper understanding of the different types of ADHD, individuals can empower themselves to seek appropriate support, develop effective strategies, and ultimately thrive with ADHD. Remember, ADHD is not a limitation but a unique way of thinking and experiencing the world. With the right tools and support, individuals with ADHD can lead fulfilling and successful lives. 2. Managing ADHD symptoms. 2.1 Medication and treatment options. When it comes to managing ADHD, there are various medication and treatment options available. It is important to note that every individual with ADHD is unique, and what works for one person may not work for another. Therefore, it is crucial to work closely with a healthcare professional to determine the most suitable approach for managing symptoms. In this section, we will explore the different medication and treatment options commonly used for ADHD. 2.1.1 Medication. Medication is often a primary treatment option for ADHD. There are two main types of medications used: stimulants and non-stimulants. Stimulant medications, such as methylphenidate, Ritalin, and amphetamine, Adderall, are the most commonly prescribed medications for ADHD. They work by increasing the levels of certain chemicals in the brain that help regulate attention and impulse control. Stimulant medications are available in various forms, including short-acting and long-acting formulations. Short-acting medications typically last for a few hours and need to be taken multiple times a day. Long-acting medications, on the other hand, provide extended coverage and only need to be taken once a day. Non-stimulant medications, such as atomoxetine, Strattera, and guanfacine, Intuniv, are an alternative for individuals who do not respond well to or cannot tolerate stimulant medications. These medications work differently than stimulants and may be prescribed alone or in combination with stimulant medications. It is important to note that medication alone is not a cure for ADHD. It helps manage symptoms but does not address the underlying causes of ADHD. Additionally, medication may have side effects, and it is essential to discuss any concerns or potential side effects with a healthcare professional. 2.1.2 Behavioral therapy. In addition to medication, behavioral therapy is an essential component of managing ADHD. Behavioral therapy focuses on teaching individuals with ADHD-specific skills and strategies to improve their behavior, attention, and self-control. It can be particularly beneficial for children and adolescents with ADHD. One commonly used behavioral therapy for ADHD is cognitive behavioral therapy, CBT. CBT helps individuals identify and change negative thought patterns and behaviors that contribute to ADHD symptoms. It also teaches practical skills, such as organization, time management, and problem solving, to help individuals better manage their daily lives. Another effective behavioral therapy for ADHD is behavior modification. This approach involves setting clear expectations, establishing rewards and consequences, and providing structure and routine. It helps individuals with ADHD develop positive behaviors and habits while reducing impulsive and disruptive behaviors. 2.1.3 Alternative treatments. In addition to medication and behavioral therapy, some individuals with ADHD may explore alternative treatments. It is important to approach alternative treatments with caution and consult with a healthcare professional before trying them. One alternative treatment that has gained attention is neurofeedback. Neurofeedback uses real-time displays of brain activity to teach individuals how to regulate their brainwaves. The goal is to improve attention and self-regulation. While some studies have shown promising results, more research is needed to determine its effectiveness as a standalone treatment for ADHD. Other alternative treatments that individuals may consider include dietary changes, such as eliminating certain food additives or allergens, and herbal supplements. However, the evidence supporting the effectiveness of these treatments is limited, and they should be used under the guidance of a healthcare professional. 2.1.4 Complementary therapies. Complementary therapies can also be used alongside medication and behavioral therapy to support the management of ADHD symptoms. These therapies aim to promote relaxation, reduce stress, and improve overall well-being. One commonly used complementary therapy is mindfulness meditation. Mindfulness involves paying attention to the present moment without judgment. It can help individuals with ADHD improve their focus, reduce impulsivity, and manage stress. Other complementary therapies that may be beneficial include yoga, acupuncture, and massage therapy. It is important to note that while complementary therapies can be helpful, they should not replace evidence-based treatments such as medication and behavioral therapy. They should be used as additional tools to support overall ADHD management. In conclusion, managing ADHD involves a combination of medication, behavioral therapy, and potentially alternative or complementary treatments. It is crucial to work closely with a healthcare professional to determine the most appropriate treatment plan for each individual. Remember, what works for one person may not work for another, so it may take time to find the right combination of treatments that effectively manage ADHD symptoms. 2.2 Behavioral therapy. Behavioral therapy is an essential component of managing ADHD symptoms. It focuses on modifying behaviors and teaching individuals with ADHD new skills to help them cope with the challenges they face. This type of therapy is often used in conjunction with other treatment options, such as medication, to provide a comprehensive approach to managing ADHD. 2.2.1 What is behavioral therapy? Behavioral therapy, also known as behavior modification or behavior management, is a form of psychotherapy that aims to change problematic behaviors and promote positive ones. It is based on the principles of learning theory, which suggest that behaviors can be learned and unlearned through conditioning and reinforcement. In the context of ADHD, behavioral therapy helps individuals develop strategies to improve their attention, impulse control, and overall behavior. It focuses on teaching specific skills and techniques that can be applied in various settings, such as home, school, and work. 2.2.2 Techniques used in behavioral therapy for ADHD. There are several techniques commonly used in behavioral therapy for ADHD. These techniques are designed to address specific symptoms and challenges associated with the disorder. Some of the most effective techniques include 2.2.2.1 Behavior monitoring. Behavior monitoring involves keeping track of specific behaviors and their frequency. This technique helps individuals with ADHD become more aware of their actions and identify patterns or triggers that may contribute to their symptoms. By monitoring their behavior, individuals can gain insight into their strengths and weaknesses and make necessary adjustments. 2.2.2.2 Token economy. Token economy is a reward system that uses tokens or points to reinforce positive behaviors. Individuals with ADHD earn tokens for completing tasks, following instructions, or exhibiting desired behaviors. These tokens can then be exchanged for rewards or privileges. Token economy helps individuals with ADHD stay motivated and provides immediate feedback for their efforts. 2.2.2.3 Time management and organization skills. Time management and organization skills are crucial for individuals with ADHD, as they often struggle with planning, prioritizing, and staying organized. Behavioral therapy helps individuals develop strategies to manage their time effectively, break tasks into smaller, manageable steps, and create systems for organizing their belongings and schedules. 2.2.2.4 Social skills training. Many individuals with ADHD struggle with social interactions and may have difficulty maintaining friendships or understanding social cues. Social skills training focuses on teaching individuals with ADHD appropriate social behaviors, such as active listening, turn-taking, and nonverbal communication. This training can improve their ability to navigate social situations and build meaningful relationships. 2.2.2.5 Self-regulation techniques. Self-regulation techniques help individuals with ADHD manage their emotions, impulses, and attention. These techniques include deep breathing exercises, mindfulness meditation, and self-monitoring. By learning to recognize and regulate their emotions, individuals can improve their ability to focus, control impulsive behaviors, and make better decisions. 2.2.3 Benefits of behavioral therapy for ADHD. Behavioral therapy offers numerous benefits for individuals with ADHD. Some of the key advantages include 2.2.3.1 Improved behavior and self-control. Behavioral therapy helps individuals with ADHD develop self-control and manage impulsive behaviors. By learning new strategies and techniques, individuals can gain better control over their actions and make more informed decisions. 2.2.3.2 Enhanced social skills. Social skills training in behavioral therapy can significantly improve an individual's ability to interact with others. By learning appropriate social behaviors, individuals can build stronger relationships, improve communication, and reduce social difficulties. 2.2.3.3 Increased academic performance. Behavioral therapy can have a positive impact on academic performance. By teaching time management, organization skills, and study strategies, individuals with ADHD can improve their focus, productivity, and overall academic success. 2.2.3.4 Better emotional regulation. Individuals with ADHD often struggle with emotional dysregulation. Behavioral therapy equips them with techniques to manage their emotions effectively, reducing stress, anxiety, and mood swings. 2.2.4 Incorporating behavioral therapy into daily life. To make the most of behavioral therapy, it is essential to incorporate the techniques and strategies learned into daily life. Here are some tips for integrating behavioral therapy into your routine. Practice the techniques consistently and regularly. Set realistic goals and track progress. Seek support from family, friends, or support groups. Communicate with your therapist or counselor regularly. Be patient and persistent, as change takes time. Remember, behavioral therapy is a valuable tool in managing ADHD symptoms, but it is not a cure. It works best when combined with other treatment options, such as medication and support from healthcare professionals. By utilizing the techniques and strategies learned in behavioral therapy, individuals with ADHD can improve their overall well-being and lead fulfilling lives. 2.3 Coping strategies for inattention. Inattention is one of the core symptoms of ADHD, and it can significantly impact daily life and productivity. However, there are various coping strategies that individuals with ADHD can employ to manage and minimize the effects of inattention. These strategies can help improve focus, increase productivity, and enhance overall functioning. In this section, we will explore some effective coping strategies for inattention. 2.3.1 Create a structured environment. Creating a structured environment is essential for individuals with ADHD, as it helps reduce distractions and promotes better focus. Here are some strategies to create a structured environment. Organize your physical space. Keep your workspace clean and clutter-free. Use storage solutions, such as bins and folders, to keep items organized and easily accessible. Establish a routine. Develop a daily routine and stick to it. Having a predictable schedule can help individuals with ADHD stay on track and manage their time effectively. Use visual cues. Utilize visual cues, such as calendars, to-do lists, and reminders, to help you stay organized and remember important tasks and deadlines. 2.3.2 Break tasks into manageable chunks. Large tasks can be overwhelming for individuals with ADHD, leading to procrastination and difficulty in getting started. Breaking tasks into smaller, more manageable chunks can make them feel less daunting and increase productivity. Here's how you can break tasks into manageable chunks. Create a task list. Write down all the steps required to complete a task. Breaking it down into smaller steps will make it easier to tackle. Set realistic goals. Set achievable goals for each task or subtask. This will help you stay motivated and provide a sense of accomplishment as you complete each goal. Use timers or alarms. Set timers or alarms to allocate specific time intervals for each task. This can help you stay focused and prevent time from slipping away. 2.3.3 Implement time management techniques. Time management is crucial for individuals with ADHD, as they often struggle with time perception and staying on schedule. Here are some effective time management techniques. Prioritize tasks. Identify the most important tasks and prioritize them. Focus on completing high-priority tasks first to ensure they are not neglected. Use a planner or digital calendar. Utilize a planner or digital calendar to schedule tasks, appointments, and deadlines. Set reminders to help you stay on track. Break down time into intervals. Divide your day into smaller time intervals and allocate specific tasks or activities to each interval. This can help you stay organized and make the most of your time. 2.3.4 Minimize distractions. Distractions can significantly impact focus and attention for individuals with ADHD. Minimizing distractions in your environment can help improve concentration and productivity. Here are some strategies to minimize distractions. Create a dedicated workspace. Designate a specific area for work or study that is free from distractions. This can be a separate room or a quiet corner in your home. Turn off notifications. Disable notifications on your electronic devices, such as smartphones and computers, to minimize interruptions and maintain focus. Use noise-canceling headphones. If you are easily distracted by noise, consider using noise-canceling headphones to block out external sounds and create a more focused environment. 2.3.5 Practice mindfulness and meditation. Mindfulness and meditation techniques can be beneficial for individuals with ADHD, as they help improve focus, reduce stress, and increase self-awareness. Here's how you can incorporate mindfulness and meditation into your daily routine. Start with short sessions. Begin with short meditation sessions, gradually increasing the duration as you become more comfortable. Even a few minutes of mindfulness practice can have a positive impact. Focus on the present moment. Pay attention to your breath or a specific sensation in your body. Whenever your mind wanders, gently bring your focus back to the present moment. Use guided meditation apps or videos. Utilize guided meditation apps or videos to help you get started and provide structure to your practice. By implementing these coping strategies for inattention, individuals with ADHD can effectively manage their symptoms and improve their overall functioning. It is important to remember that everyone's experience with ADHD is unique, so it may take some trial and error to find the strategies that work best for you. Be patient with yourself and celebrate small victories along the way. 2.4 Coping strategies for hyperactivity and impulsivity. Hyperactivity and impulsivity are common symptoms of ADHD that can significantly impact daily life. Individuals with ADHD may struggle with restlessness, fidgeting, difficulty staying seated, excessive talking, and acting without thinking. These symptoms can make it challenging to focus, complete tasks, and maintain relationships. However, there are various coping strategies that can help manage hyperactivity and impulsivity and improve overall functioning. In this section, we will explore some effective strategies to address these symptoms. 2.4.1 Establishing structure and routine. Creating a structured and predictable environment can be beneficial for individuals with ADHD. Establishing a daily routine can help reduce impulsivity and provide a sense of stability. It is essential to have consistent wake-up and bedtime routines, regular meal times, and designated times for work, study, and leisure activities. Breaking tasks into smaller, manageable steps and setting specific time frames for each task can also help individuals with ADHD stay focused and organized. 2.4.2 Engaging in regular physical activity. Engaging in regular physical activity can be an effective way to manage hyperactivity and impulsivity. Exercise helps release excess energy and promotes the production of neurotransmitters that regulate mood and attention. Encouraging activities such as walking, jogging, swimming, or participating in team sports can help individuals with ADHD channel their energy in a positive and productive way. Additionally, physical activity can improve overall well-being and reduce stress, which can further alleviate symptoms of ADHD. 2.4.3 Utilizing mindfulness and relaxation techniques. Practicing mindfulness and relaxation techniques can help individuals with ADHD calm their minds and reduce impulsivity. Mindfulness involves focusing on the present moment without judgment, allowing individuals to become more aware of their thoughts and emotions. Techniques such as deep breathing exercises, progressive muscle relaxation, and guided imagery can help promote relaxation and improve self-control. Regular practice of these techniques can enhance attention, reduce impulsivity, and increase overall well-being. 2.4.4 Implementing self-regulation strategies. Self-regulation strategies are essential for managing hyperactivity and impulsivity. These strategies involve recognizing and controlling impulsive behaviors and emotions. One effective technique is the stop and think method, where individuals pause before acting and consider the consequences of their actions. Taking a moment to evaluate the situation and consider alternative responses can help individuals make more thoughtful and deliberate choices. Additionally, using visual cues, such as sticky notes or reminders, can serve as prompts to pause and reflect before acting impulsively. 2.4.5 Developing time management skills. Time management skills are crucial for individuals with ADHD to stay organized and reduce impulsivity. Using tools such as calendars, planners, or smartphone apps can help individuals keep track of appointments, deadlines, and tasks. Breaking tasks into smaller, manageable chunks and setting realistic deadlines can prevent individuals from feeling overwhelmed and reduce the likelihood of impulsive decision-making. Additionally, setting aside specific times for planning and prioritizing tasks can help individuals stay focused and avoid impulsive distractions. 2.4.6 Practicing social skills and communication. Developing effective social skills and communication strategies can help individuals with ADHD manage impulsivity in social situations. It is essential to practice active listening, maintain eye contact, and take turns speaking. Learning to pause and think before responding can prevent impulsive reactions and improve overall communication. Seeking support from a therapist or participating in social skills training programs can provide individuals with ADHD with the necessary tools to navigate social interactions successfully. 2.4.7 Seeking support and building a supportive network. Seeking support from others who understand and can empathize with the challenges of ADHD can be invaluable. Joining support groups or online communities can provide individuals with ADHD a safe space to share experiences, exchange coping strategies, and receive encouragement. Building a supportive network of family, friends, and professionals who can offer guidance and understanding can also help individuals manage hyperactivity and impulsivity effectively. 2.4.8 Managing stress and emotions. Stress and intense emotions can exacerbate hyperactivity and impulsivity in individuals with ADHD. Learning effective stress management techniques, such as deep breathing exercises, meditation, or engaging in hobbies, can help individuals regulate their emotions and reduce impulsive behaviors. It is also important to identify triggers that contribute to stress and develop strategies to minimize their impact. Seeking professional help, such as therapy or counseling, can provide individuals with ADHD with additional tools to manage stress and emotions effectively. In conclusion, managing hyperactivity and impulsivity is crucial for individuals with ADHD to improve their overall functioning and well-being. By implementing strategies such as establishing structure and routine, engaging in regular physical activity, practicing mindfulness and relaxation techniques, utilizing self-regulation strategies, developing time management skills, practicing social skills and communication, seeking support, and managing stress and emotions, individuals with ADHD can effectively cope with these symptoms and thrive in their daily lives. 3. Creating an ADHD-friendly environment. 3.1 Organizing your space. One of the key strategies for managing ADHD is creating an organized and clutter-free environment. An organized space can help reduce distractions, improve focus, and enhance productivity. When your physical surroundings are in order, it becomes easier to stay on track and complete tasks efficiently. In this section, we will explore various techniques and tips for organizing your space to better manage your ADHD symptoms. 3.1.1 Decluttering. The first step in organizing your space is decluttering. Clutter can be overwhelming and can make it difficult to concentrate. Start by going through each room and identifying items that are no longer needed or used. Sort these items into categories such as donate, sell, or discard. By getting rid of unnecessary items, you create more physical and mental space for yourself. 3.1.2 Creating storage solutions. Once you have decluttered, it's important to create effective storage solutions. Having designated places for your belongings makes it easier to find and access them when needed. Consider using storage bins, shelves, and drawers to keep items organized. Labeling containers and shelves can also help you quickly locate items and maintain order. 3.1.3 Designating workspaces. Having dedicated workspaces can help you stay focused and productive. Create a designated area for different activities such as studying, working, or hobbies. Ensure that these spaces are free from distractions and have all the necessary supplies within reach. By having specific areas for different tasks, you can train your brain to associate each space with its respective activity. 3.1.4 Establishing a daily routine. A consistent daily routine can provide structure and help you stay organized. Set specific times for activities such as waking up, meals, work, and relaxation. Incorporate regular breaks into your routine to prevent burnout and maintain focus. Use visual cues such as calendars or planners to keep track of your schedule and tasks. Stick to your routine as much as possible to create a sense of stability and predictability. 3.1.5 Managing paperwork. Paperwork can quickly accumulate and become overwhelming. Develop a system for managing paperwork, such as bills, documents, and mail. Consider using folders, binders, or digital storage solutions to keep important papers organized and easily accessible. Sort and file paperwork regularly to prevent it from piling up and causing unnecessary stress. 3.1.6 Simplifying your space. Simplifying your space can help reduce sensory overload and improve focus. Minimize visual distractions by keeping surfaces clear and uncluttered. Use neutral colors and simple decor to create a calming environment. Consider using noise-canceling headphones or white noise machines to block out auditory distractions. By creating a simplified and organized space, you can create a more conducive environment for concentration and productivity. 3.1.7 Utilizing technology. Technology can be a valuable tool for organizing your space and managing ADHD symptoms. Use digital calendars, task management apps, and reminder systems to keep track of appointments, deadlines, and tasks. Set up alerts and notifications to help you stay on top of your schedule. Explore productivity apps that can assist with organizing and prioritizing your tasks. However, be mindful of not getting overwhelmed by excessive notifications or spending too much time on digital devices. 3.1.8 Seeking support. Organizing your space can be challenging, especially if you struggle with executive functioning skills. Consider seeking support from a professional organizer or a trusted friend or family member. They can provide guidance, accountability, and assistance in creating an organized environment. Additionally, joining support groups or online communities for individuals with ADHD can provide valuable tips and insights from others who have faced similar challenges. 3.1.9 Maintaining consistency. Once you have organized your space, it's important to maintain consistency. Regularly declutter, clean, and reorganize your space to prevent it from becoming chaotic again. Make organizing a part of your routine and set aside time each week to tidy up and reassess your organization systems. By consistently maintaining an organized space, you can better manage your ADHD symptoms and create a more productive and peaceful environment. In conclusion, organizing your space is an essential aspect of managing ADHD. By decluttering, creating storage solutions, designating workspaces, establishing a daily routine, managing paperwork, simplifying your space, utilizing technology, seeking support, and maintaining consistency, you can create an environment that supports focus, productivity, and overall well-being. Experiment with different strategies and find what works best for you. Remember, organizing your space is not a one-time task but an ongoing process that requires commitment and effort. 3.2 Establishing routines and schedules. Establishing routines and schedules is an essential aspect of managing ADHD. Individuals with ADHD often struggle with time management, organization, and maintaining focus. By implementing consistent routines and schedules, individuals with ADHD can create a structured environment that promotes productivity, reduces stress, and improves overall functioning. 3.2.1 The importance of routines. Routines provide a sense of predictability and stability, which is particularly beneficial for individuals with ADHD. They help to establish a framework for daily activities and tasks, making it easier to prioritize and manage time effectively. Routines also reduce decision-making fatigue by eliminating the need to constantly make choices about what to do next. For individuals with ADHD, routines can be especially helpful in managing impulsivity and hyperactivity. By following a set schedule, individuals can channel their energy into productive activities and reduce the likelihood of engaging in impulsive behaviors. Routines also provide a sense of security and control, which can help to alleviate anxiety and improve overall well-being. 3.2.2 Creating a daily schedule. Creating a daily schedule is a practical way to establish routines and manage time effectively. Start by identifying the key activities and tasks that need to be accomplished each day. This may include work or school commitments, household chores, exercise, and leisure activities. When creating a schedule, it is important to consider individual preferences and energy levels. Some individuals with ADHD may find it helpful to tackle more challenging tasks during their peak energy times, while others may prefer to start with easier tasks to build momentum. Experiment with different approaches to find what works best for you. Break down larger tasks into smaller, more manageable steps. This can help to prevent feeling overwhelmed and increase the likelihood of completing tasks successfully. Set realistic timeframes for each activity, allowing for breaks and transitions between tasks. Be flexible and open to adjusting the schedule as needed. 3.2.3 Establishing morning and evening routines. Morning and evening routines are particularly important for individuals with ADHD, as they help to set the tone for the day and promote a restful night's sleep. A consistent morning routine can help to jumpstart the day and improve focus and productivity. Similarly, an evening routine can signal to the brain that it is time to wind down and prepare for sleep. In the morning, establish a routine that includes activities such as waking up at the same time each day, engaging in physical exercise, practicing mindfulness or meditation, and having a nutritious breakfast. These activities can help to increase alertness, reduce impulsivity, and improve overall mood and well-being. In the evening, create a routine that promotes relaxation and prepares the mind and body for sleep. This may include activities such as turning off electronic devices at least an hour before bedtime, engaging in a calming activity such as reading or taking a warm bath, and practicing relaxation techniques such as deep breathing or progressive muscle relaxation. 3.2.4 Using visual supports. Visual supports can be highly beneficial for individuals with ADHD in establishing and maintaining routines and schedules. Visual aids such as calendars, to-do lists, and timers can help to provide a visual representation of time and tasks, making it easier to stay organized and on track. Use a calendar or planner to record important dates, deadlines, and appointments. Color coding or highlighting can be helpful in distinguishing between different types of activities or tasks. Break down larger tasks into smaller steps and create a checklist to track progress. Timers can be used to allocate specific amounts of time for different activities or tasks. Set a timer for focused work periods, followed by short breaks to prevent burnout and maintain motivation. Timers can also be used to establish a consistent bedtime routine, signaling when it is time to start winding down and preparing for sleep. 3.2.5 Anticipating and managing transitions. Transitions can be challenging for individuals with ADHD, as they often struggle with shifting attention and adapting to new situations. However, with proper planning and preparation, transitions can be made smoother and less stressful. Anticipate upcoming transitions and provide clear and concise instructions or reminders. Use visual supports such as timers or countdowns to signal when a transition is approaching. Allow for extra time during transitions to account for potential difficulties or delays. Establishing routines and schedules can also help to minimize the impact of transitions. When daily activities and tasks follow a predictable pattern, transitions become more familiar and easier to navigate. By incorporating transition strategies into daily routines, individuals with ADHD can develop effective coping mechanisms and reduce anxiety associated with change. 3.2.6 Seeking support. Establishing and maintaining routines and schedules can be challenging, especially for individuals with ADHD. It is important to seek support from family, friends, or professionals who can provide guidance and encouragement. Consider working with a therapist or coach who specializes in ADHD to develop strategies and techniques for managing routines and schedules. They can provide personalized support and help to identify and address any barriers or challenges that may arise. Additionally, involving family members or roommates in the process can create a supportive and collaborative environment. Communicate your needs and preferences to those around you, and work together to establish routines and schedules that benefit everyone. Remember, establishing routines and schedules is a process that requires patience and flexibility. It may take time to find what works best for you, and adjustments may need to be made along the way. Stay committed to the process and celebrate small victories along the journey to managing ADHD effectively. 3.3 Minimizing distractions. One of the key challenges for individuals with ADHD is managing distractions. With their tendency to have difficulty focusing and maintaining attention, distractions can significantly impact their ability to stay on task and complete activities. However, there are several strategies that can be implemented to minimize distractions and create a more ADHD-friendly environment. In this section, we will explore these strategies in detail. 3.3.1 Creating a distraction-free space. Creating a distraction-free space is essential for individuals with ADHD to optimize their focus and productivity. Here are some tips to help you create such an environment. Designate a specific workspace. Designate a specific area in your home or office as your workspace. This area should be free from distractions such as televisions, loud noises, and excessive clutter. Organize your workspace. Keep your workspace clean and organized. Remove any unnecessary items that may divert your attention. Use storage solutions such as bins, shelves, and drawers to keep your materials and supplies neatly organized. Minimize visual distractions. Reduce visual distractions by keeping your workspace free from unnecessary decorations or objects that may catch your eye. Use neutral colors and simple designs to create a calm and focused environment. Control noise levels. Noise can be a major distraction for individuals with ADHD. Consider using noise-canceling headphones or playing soft background music to mask distracting noises. If possible, choose a quiet location for your workspace or use soundproofing materials to reduce external noise. 3.3.2 Managing digital distractions. In today's digital age, managing digital distractions is crucial for individuals with ADHD. Here are some strategies to help you minimize digital distractions. Turn off notifications. Disable unnecessary notifications on your electronic devices, including smartphones, tablets, and computers. These notifications can interrupt your focus and divert your attention away from the task at hand. Use website blockers. Install website blocking apps or browser extensions that allow you to block access to distracting websites or social media platforms during designated work or study periods. This can help you stay focused and avoid the temptation to constantly check your social media feeds. Create a digital detox routine. Set aside specific times during the day when you disconnect from digital devices completely. Use this time to engage in activities that promote relaxation and focus, such as reading a book, going for a walk, or practicing mindfulness. Organize digital files. Keep your digital files organized and easily accessible. Create folders and subfolders to categorize your documents, photos, and other digital materials. This will help you locate files quickly and avoid wasting time searching for them. 3.3.3 Establishing boundaries with others. In addition to managing physical and digital distractions, it is important to establish boundaries with others to minimize interruptions and maintain focus. Here are some strategies to help you establish these boundaries. Communicate your needs. Clearly communicate your needs for a distraction-free environment to those around you, such as family members, roommates, or colleagues. Let them know when you need uninterrupted time to work or study and ask for their support in minimizing distractions during those periods. Use visual cues. Use visual cues, such as a "do not disturb" sign or a closed door, to indicate when you need privacy and should not be interrupted. This can help others understand and respect your boundaries. Schedule dedicated focus time. Set aside specific blocks of time each day for focused work or study. During these periods, inform others that you should not be disturbed unless it is an emergency. This will help you establish a routine and create a predictable environment for yourself. Seek alternative workspaces. If your home or office environment is consistently distracting, consider seeking alternative workspaces such as libraries, coffee shops, or co-working spaces. These environments are often designed to minimize distractions and provide a more conducive setting for focused work. By implementing these strategies, you can create an environment that is conducive to managing distractions and optimizing your focus and productivity. Remember, minimizing distractions is an ongoing process, and it may take time to find the strategies that work best for you. Stay patient and persistent, and don't hesitate to adjust your approach as needed. 3.4 Setting realistic goals. Setting realistic goals is an essential aspect of managing ADHD. People with ADHD often struggle with impulsivity, distractibility, and difficulty with time management, which can make it challenging to achieve their goals. However, by implementing effective strategies and making adjustments to their approach, individuals with ADHD can set realistic goals and increase their chances of success. 3.4.1 Understanding the importance of realistic goals. Setting realistic goals is crucial for individuals with ADHD because it helps them stay focused, motivated, and organized. When goals are unrealistic or too ambitious, it can lead to frustration, disappointment, and a sense of failure. This can further exacerbate ADHD symptoms and make it even more challenging to stay on track. By setting realistic goals, individuals with ADHD can experience a sense of accomplishment and build their self-confidence. Realistic goals are attainable, measurable, and aligned with their abilities and resources. They provide a clear roadmap for progress and allow individuals to break down larger tasks into smaller, manageable steps. 3.4.2 Identifying personal strengths and limitations. Before setting goals, it is essential to identify personal strengths and limitations. Individuals with ADHD often have unique strengths, such as creativity, problem-solving skills, and the ability to think outside the box. By recognizing and leveraging these strengths, individuals can set goals that align with their natural abilities and interests. At the same time, it is crucial to acknowledge limitations and challenges associated with ADHD. These may include difficulties with organization, time management, and sustaining focus. By understanding these limitations, individuals can develop strategies to overcome them and set goals that take these challenges into account. 3.4.3 Smart Goals. One effective approach to setting realistic goals is to use the SMART framework. SMART stands for specific, measurable, achievable, relevant, and time-bound. This framework provides a structured method for setting goals that are clear, actionable, and attainable. Specific. Goals should be specific and well-defined. Instead of setting a vague goal like, improve my grades, a specific goal would be, increase my math grade by 1 letter grade by the end of the semester. Measurable. Goals should be measurable so that progress can be tracked. This allows individuals to stay motivated and make adjustments if necessary. For example, instead of setting a goal to exercise more, a measurable goal would be, exercise for 30 minutes, 3 times a week. Achievable. Goals should be realistic and attainable. It is important to consider personal abilities, resources, and time constraints when setting goals. Setting goals that are too challenging or unrealistic can lead to frustration and discouragement. Relevant. Goals should be relevant and aligned with personal values, interests, and long-term objectives. When goals are meaningful and relevant, individuals are more likely to stay motivated and committed to achieving them. Time-bound. Goals should have a specific timeframe for completion. This helps individuals stay focused and accountable. Setting deadlines and milestones can provide a sense of urgency and structure to the goal-setting process. 3.4.4 Breaking down goals into smaller steps. For individuals with ADHD, breaking down goals into smaller, manageable steps is crucial. Large, complex goals can feel overwhelming and lead to procrastination or avoidance. By breaking goals into smaller tasks, individuals can focus on one step at a time, making progress more achievable and less daunting. Breaking down goals into smaller steps also allows for better planning and organization. Each step can be assigned a specific timeframe and prioritized accordingly. This approach helps individuals with ADHD stay on track, manage their time effectively, and maintain motivation throughout the goal-setting process. 3.4.5 Flexibility and adjustments. Flexibility and the ability to make adjustments are essential when setting realistic goals. Individuals with ADHD may encounter unexpected challenges or setbacks along the way. It is important to be adaptable and willing to modify goals or strategies as needed. If a goal becomes too challenging or unrealistic, it may be necessary to reassess and make adjustments. This could involve revising the timeframe, breaking the goal into smaller steps, or seeking additional support or resources. Being flexible and open to adjustments increases the likelihood of success and reduces feelings of frustration or failure. 3.4.6 Celebrating progress and achievements. Celebrating progress and achievements is an important part of the goal-setting process. Recognizing and acknowledging small victories along the way can boost motivation and self-confidence. It is essential to celebrate both the completion of goals and the progress made towards larger, long-term objectives. Celebrations can take various forms, such as treating oneself to a favorite activity, sharing achievements with friends or family, or simply taking a moment to reflect and appreciate the hard work and effort put into reaching the goal. By celebrating progress, individuals with ADHD can stay motivated and maintain a positive mindset throughout their journey. In conclusion, setting realistic goals is a vital component of managing ADHD. By understanding the importance of realistic goals, identifying personal strengths and limitations, using the SMART framework, breaking goals into smaller steps, being flexible, and celebrating progress, individuals with ADHD can increase their chances of success and thrive in various aspects of their lives. 3.5 Building supportive relationships. Living with ADHD can be challenging, but having a strong support system can make a significant difference in managing the condition. Building supportive relationships is crucial for individuals with ADHD as it provides understanding, encouragement, and assistance in navigating the daily struggles associated with the disorder. In this section, we will explore the importance of supportive relationships and provide strategies for fostering and maintaining them. 3.5.1 The importance of supportive relationships. Supportive relationships play a vital role in the lives of individuals with ADHD. They provide emotional support, practical assistance, and a sense of belonging. Here are some reasons why building supportive relationships is essential. Understanding and acceptance. One of the most significant benefits of supportive relationships is the understanding and acceptance they offer. Friends, family members, and partners who are knowledgeable about ADHD can empathize with the challenges faced by individuals with the condition. They can provide a safe space to express frustrations, fears, and concerns without judgment. Emotional support. Living with ADHD can be emotionally taxing. Supportive relationships provide a source of emotional support, helping individuals cope with the ups and downs of managing their symptoms. Having someone to talk to, share experiences with, and lean on during difficult times can make a significant difference in one's overall well-being. Practical assistance. Supportive relationships can also offer practical assistance in managing ADHD. Friends and family members can help with organizing tasks, creating routines, and minimizing distractions. They can provide reminders, offer assistance with time management, and help individuals stay on track with their goals. Accountability and motivation. Having supportive relationships can provide individuals with ADHD with a sense of accountability and motivation. Friends and family members can help keep them accountable for their actions, encourage them to stay focused, and celebrate their achievements. This support can be instrumental in maintaining consistency and progress in managing ADHD symptoms. 3.5.2 Strategies for building supportive relationships. Building and maintaining supportive relationships requires effort and communication from both parties involved. Here are some strategies to help foster and strengthen supportive relationships. Education and awareness. Educate your loved ones about ADHD to help them understand the condition better. Provide them with resources, books, or articles that explain the symptoms, challenges, and strategies for managing ADHD. This knowledge will enable them to offer more informed support and be more understanding of your experiences. Open and honest communication. Communication is key in any relationship, especially when it comes to ADHD. Be open and honest about your experiences, challenges, and needs. Clearly express how ADHD affects you and what kind of support you require. Encourage your loved ones to ask questions and engage in conversations about ADHD to foster understanding and empathy. Set realistic expectations. ADHD can sometimes make it challenging to meet certain expectations. It is essential to set realistic expectations with your loved ones and communicate your limitations. Help them understand that ADHD is a neurodevelopmental disorder that affects various aspects of your life. By setting realistic expectations, you can avoid unnecessary frustration and disappointment. Active listening and empathy. Supportive relationships thrive on active listening and empathy. Practice active listening by giving your full attention to the person speaking and validating their feelings. Show empathy by trying to understand their perspective and offering support and encouragement. This reciprocal exchange of understanding and empathy strengthens the bond between individuals with ADHD and their loved ones. Seek support groups or therapy. Consider joining support groups or attending therapy sessions specifically designed for individuals with ADHD and their families. These platforms provide a safe and supportive environment to share experiences, learn coping strategies, and connect with others who understand the challenges of living with ADHD. Support groups and therapy can also help improve communication and problem-solving skills within relationships. Celebrate successes together. Celebrate both small and significant achievements together with your loved ones. Recognize and acknowledge the progress made in managing ADHD symptoms. Celebrating successes not only boosts self-esteem but also reinforces the importance of supportive relationships in the journey of living with ADHD. Conclusion. Building supportive relationships is crucial for individuals with ADHD. These relationships provide understanding, emotional support, practical assistance, and motivation. By implementing strategies such as education, open communication, setting realistic expectations, active listening, and seeking support, individuals with ADHD can foster and maintain strong relationships that contribute to their overall well-being and success in managing the condition. Remember, you are not alone in your journey, and having a support system can make all the difference. 3.6 Managing time effectively. Time management is a crucial skill for individuals with ADHD. The ability to effectively manage time can help reduce stress, improve productivity, and enhance overall well-being. However, individuals with ADHD often struggle with time management due to difficulties with organization, planning, and prioritization. In this section, we will explore strategies and techniques that can help individuals with ADHD manage their time more effectively. 3.6.1 Understanding time perception. One of the challenges individuals with ADHD face is a distorted perception of time. They may struggle to accurately estimate how long tasks will take or underestimate the time needed to complete them. This can lead to poor time management and a constant feeling of being rushed or running out of time. To improve time perception, it can be helpful to use visual aids such as timers, clocks, or countdown apps. These tools provide a tangible representation of time passing and can help individuals with ADHD stay on track and better understand the passage of time. Breaking tasks into smaller, more manageable chunks can also make it easier to estimate how long each part will take and allocate time accordingly. 3.6.2 Prioritizing tasks. Prioritization is a key aspect of effective time management. Individuals with ADHD often struggle with prioritizing tasks, leading to a sense of overwhelm and difficulty in getting started. To overcome this challenge, it can be helpful to use a system of categorizing tasks based on urgency and importance. One popular method is the Eisenhower matrix, which involves dividing tasks into 4 categories: urgent and important, important but not urgent, urgent but not important, and neither urgent nor important. By categorizing tasks in this way, individuals with ADHD can focus on the most critical and time-sensitive tasks first, ensuring that they are not constantly reacting to urgent but less important tasks. 3.6.3 Breaking tasks into manageable steps. Large tasks can be overwhelming for individuals with ADHD, leading to procrastination and difficulty in getting started. Breaking tasks into smaller, more manageable steps can make them feel less daunting and increase the likelihood of completion. To break tasks down effectively, it can be helpful to use a technique called chunking. Chunking involves dividing a task into smaller subtasks or actions that can be completed in a shorter amount of time. This not only makes the task more manageable but also provides a sense of accomplishment as each subtask is completed. 3.6.4 Using time blocking techniques. Time blocking is a technique that involves scheduling specific blocks of time for different activities or tasks. This method can be particularly beneficial for individuals with ADHD as it provides structure and helps to minimize distractions. To implement time blocking, start by identifying the most important tasks or activities that need to be completed. Assign specific time blocks to each task, ensuring that there is enough time allocated for each one. It is important to be realistic when estimating the time needed for each task and to allow for breaks and transitions between activities. During each time block, focus solely on the assigned task and avoid multitasking. This can help improve concentration and productivity. It is also essential to set boundaries and communicate with others about the importance of uninterrupted time during these blocks. 3.6.5 Utilizing reminders and alarms. Individuals with ADHD often struggle with forgetfulness and may have difficulty remembering important deadlines or appointments. Utilizing reminders and alarms can be an effective way to stay on track and manage time more effectively. Setting reminders on smartphones, using calendar apps, or utilizing sticky notes can help individuals with ADHD remember important tasks, deadlines, and appointments. It is important to set reminders in advance to allow enough time for preparation and planning. 3.6.6 Minimizing distractions. Distractions can significantly impact time management for individuals with ADHD. It is crucial to create an environment that minimizes distractions and promotes focus. Some strategies to minimize distractions include designating a specific workspace that is free from clutter and distractions, turning off notifications on electronic devices or using apps that block distracting websites or apps during designated work times, using noise-canceling headphones or playing background music to drown out external distractions, communicating with others about the need for uninterrupted time during specific periods. By minimizing distractions, individuals with ADHD can improve their ability to manage time effectively and stay focused on tasks. 3.6.7 Seeking support and accountability. Managing time effectively can be challenging, but seeking support and accountability can make a significant difference. Engaging with a coach, therapist, or support group can provide guidance, encouragement, and accountability in implementing time management strategies. Working with a coach or therapist who specializes in ADHD can help individuals develop personalized strategies and techniques tailored to their specific needs. Support groups can also provide a sense of community and a platform for sharing experiences and learning from others. 3.6.8 Practicing self-care. Taking care of oneself is essential for managing time effectively. When individuals with ADHD are well-rested, well-nourished, and engaged in activities they enjoy, they are better equipped to manage their time and stay focused. Practicing self-care involves getting enough sleep, eating a balanced diet, engaging in regular physical exercise, and participating in activities that bring joy and relaxation. Taking breaks and allowing time for leisure activities can help prevent burnout and improve overall productivity. 3.6.9 Reviewing and adjusting strategies. Time management strategies may need to be reviewed and adjusted periodically to ensure their effectiveness. It is important to reflect on what is working well and what needs improvement. Regularly reviewing and adjusting strategies can help individuals with ADHD identify any challenges or areas where they may be falling behind. By making necessary adjustments, individuals can continue to refine their time management skills and improve their overall productivity and well-being. In conclusion, managing time effectively is a crucial skill for individuals with ADHD. By understanding time perception, prioritizing tasks, breaking tasks into manageable steps, utilizing time blocking techniques, using reminders and alarms, minimizing distractions, seeking support and accountability, practicing self-care, and regularly reviewing and adjusting strategies, individuals with ADHD can improve their time management skills and enhance their overall quality of life. 4. Improving focus and attention. 4.1 Enhancing concentration. One of the core challenges faced by individuals with ADHD is difficulty in maintaining focus and concentration. This can significantly impact their ability to complete tasks, stay organized, and achieve their goals. However, there are various strategies and techniques that can be employed to enhance concentration and improve overall productivity. In this section, we will explore some effective methods to help individuals with ADHD manage and enhance their concentration skills. 4.1.1 Creating a distraction-free environment. Creating a distraction-free environment is crucial for individuals with ADHD to optimize their concentration. Minimizing external distractions can significantly improve focus and attention. Here are some tips to create an ADHD-friendly environment. Designate a quiet workspace. Set up a dedicated workspace that is free from distractions such as noise, clutter, and visual stimuli. This can be a separate room or a specific area in your home where you can focus solely on your tasks. Remove digital distractions. Turn off notifications on your electronic devices, such as smartphones and tablets, to minimize interruptions. Consider using apps or browser extensions that block distracting websites or limit your access to social media during designated work periods. Use noise-canceling headphones. If you are sensitive to noise, consider using noise-canceling headphones to block out external sounds and create a more focused environment. Organize your workspace. Keep your workspace clean and organized. Use storage solutions, such as bins or folders, to keep your materials and supplies neatly arranged. A clutter-free environment can help reduce visual distractions and promote better concentration. 4.1.2 Implementing time management techniques. Effective time management is essential for individuals with ADHD to stay on track and complete tasks efficiently. By implementing specific techniques, you can enhance your ability to manage time effectively and improve concentration. Here are some strategies to consider. Break tasks into smaller chunks. Large tasks can be overwhelming and lead to procrastination. Break them down into smaller, more manageable tasks. This approach allows you to focus on one task at a time, making it easier to maintain concentration and stay motivated. Use timers and reminders. Set timers or use reminder apps to help you stay on track and manage your time effectively. This can help you allocate specific time periods for different tasks and prevent you from getting too absorbed in a single activity. Prioritize tasks. Determine which tasks are most important and need to be completed first. By prioritizing your tasks, you can allocate your time and energy more efficiently, ensuring that you focus on the most critical activities. Create a schedule. Establish a daily or weekly schedule that includes specific time slots for different activities. Having a structured routine can help you stay organized and maintain focus throughout the day. 4.1.3 Practicing mindfulness and meditation. Mindfulness and meditation techniques can be powerful tools for improving concentration and reducing distractions. By training your mind to stay present and focused, you can enhance your ability to concentrate on tasks. Here are some mindfulness practices to consider. Deep breathing exercises. Take a few moments to focus on your breath. Inhale deeply through your nose, hold for a few seconds, and exhale slowly through your mouth. This simple practice can help calm your mind and increase your ability to concentrate. Body scan meditation. Sit or lie down in a comfortable position and bring your attention to different parts of your body, starting from your toes and moving up to your head. This practice helps you become more aware of your body and can improve your ability to stay present and focused. Guided visualization. Close your eyes and imagine yourself in a peaceful and serene environment. Visualize yourself successfully completing tasks and staying focused. This technique can help you create a positive mental image and enhance your concentration. 4.1.4 Engaging in regular physical exercise. Physical exercise has been shown to have numerous benefits for individuals with ADHD, including improved concentration and focus. Engaging in regular physical activity can help reduce restlessness, increase alertness, and enhance overall cognitive function. Here are some exercise recommendations. Aerobic exercises. Activities such as jogging, swimming, cycling, or dancing can increase blood flow to the brain and improve cognitive function. Aim for at least 30 minutes of moderate intensity aerobic exercise most days of the week. Yoga or Tai Chi. These mind-body practices combine physical movement with deep breathing and mindfulness. They can help improve focus, reduce stress, and enhance overall well-being. Outdoor activities. Spending time in nature has been shown to have a positive impact on attention and concentration. Take advantage of outdoor activities such as hiking, gardening, or simply taking a walk in a park. 4.1.5 Utilizing assistive technology. In today's digital age, there are numerous assistive technologies available that can help individuals with ADHD enhance their concentration and productivity. Here are some examples. Productivity apps. There are various apps available that can help individuals with ADHD stay organized, manage tasks, and set reminders. These apps can provide visual cues and notifications to help you stay on track. Focus apps and browser extensions. Some apps and browser extensions are specifically designed to minimize distractions and improve focus. They can block access to distracting websites or limit your time spent on certain applications. Digital calendars and planners. Utilize digital calendars and planners to keep track of your schedule, deadlines, and important events. Set reminders and notifications to ensure you stay on top of your tasks. By implementing these strategies and techniques, individuals with ADHD can enhance their concentration skills and improve their overall productivity. Remember that finding the right combination of strategies may require some trial and error, so be patient and persistent in your efforts. With practice and consistency, you can develop effective concentration habits and thrive with ADHD. 4.2 Improving working memory. Working memory is a crucial cognitive function that allows us to temporarily hold and manipulate information in our minds. It plays a vital role in various daily activities, such as following instructions, problem solving, decision making, and learning. However, individuals with ADHD often struggle with working memory deficits, which can significantly impact their ability to focus, organize thoughts, and complete tasks efficiently. The good news is that there are strategies and techniques that can help improve working memory in individuals with ADHD. 4.2.1 Understanding working memory. Before diving into strategies to improve working memory, it's essential to understand what working memory is and how it functions. Working memory is a cognitive system responsible for temporarily storing and manipulating information in our minds. It involves three main components: the phonological loop, the visual spatial sketchpad, and the central executive. The phonological loop is responsible for processing and storing verbal information, such as words or numbers. The visual spatial sketchpad, on the other hand, deals with visual and spatial information, such as images or locations. The central executive acts as the control center, coordinating and managing the information processed by the phonological loop and visual spatial sketchpad. Individuals with ADHD often struggle with working memory deficits, which can manifest as forgetfulness, difficulty following instructions, and trouble staying focused on tasks that require holding and manipulating information in their minds. These challenges can have a significant impact on academic performance, work productivity, and daily functioning. 4.2.2 Strategies to improve working memory. While working memory deficits may pose challenges for individuals with ADHD, there are several strategies and techniques that can help improve working memory skills. By incorporating these strategies into daily routines and activities, individuals with ADHD can enhance their ability to focus, retain information, and complete tasks more effectively. Here are some strategies to consider. 4.2.2.1 Chunking information. One effective strategy to improve working memory is to chunk information into smaller, more manageable pieces. Instead of trying to remember a long list of items or instructions, break them down into smaller groups or categories. For example, if you need to remember a grocery list, group similar items together, such as fruits, vegetables, dairy products, and so on. By organizing information into meaningful chunks, you can reduce the cognitive load on your working memory and make it easier to remember and process. 4.2.2.2 Using mnemonic devices. Mnemonic devices are memory aids that help individuals remember information by associating it with something more memorable or familiar. For example, you can use acronyms, rhymes, or visual imagery to encode and retrieve information more effectively. Mnemonic devices can be particularly helpful when trying to remember lists, sequences, or complex information. By creating a vivid mental image or a catchy phrase, you can enhance your working memory's ability to retain and recall information. 4.2.2.3 Practicing mindfulness and meditation. Mindfulness and meditation practices can also help improve working memory in individuals with ADHD. These practices involve focusing attention on the present moment and cultivating a non-judgmental awareness of thoughts and sensations. By training your mind to stay present and focused, you can enhance your working memory's ability to retain and manipulate information. Regular mindfulness and meditation practice can also help reduce distractibility and improve overall cognitive functioning. 4.2.2.4 Engaging in brain-boosting activities. Engaging in activities that challenge and stimulate the brain can also improve working memory skills. Activities such as puzzles, crosswords, Sudoku, and memory games can help exercise and strengthen the working memory. These activities require concentration, attention to detail, and the ability to hold and manipulate information in your mind. By regularly engaging in brain-boosting activities, you can enhance your working memory's capacity and improve your cognitive abilities. 4.2.2.5 Using external memory aids. In addition to internal strategies, utilizing external memory aids can also be beneficial for individuals with ADHD. These aids can include physical tools such as calendars, planners, to-do lists, and reminder apps on smartphones or computers. By offloading information from your working memory onto external tools, you can free up cognitive resources and reduce the risk of forgetting important tasks or appointments. Consistently using external memory aids can help you stay organized, manage your time effectively, and improve overall productivity. 4.2.3 Consistency and practice. Improving working memory skills takes time, consistency, and practice. It's important to incorporate these strategies into your daily routines and activities consistently. By making them a habit, you can gradually strengthen your working memory and experience improvements in your ability to focus, retain information, and complete tasks efficiently. Remember that everyone's working memory capacity is different, and progress may vary from person to person. Be patient with yourself and celebrate small victories along the way. With dedication and perseverance, you can improve your working memory skills and thrive with ADHD. 4.3 Developing attention strategies. Developing effective attention strategies is crucial for individuals with ADHD to improve their focus and concentration. Attention difficulties are a common symptom of ADHD, and they can significantly impact daily life, including academic and professional performance, as well as personal relationships. Fortunately, there are various strategies and techniques that can help individuals with ADHD enhance their attention skills and overcome challenges. In this section, we will explore some effective attention strategies that can be implemented to manage ADHD symptoms and improve overall functioning. 4.3.1 Mindfulness and meditation. Mindfulness and meditation practices have gained significant attention in recent years for their ability to improve attention and focus. These techniques involve training the mind to stay present and focused on the present moment, rather than getting caught up in distractions or racing thoughts. For individuals with ADHD, practicing mindfulness and meditation can be particularly beneficial in developing attention strategies. By engaging in regular mindfulness exercises, such as deep breathing, body scans, or guided meditation, individuals with ADHD can learn to redirect their attention back to the present moment when their mind starts to wander. These practices help cultivate awareness of the mind's tendency to drift and provide tools to bring the focus back to the task at hand. Over time, individuals with ADHD can develop greater control over their attention and reduce impulsivity. 4.3.2 Chunking and task breakdown. Breaking down tasks into smaller, more manageable chunks is an effective attention strategy for individuals with ADHD. Large tasks can often feel overwhelming and lead to procrastination or difficulty sustaining attention. By breaking tasks into smaller steps, individuals with ADHD can focus on one component at a time, making it easier to maintain attention and complete the task. To implement this strategy, individuals can start by identifying the main goal or objective of the task. Then, they can break it down into smaller subtasks or steps. By focusing on completing each step before moving on to the next, individuals can maintain their attention and feel a sense of accomplishment as they progress through the task. Additionally, using visual aids, such as checklists or task boards, can help individuals with ADHD stay organized and track their progress. 4.3.3 Environmental modifications. Creating an environment that supports attention and minimizes distractions is essential for individuals with ADHD. Simple modifications to the physical environment can significantly improve focus and concentration. Here are some strategies to consider. Designated workspace. Having a dedicated workspace that is free from distractions can help individuals with ADHD maintain their attention. This space should be organized, clutter-free, and equipped with the necessary materials for the task at hand. Noise reduction. Noise can be a significant distraction for individuals with ADHD. Using noise-canceling headphones or playing soft background music can help drown out external noises and create a more focused environment. Visual cues. Visual cues, such as color-coded folders, labels, or reminders, can help individuals with ADHD stay organized and remember important tasks or deadlines. These cues serve as visual prompts and can assist in redirecting attention back to the task. Time management tools. Utilizing timers, alarms, or smartphone apps can help individuals with ADHD manage their time effectively and stay on track. These tools can be used to set specific time intervals for focused work and breaks, ensuring a balance between sustained attention and rest. 4.3.4 Active Listening Techniques. Improving listening skills is crucial for individuals with ADHD, as it directly impacts their ability to sustain attention during conversations or lectures. Active listening techniques can help individuals with ADHD stay engaged and focused on the speaker. Here are some strategies to enhance active listening. Maintain eye contact. Making eye contact with the speaker can help individuals with ADHD stay focused and actively participate in the conversation. It signals to the speaker that they are engaged and encourages them to continue. Ask questions. Asking questions during a conversation or lecture can help individuals with ADHD stay actively involved and maintain their attention. It demonstrates their interest and encourages further engagement. Take notes. Taking notes can be a helpful strategy for individuals with ADHD to stay focused and retain information. It provides a visual and kinesthetic element to the learning process, reinforcing attention and comprehension. Paraphrase and summarize. Paraphrasing or summarizing the speaker's main points can help individuals with ADHD consolidate information and ensure understanding. It also serves as a mental checkpoint to maintain attention and actively process the information. 4.3.5 Physical Activity and Exercise. Engaging in regular physical activity and exercise has been shown to improve attention and focus in individuals with ADHD. Exercise releases endorphins, which can enhance mood and cognitive function. Additionally, physical activity increases blood flow to the brain, promoting optimal brain function and attention. Individuals with ADHD can incorporate physical activity into their daily routine by participating in activities they enjoy, such as walking, jogging, swimming, or dancing. Engaging in exercise before engaging in tasks that require sustained attention can help individuals with ADHD prime their brain for optimal focus and concentration. 4.3.6 Utilizing Assistive Technology. In today's digital age, there are numerous assistive technologies available that can aid individuals with ADHD in improving their attention and focus. These technologies can provide visual and auditory cues, reminders, and organization tools to support attention strategies. Some examples of assistive technology for ADHD include digital calendars and reminders. Utilizing digital calendars and reminder apps can help individuals with ADHD stay organized and manage their time effectively. These tools can send notifications and reminders for important tasks, appointments, or deadlines. Focus apps and website blockers. There are various apps and browser extensions available that can block distracting websites or limit access to social media during designated work periods. These tools can help individuals with ADHD stay focused and minimize digital distractions. Note-taking apps. Using note-taking apps on smartphones or tablets can help individuals with ADHD capture and organize information more efficiently. These apps often provide features such as voice recording, searchable notes, and synchronization across devices. Task management apps. Task management apps can assist individuals with ADHD in breaking down tasks, setting reminders, and tracking progress. These apps often provide visual cues and checklists to support attention and organization. By incorporating these attention strategies into their daily lives, individuals with ADHD can develop effective techniques to manage their symptoms and improve their overall attention and focus. It is important to remember that everyone's experience with ADHD is unique, and finding the strategies that work best for each individual may require some trial and error. 4.4 Using technology to aid focus. In today's digital age, technology has become an integral part of our lives. From smartphones to tablets, there are countless devices and applications that can help individuals with ADHD manage their symptoms and improve their focus. In this section, we will explore various ways in which technology can be used as a tool to aid focus and enhance productivity for individuals with ADHD. 4.4.1 Digital calendars and task managers. One of the key challenges for individuals with ADHD is managing time effectively and staying organized. Digital calendars and task managers can be invaluable tools in helping individuals with ADHD stay on top of their schedules and responsibilities. These tools allow users to create and manage tasks, set reminders, and prioritize their activities. By utilizing these digital tools, individuals with ADHD can better manage their time, reduce forgetfulness, and stay focused on their goals. 4.4.2 Focus and Productivity Apps. There are numerous apps available that are specifically designed to help individuals with ADHD improve their focus and productivity. These apps often utilize techniques such as time management, goal setting, and task prioritization to help users stay on track. Some apps even incorporate features like timers, reminders, and progress tracking to keep individuals motivated and engaged. By using these apps, individuals with ADHD can break tasks into manageable chunks, set deadlines, and track their progress, ultimately improving their ability to stay focused and complete tasks. 4.4.3 Distraction blockers and website app limiters. One of the biggest challenges for individuals with ADHD is managing distractions, especially in the digital world. Distraction blockers and website app limiters can be incredibly helpful in reducing the temptation to engage in non-productive activities. These tools allow users to block or limit access to certain websites or applications during specific times or for a set duration. By setting boundaries and reducing distractions, individuals with ADHD can create a more focused and productive work environment. 4.4.4 Mindfulness and meditation apps. Mindfulness and meditation have been shown to have numerous benefits for individuals with ADHD, including improved focus, reduced stress, and increased self-awareness. Technology can be a valuable tool in incorporating mindfulness and meditation practices into daily routines. There are various apps available that offer guided meditation sessions, breathing exercises, and relaxation techniques. By using these apps, individuals with ADHD can develop a regular mindfulness practice, which can help calm the mind, improve attention, and enhance overall well-being. 4.4.5 Assistive technology for reading and writing. Many individuals with ADHD struggle with reading and writing tasks due to difficulties with attention and focus. Assistive technology can provide valuable support in these areas. Text-to-speech software can read aloud written content, making it easier for individuals with ADHD to comprehend and retain information. Speech-to-text software allows individuals to dictate their thoughts and ideas, reducing the cognitive load associated with writing. These tools can significantly enhance reading and writing abilities, making academic and professional tasks more manageable for individuals with ADHD. 4.4.6 White noise and ambient sound apps. For some individuals with ADHD, background noise can be highly distracting, making it difficult to concentrate on tasks. White noise and ambient sound apps can help create a more conducive work environment by masking distracting noises and promoting focus. These apps offer a variety of sounds, such as rain, waves, or gentle music, that can help individuals with ADHD tune out external distractions and maintain their attention on the task at hand. 4.4.7 Wearable devices for focus and mindfulness. Advancements in wearable technology have opened up new possibilities for individuals with ADHD. Wearable devices, such as smartwatches or fitness trackers, can provide real-time feedback on focus, stress levels, and physical activity. These devices often come with built-in features like guided breathing exercises or reminders to take breaks, which can help individuals with ADHD stay on track and manage their symptoms throughout the day. By utilizing wearable devices, individuals with ADHD can gain insights into their behavior patterns and make informed decisions to improve their focus and overall well-being. In conclusion, technology can be a powerful ally for individuals with ADHD in managing their symptoms and improving their focus. From digital calendars and task managers to distraction blockers and mindfulness apps, there are numerous tools available to aid individuals with ADHD in their daily lives. By leveraging the benefits of technology, individuals with ADHD can enhance their productivity, reduce distractions, and ultimately thrive in both academic and professional settings. 5. Boosting executive functioning. 5.1 Planning and organization skills. One of the key challenges faced by individuals with ADHD is difficulty in planning and organizing tasks. This can lead to a sense of overwhelm, missed deadlines, and a general feeling of being disorganized. However, with the right strategies and techniques, it is possible to improve planning and organization skills and effectively manage ADHD symptoms. In this section, we will explore various strategies that can help individuals with ADHD become more organized and better equipped to handle their daily tasks and responsibilities. 5.1.1 Creating a daily planner. A daily planner is an essential tool for individuals with ADHD. It provides a visual representation of tasks and helps in prioritizing and organizing daily activities. When creating a daily planner, it is important to keep it simple and easy to use. Here are some tips for creating an effective daily planner. Use a physical planner or a digital tool. Choose a planner that suits your preferences. Some individuals find it helpful to have a physical planner that they can carry around and write in, while others prefer using digital tools such as smartphone apps or computer software. Break tasks into smaller steps. Breaking down tasks into smaller, manageable steps can make them less overwhelming. Write down each step in your planner to ensure that you stay on track. Prioritize tasks. Identify the most important tasks for the day and prioritize them accordingly. This will help you focus on what needs to be done first and avoid feeling overwhelmed by a long list of tasks. Set realistic goals. Be realistic about what you can accomplish in a day. Setting unrealistic goals can lead to frustration and disappointment. Start with a few achievable tasks and gradually increase the workload as you become more comfortable with your planning and organization skills. 5.1.2 Using visual cues and reminders. Visual cues and reminders can be powerful tools for individuals with ADHD to stay organized and on track. Here are some strategies to incorporate visual cues into your daily routine. Use color coding. Assign different colors to different tasks or categories to make them visually distinct. For example, you can use one color for work-related tasks, another for personal tasks, and so on. This can help you quickly identify and prioritize tasks. Use sticky notes. Place sticky notes in visible locations as reminders for important tasks or deadlines. You can stick them on your computer monitor, bathroom mirror, or any other place where you are likely to see them frequently. Create a visual schedule. A visual schedule provides a clear overview of your daily or weekly activities. Use a whiteboard or a poster board to create a visual representation of your schedule. Include important tasks, appointments, and deadlines, and update it regularly. Set alarms and timers. Use alarms and timers on your phone or other devices to remind you of important tasks or to keep track of time. Set reminders for appointments, deadlines, or even for taking breaks during work or study sessions. 5.1.3 Establishing a routine. Establishing a routine can greatly help individuals with ADHD in managing their time and staying organized. A routine provides structure and predictability, which can reduce stress and improve productivity. Here are some tips for establishing a routine. Set consistent wake up and bedtime. Try to wake up and go to bed at the same time every day. This helps regulate your sleep patterns and ensures that you start each day with a fresh mind. Plan regular meal times. Establish regular meal times and try to stick to them. This can help regulate your energy levels and prevent hunger-induced distractions. Schedule regular breaks. Breaks are important for individuals with ADHD to recharge and refocus. Schedule short breaks throughout the day to give yourself time to relax and rejuvenate. Allocate specific times for specific tasks. Assign specific time slots for different activities, such as work, study, exercise, and leisure. This helps create a sense of structure and ensures that you allocate enough time for each task. 5.1.4 Utilizing technology and apps. Technology can be a valuable tool for individuals with ADHD to improve planning and organization skills. There are numerous apps and software available that can help you stay organized and manage your tasks effectively. Here are some ways to utilize technology. Task management apps. Use task management apps to create to-do lists, set reminders, and track your progress. These apps often have features such as notifications, due dates, and priority settings to help you stay on top of your tasks. Calendar apps. Calendar apps can help you schedule and manage your appointments, deadlines, and events. Set reminders and sync your calendar across multiple devices to ensure that you never miss an important task or appointment. Note-taking apps. Note-taking apps can help you capture and organize your thoughts, ideas, and important information. Use these apps to jot down notes, create checklists, and store important documents. Time tracking apps. Time tracking apps can help you monitor how you spend your time and identify areas where you can improve your productivity. These apps often provide insights and analytics to help you better understand your time management habits. By implementing these planning and organization strategies, individuals with ADHD can improve their ability to manage tasks, reduce stress, and increase productivity. Remember that finding the right strategies that work for you may require some trial and error. Be patient with yourself and keep experimenting until you find the techniques that best suit your needs. 5.2 Time Management Techniques. Time management is a crucial skill for individuals with ADHD. The ability to effectively manage time can help reduce stress, improve productivity, and enhance overall well-being. People with ADHD often struggle with time management due to difficulties with organization, planning, and prioritization. However, with the right strategies and techniques, it is possible to develop effective time management skills and thrive in various aspects of life. 5.2.1 Creating a daily schedule. One of the most effective time management techniques for individuals with ADHD is creating a daily schedule. Having a structured routine can provide a sense of stability and help individuals stay on track. Here are some tips for creating a daily schedule. Set priorities. Start by identifying the most important tasks or activities that need to be accomplished each day. Prioritize these tasks based on their urgency and importance. Break tasks into smaller steps. Large tasks can be overwhelming and lead to procrastination. Break them down into smaller, more manageable steps. This not only makes the task seem less daunting but also allows for better planning and allocation of time. Allocate time slots. Assign specific time slots for each task or activity in your schedule. Be realistic about the time needed for each task and avoid overloading your schedule. Leave some buffer time between tasks to account for unexpected delays or interruptions. Use visual cues. Use visual cues such as color coding or highlighting to make your schedule more visually appealing and easier to follow. This can help individuals with ADHD stay organized and focused. Stick to the schedule. Once you have created your schedule, make a commitment to stick to it as much as possible. Consistency is key to developing good time management habits. 5.2.2 Prioritizing tasks. Prioritization is an essential skill for effective time management. It involves identifying the most important tasks and allocating time and resources accordingly. Here are some strategies to help prioritize tasks. Urgency and importance. Evaluate tasks based on their urgency and importance. Urgent tasks require immediate attention, while important tasks contribute to long-term goals or have significant consequences. Focus on tasks that are both urgent and important first. The Eisenhower Matrix. The Eisenhower Matrix is a popular tool for prioritization. It categorizes tasks into 4 quadrants: urgent and important, important but not urgent but important, and neither urgent nor important. Prioritize tasks in the first quadrant, delegate or schedule tasks in the second quadrant, minimize or eliminate tasks in the third quadrant, and avoid tasks in the fourth quadrant. Consider deadlines. Take into account any deadlines associated with tasks. Tasks with approaching deadlines should be given higher priority to ensure they are completed on time. Consider impact. Consider the impact of completing a task. Some tasks may have a greater impact on your goals or overall well-being than others. Prioritize tasks that align with your long-term objectives. 5.2.3 Breaking tasks into manageable chunks. Individuals with ADHD often struggle with starting and completing tasks due to difficulties with focus and attention. Breaking tasks into smaller, more manageable chunks can help overcome this challenge. Here's how to break tasks down effectively. Identify the main task. Start by identifying the main task or goal. This is the larger task that needs to be accomplished. Break it down. Break the main task into smaller, more manageable subtasks. Each subtask should be specific, actionable, and achievable within a reasonable time frame. Set milestones. Set milestones or checkpoints for each subtask. This provides a sense of progress and motivation as you complete each milestone. Focus on one subtask at a time. Instead of trying to tackle the entire task at once, focus on one subtask at a time. This helps prevent overwhelm and allows for better concentration and productivity. Celebrate progress. Celebrate your progress as you complete each subtask. This can be as simple as taking a short break, rewarding yourself, or acknowledging your achievements. 5.2.4 Minimizing distractions. Distractions can significantly impact time management for individuals with ADHD. Minimizing distractions is essential for maintaining focus and staying on track. Here are some strategies to minimize distractions. Create a distraction-free environment. Designate a specific workspace or area that is free from distractions. Remove or minimize potential distractions such as noise, clutter, or visual stimuli. Use time blocking techniques. Time blocking involves allocating specific time periods for focused work. During these periods, eliminate or minimize distractions by turning off notifications, closing unnecessary tabs or apps, and setting boundaries with others. Utilize technology. Use technology to your advantage by utilizing productivity apps or tools that can help minimize distractions. For example, there are apps available that block access to social media or websites during designated work periods. Practice mindfulness. Cultivate mindfulness to improve focus and attention. Mindfulness techniques, such as deep breathing or meditation, can help individuals with ADHD become more aware of distractions and better able to refocus their attention. Seek support. Communicate with family members, friends, or colleagues about your need for a distraction-free environment. Ask for their understanding and support in minimizing distractions during designated work or study periods. By implementing these time management techniques, individuals with ADHD can improve their ability to manage time effectively, reduce stress, and enhance productivity. It may take time and practice to develop these skills, but with persistence and consistency, individuals with ADHD can overcome time management challenges and thrive in various aspects of their lives. 5.3 Problem-solving strategies. Problem solving is an essential skill for individuals with ADHD. It helps them navigate through challenges, make decisions, and find effective solutions to everyday problems. By developing problem-solving strategies, individuals with ADHD can enhance their executive functioning skills and improve their overall quality of life. In this section, we will explore various techniques and approaches to problem solving that can be beneficial for individuals with ADHD. 5.3.1 Identify the problem. The first step in problem solving is to clearly identify the problem at hand. This involves recognizing the specific issue or challenge that needs to be addressed. It is important to break down the problem into smaller, more manageable parts to gain a better understanding of its nature. For individuals with ADHD, it can be helpful to write down the problem or create a visual representation to aid in the identification process. 5.3.2 Gather information. Once the problem has been identified, the next step is to gather relevant information. This involves collecting data, facts, and details that are necessary to understand the problem fully. It may require conducting research, seeking advice from experts, or consulting reliable sources of information. Gathering information helps individuals with ADHD gain a comprehensive understanding of the problem and enables them to make informed decisions. 5.3.3 Generate possible solutions. After gathering information, it is time to brainstorm and generate possible solutions. Encourage creativity and open-mindedness during this stage. Individuals with ADHD often have unique perspectives and can come up with innovative ideas. It can be helpful to write down all the potential solutions without evaluating them at this point. The goal is to generate as many options as possible. 5.3.4 Evaluate and select the best solution. Once a list of potential solutions has been generated, it is time to evaluate each option and select the best one. Consider the advantages and disadvantages of each solution, as well as the potential outcomes and consequences. It can be helpful to weigh the pros and cons of each solution and consider how well it aligns with personal values and goals. Individuals with ADHD may find it beneficial to seek input from trusted individuals or professionals during the evaluation process. 5.3.5 Create an action plan. Once the best solution has been selected, it is important to create an action plan. Break down the solution into smaller, manageable steps that can be easily followed. Set specific goals and deadlines for each step to ensure progress is made. Individuals with ADHD may find it helpful to use visual aids, such as charts or calendars, to keep track of their action plan. Breaking down the solution into smaller steps can make it feel less overwhelming and increase the likelihood of success. 5.3.6 Implement the solution. With the action plan in place, it is time to implement the chosen solution. Start by taking the first step and gradually work through each subsequent step. It is important to stay focused and motivated during this stage, as individuals with ADHD may face challenges related to impulsivity or distractibility. Utilize strategies such as setting reminders, creating routines, and seeking support from others to stay on track. 5.3.7 Monitor and evaluate progress. Throughout the implementation process, it is crucial to monitor and evaluate progress regularly. This involves assessing whether the chosen solution is effective and making adjustments if necessary. Individuals with ADHD may find it helpful to track their progress using a journal or a digital tool. Celebrate small victories along the way to maintain motivation and momentum. 5.3.8 Learn from mistakes. It is important to recognize that problem solving is a learning process, and mistakes are a natural part of it. If the chosen solution does not yield the desired results, it is essential to reflect on what went wrong and learn from the experience. Adjustments and modifications may be needed to improve future problem-solving endeavors. Embrace the opportunity to grow and develop new strategies based on lessons learned. 5.3.9 Seek support. Problem solving can be challenging, especially for individuals with ADHD. It is important to remember that seeking support is not a sign of weakness but a proactive step towards finding effective solutions. Reach out to trusted friends, family members, or professionals who can provide guidance and assistance. Support groups or therapy can also be valuable resources for individuals with ADHD, as they offer a safe space to share experiences and learn from others. 5.3.10 Practice persistence. Problem solving requires persistence and resilience. It is essential to stay committed to finding solutions, even when faced with setbacks or obstacles. Individuals with ADHD may encounter difficulties related to impulsivity, distractibility, or time management. By practicing persistence and maintaining a positive mindset, individuals can overcome challenges and achieve their desired outcomes. In conclusion, problem solving is a crucial skill for individuals with ADHD. By following a systematic approach and utilizing various strategies, individuals can effectively identify, evaluate, and implement solutions to everyday challenges. Remember to break down problems into smaller parts, gather relevant information, generate multiple solutions, evaluate options, create an action plan, implement the chosen solution, monitor progress, learn from mistakes, seek support, and practice persistence. With these problem-solving strategies, individuals with ADHD can enhance their executive functioning skills and thrive in various aspects of their lives. 5.4 Decision-making skills. Making decisions can be challenging for individuals with ADHD due to difficulties with impulsivity, inattention, and executive functioning. However, with the right strategies and techniques, it is possible to improve decision-making skills and make more informed choices. In this section, we will explore various approaches to enhance decision-making abilities for individuals with ADHD. 5.4.1 Understanding decision-making challenges. People with ADHD often struggle with decision-making due to several factors. These challenges can include 5.4.1.1 Impulsivity. Impulsivity can lead individuals with ADHD to make hasty decisions without considering the consequences. They may act on immediate desires or impulses without fully evaluating the situation. 5.4.1.2 Inattention. Inattention can make it difficult for individuals with ADHD to gather and process information necessary for making informed decisions. They may miss important details or fail to consider all available options. 5.4.1.3 Executive functioning deficits. Executive functioning deficits, such as poor planning and organization skills, can hinder the decision-making process. Difficulties in prioritizing, weighing pros and cons, and considering long-term consequences can make decisions more challenging. 5.4.2 Strategies for effective decision-making. To improve decision-making skills, individuals with ADHD can utilize various strategies and techniques. Here are some approaches that can be helpful. 5.4.2.1 Gather and evaluate information. Before making a decision, it is crucial to gather all relevant information. Take the time to research and explore different options. Consider the potential outcomes and consequences of each choice. Write down the pros and cons of each option to help evaluate them objectively. 5.4.2.2 Break down the decision. Complex decisions can be overwhelming for individuals with ADHD. Breaking down the decision into smaller, manageable steps can make the process more manageable. Create a step-by-step plan to guide you through the decision-making process. 5.4.2.3 Set clear goals. Having clear goals can provide a framework for decision-making. Define what you want to achieve and consider how each option aligns with your goals. This can help you prioritize and make decisions that are in line with your long-term objectives. 5.4.2.4 Seek input from others. Consulting with trusted friends, family members, or professionals can provide valuable perspectives and insights. Discussing your options with others can help you gain a different viewpoint and consider factors that you may have overlooked. 5.4.2.5 Consider consequences. Impulsivity can lead to decisions without considering the potential consequences. Take the time to think about the short-term and long-term effects of each choice. Consider how each decision may impact your life, relationships, and future goals. 5.4.2.6 Use visual aids. Visual aids, such as charts, diagrams, or mind maps, can help individuals with ADHD organize their thoughts and visually represent the decision-making process. These visual tools can make it easier to see the connections between different options and evaluate them more effectively. 5.4.2.7 Practice delayed gratification. Impulsivity can often lead to seeking immediate rewards or gratification. Practice delaying gratification by taking a step back and considering the long-term benefits of each option. This can help you make decisions that align with your overall goals and values. 5.4.2.8 Learn from past experiences. Reflecting on past decisions and their outcomes can provide valuable lessons for future decision-making. Consider what worked well and what didn't in previous situations. Use this knowledge to inform your current decision-making process. 5.4.3 Developing decision-making confidence. Building confidence in decision-making is essential for individuals with ADHD. Here are some strategies to develop confidence in your decision-making abilities. 5.4.3.1 Start with small decisions. Begin by making small decisions to practice and build confidence. Start with choices that have minimal consequences and gradually work your way up to more significant decisions. This incremental approach can help you gain confidence in your decision-making skills. 5.4.3.2 Reflect on successful decisions. Take the time to reflect on decisions that turned out well. Identify the factors that contributed to their success. Acknowledge your ability to make good choices and use these positive experiences to boost your confidence in future decision-making. 5.4.3.3 Embrace mistakes as learning opportunities. Mistakes are a natural part of the decision-making process. Instead of dwelling on failures, view them as learning opportunities. Analyze what went wrong, identify areas for improvement, and use this knowledge to make better decisions in the future. 5.4.3.4 Seek support and feedback. Seeking support from trusted individuals can provide valuable feedback and guidance. Share your decision-making process with someone you trust and ask for their input. This external perspective can help you gain confidence in your decision-making abilities. 5.4.3.5 Practice mindfulness. Practicing mindfulness can help individuals with ADHD become more aware of their thoughts, emotions, and impulses. By cultivating mindfulness, you can develop a greater sense of self-awareness, which can aid in making more deliberate and thoughtful decisions. 5.4.4 Decision-making and ADHD medication. For individuals with ADHD who are taking medication, it is important to consider the potential impact on decision-making. Some ADHD medications can affect cognitive processes, including decision-making abilities. It is essential to discuss any concerns or observations with your healthcare provider to ensure that your medication is optimized for your specific needs. 5.4.5 Seeking professional help. If decision-making difficulties significantly impact your daily life or if you find it challenging to implement the strategies mentioned above, it may be beneficial to seek professional help. A mental health professional experienced in working with individuals with ADHD can provide guidance, support, and additional strategies to improve decision-making skills. Remember, improving decision-making skills takes time and practice. By implementing these strategies and seeking support when needed, individuals with ADHD can enhance their ability to make informed choices and navigate life more effectively. 6. Managing emotional challenges. 6.1 Understanding emotional dysregulation. Emotional dysregulation is a common challenge for individuals with ADHD. It refers to difficulties in managing and controlling emotions, leading to intense and often unpredictable emotional responses. People with ADHD may experience heightened emotional sensitivity, mood swings, and difficulty in regulating their emotions. Understanding emotional dysregulation is crucial for effectively managing ADHD symptoms and improving overall well-being. 6.1.1 The impact of emotional dysregulation. Emotional dysregulation can have a significant impact on various aspects of life. It can affect relationships, academic performance, work productivity, and overall mental health. Individuals with ADHD may struggle with emotional regulation due to several factors, including impulsivity, difficulty in shifting attention, and challenges in executive functioning. 6.1.2 Common emotional challenges. Intense emotions. People with ADHD often experience emotions more intensely than others. They may feel overwhelmed by even minor setbacks or frustrations, leading to outbursts of anger or frustration. Mood swings. Emotional dysregulation can cause rapid and unpredictable shifts in mood. Individuals with ADHD may go from feeling happy and excited to sad or irritable within a short period. Rejection sensitivity. Many individuals with ADHD have a heightened sensitivity to rejection and criticism. They may interpret neutral or constructive feedback as personal attacks, leading to feelings of shame, anger, or sadness. Impulsivity. Impulsivity, a common symptom of ADHD, can contribute to impulsive emotional reactions. Individuals may act on their emotions without considering the consequences, leading to regret or conflict. Difficulty in emotional expression. Some individuals with ADHD may struggle to express their emotions effectively. They may have difficulty identifying and articulating their feelings, which can lead to frustration and misunderstandings in relationships. 6.1.3 Strategies for managing emotional dysregulation. While emotional dysregulation can be challenging, there are strategies that individuals with ADHD can use to better manage their emotions. These strategies can help promote emotional stability, improve relationships, and enhance overall well-being. Self-awareness. Developing self-awareness is crucial for managing emotional dysregulation. Take the time to identify and understand your emotional triggers and patterns. Pay attention to how your body feels when you experience intense emotions, and practice recognizing the early signs of emotional dysregulation. Emotion regulation techniques. Learn and practice specific techniques to regulate your emotions. Deep breathing exercises, mindfulness meditation, and progressive muscle relaxation can help calm the mind and body during moments of emotional intensity. Engaging in regular physical exercise can also help regulate emotions by releasing endorphins and reducing stress. Cognitive restructuring. Challenge negative thoughts and beliefs that contribute to emotional dysregulation. Practice reframing negative situations and focusing on more positive and realistic perspectives. Cognitive behavioral therapy, CBT, can be particularly helpful in identifying and modifying unhelpful thinking patterns. Social support. Seek support from trusted friends, family members, or support groups who can provide understanding and empathy. Talking about your emotions and experiences with others who have ADHD can help you feel less alone and provide valuable insights and coping strategies. Healthy lifestyle. Prioritize self-care activities that promote emotional well-being. Get enough sleep, eat a balanced diet, and engage in activities that bring you joy and relaxation. Avoid excessive caffeine and alcohol, as they can exacerbate emotional dysregulation. Seek professional help. If emotional dysregulation significantly impacts your daily life and relationships, consider seeking professional help. A mental health professional experienced in working with ADHD can provide guidance, support, and evidence-based interventions to help manage emotional dysregulation. 6.1.4 Patience and persistence. Managing emotional dysregulation is an ongoing process that requires patience and persistence. It is essential to remember that progress may be gradual, and setbacks are normal. Be kind to yourself and celebrate small victories along the way. With time and practice, you can develop effective strategies to manage emotional dysregulation and lead a more balanced and fulfilling life with ADHD. 6.2 Coping with rejection and criticism. Living with ADHD can present unique challenges, especially when it comes to dealing with rejection and criticism. Individuals with ADHD may often face judgment, misunderstanding, and negative feedback from others due to their symptoms and behaviors. This can lead to feelings of frustration, low self-esteem, and a sense of isolation. However, there are strategies and techniques that can help individuals with ADHD cope with rejection and criticism in a healthy and constructive way. 6.2.1 Understanding the impact of rejection and criticism. Rejection and criticism can have a significant impact on individuals with ADHD. Due to their difficulties with attention, impulsivity, and hyperactivity, they may be more prone to making mistakes or exhibiting behaviors that are perceived as disruptive or inappropriate. This can result in negative feedback from others, which can be particularly challenging for individuals with ADHD who may already struggle with self-esteem and self-confidence. It is important to recognize that rejection and criticism are not personal attacks, but rather a reflection of others' perceptions and understanding of ADHD. It is crucial to separate one's self-worth from the opinions and judgments of others. Understanding this can help individuals with ADHD develop resilience and cope more effectively with rejection and criticism. 6.2.2 Building self-awareness and self-reflection. Developing self-awareness is a key aspect of coping with rejection and criticism. By understanding one's strengths, weaknesses, and ADHD symptoms, individuals can better navigate challenging situations and respond to feedback in a constructive manner. Self-reflection allows individuals to evaluate their actions and behaviors objectively, identifying areas for improvement without internalizing negative judgments. Practicing mindfulness and self-reflection techniques can help individuals with ADHD become more aware of their emotions and reactions. This can enable them to respond to rejection and criticism in a calm and rational manner, rather than reacting impulsively or defensively. Taking the time to pause, reflect, and consider different perspectives can help individuals with ADHD gain a better understanding of themselves and others. 6.2.3 Developing effective communication skills. Effective communication is essential when dealing with rejection and criticism. It is important to express oneself clearly and assertively, while also being open to feedback and different viewpoints. When faced with criticism, individuals with ADHD can benefit from active listening, acknowledging the other person's perspective, and asking for clarification if needed. Using I statements can be helpful in expressing one's feelings and thoughts without becoming defensive or confrontational. For example, instead of saying, "You're always criticizing me," one can say, "I feel hurt when I receive negative feedback," without any constructive suggestions. This approach encourages open dialogue and can lead to a more productive conversation. 6.2.4 Seeking support from trusted individuals. Having a support system is crucial for individuals with ADHD, especially when dealing with rejection and criticism. Trusted friends, family members, or support groups can provide a safe space to share experiences, seek advice, and receive emotional support. Surrounding oneself with understanding and empathetic individuals can help counteract the negative impact of rejection and criticism. It is important to communicate one's needs and feelings to the support system, ensuring they understand the challenges faced due to ADHD. This can help them provide the necessary support and encouragement during difficult times. Additionally, seeking professional help from therapists or counselors who specialize in ADHD can provide valuable guidance and coping strategies. 6.2.5 Practicing self-care and stress management. Coping with rejection and criticism can be emotionally draining for individuals with ADHD. Engaging in self-care activities can help reduce stress and promote emotional well-being. This can include activities such as exercise, meditation, hobbies, or spending time in nature. Taking care of one's physical and mental health is essential for building resilience and coping with challenging situations. Managing stress is also crucial when facing rejection and criticism. Stress can exacerbate ADHD symptoms and make it more difficult to cope with negative feedback. Implementing stress management techniques such as deep breathing exercises, mindfulness, and relaxation techniques can help individuals with ADHD stay calm and focused during stressful situations. 6.2.6 Reframing rejection and criticism. Reframing rejection and criticism involves changing one's perspective and finding positive aspects in negative situations. Instead of viewing rejection and criticism as personal failures, individuals with ADHD can choose to see them as opportunities for growth and learning. This mindset shift can help build resilience and foster a more positive outlook. By reframing rejection and criticism, individuals can focus on the constructive aspects of feedback and use it as a catalyst for personal development. It is important to remember that everyone makes mistakes and faces criticism at some point. Embracing these experiences as opportunities for growth can lead to personal and professional development. In conclusion, coping with rejection and criticism is a challenge that individuals with ADHD often face. By understanding the impact of rejection and criticism, building self-awareness, developing effective communication skills, seeking support, practicing self-care, and reframing negative experiences, individuals with ADHD can navigate these challenges in a healthy and constructive way. It is important to remember that ADHD does not define one's worth, and with the right strategies and support, individuals with ADHD can thrive and succeed. 6.3 Building emotional resilience. Emotional resilience plays a crucial role in managing ADHD. Individuals with ADHD often face emotional challenges such as frustration, impulsivity, and difficulty regulating their emotions. Building emotional resilience can help individuals with ADHD navigate these challenges more effectively and lead a more balanced and fulfilling life. In this section, we will explore strategies and techniques to build emotional resilience and enhance emotional well-being. 6.3.1 Understanding emotional resilience. Emotional resilience refers to the ability to adapt and bounce back from adversity, stress, and emotional challenges. It involves developing coping mechanisms, self-awareness, and the ability to regulate emotions effectively. For individuals with ADHD, emotional resilience is particularly important as they may experience heightened emotional sensitivity and difficulty managing their emotions. 6.3.2 Developing self-awareness. Developing self-awareness is a fundamental step in building emotional resilience. It involves recognizing and understanding one's emotions, triggers, and patterns of behavior. By becoming more aware of their emotional states, individuals with ADHD can better manage their reactions and make conscious choices about how to respond to challenging situations. One effective way to develop self-awareness is through mindfulness practices. Mindfulness involves paying attention to the present moment without judgment. By practicing mindfulness, individuals with ADHD can become more attuned to their emotions and thoughts, allowing them to respond in a more intentional and constructive manner. 6.3.3 Practicing emotional regulation techniques. Emotional regulation is the ability to manage and control one's emotions effectively. For individuals with ADHD, emotional regulation can be particularly challenging due to impulsivity and difficulty with self-control. However, there are several techniques that can help in developing emotional regulation skills. Deep breathing exercises can be a powerful tool in managing emotions. Taking slow, deep breaths can help calm the nervous system and reduce feelings of anxiety or anger. Additionally, engaging in physical activities such as exercise or yoga can also help regulate emotions by releasing endorphins and promoting a sense of well-being. Another effective technique is cognitive reframing. This involves challenging negative or distorted thoughts and replacing them with more positive and realistic ones. By reframing negative thoughts, individuals with ADHD can shift their perspective and reduce emotional distress. 6.3.4 Building resilient coping strategies. Coping strategies are essential for managing emotional challenges associated with ADHD. It is important to develop a toolbox of coping strategies that can be utilized in different situations. Here are some strategies that can help build emotional resilience. Self-care. Prioritizing self-care activities such as getting enough sleep, eating a balanced diet, and engaging in activities that bring joy and relaxation can significantly improve emotional well-being. Seeking support. Building a support network of friends, family, or support groups can provide a valuable source of emotional support and understanding. Sharing experiences and seeking advice from others who have faced similar challenges can be empowering. Journaling. Writing down thoughts and emotions in a journal can provide a safe outlet for expressing and processing emotions. It can also help identify patterns and triggers, leading to a better understanding of one's emotional landscape. Engaging in hobbies. Pursuing hobbies and activities that bring joy and fulfillment can serve as a positive distraction and help manage stress and emotional challenges. Practicing gratitude. Cultivating a gratitude practice can shift focus towards positive aspects of life and enhance emotional well-being. Taking time each day to reflect on things to be grateful for can foster a more positive outlook. 6.3.5 Seeking professional support. While building emotional resilience is important, it is essential to recognize when professional support may be necessary. Therapists, counselors, or psychologists with experience in ADHD can provide valuable guidance and support in developing emotional resilience strategies. They can help individuals with ADHD explore underlying emotional issues, develop coping mechanisms, and provide a safe space for processing emotions. In conclusion, building emotional resilience is a vital aspect of managing ADHD. By developing self-awareness, practicing emotional regulation techniques, and building resilient coping strategies, individuals with ADHD can navigate emotional challenges more effectively. Seeking professional support when needed can also provide additional guidance and assistance in building emotional resilience. With these strategies in place, individuals with ADHD can enhance their emotional well-being and thrive in their daily lives. 6.4 Stress management techniques. Living with ADHD can often be accompanied by high levels of stress. The challenges of managing symptoms, meeting expectations, and navigating daily life can all contribute to feelings of overwhelm and anxiety. However, there are effective stress management techniques that can help individuals with ADHD better cope with and reduce stress levels. By implementing these techniques, you can improve your overall well-being and enhance your ability to manage ADHD. 6.4.1 Identify and understand your stress triggers. The first step in managing stress is to identify and understand your stress triggers. Each person with ADHD may have different triggers that cause stress. It could be a specific task, a certain environment, or even interpersonal relationships. By recognizing these triggers, you can develop strategies to minimize their impact on your stress levels. Take some time to reflect on situations or circumstances that consistently lead to stress. Keep a journal to track your stress levels and note any patterns or commonalities. This self-awareness will help you gain insight into your triggers and enable you to develop targeted stress management techniques. 6.4.2 Practice relaxation techniques. Relaxation techniques are invaluable tools for managing stress. They can help calm the mind, reduce anxiety, and promote a sense of well-being. Here are a few relaxation techniques that can be particularly beneficial for individuals with ADHD. Deep breathing exercises. Deep breathing exercises are simple yet powerful techniques that can be practiced anywhere, anytime. Take slow, deep breaths, inhaling deeply through your nose and exhaling slowly through your mouth. Focus on the sensation of your breath entering and leaving your body. This technique can help regulate your nervous system and promote a sense of calm. Progressive muscle relaxation. Progressive muscle relaxation involves tensing and then releasing different muscle groups in your body. Start by tensing a specific muscle group, such as your hands or shoulders, for a few seconds, and then release the tension while focusing on the sensation of relaxation. Move through each muscle group, progressively working your way from head to toe. This technique can help release physical tension and promote relaxation. Mindfulness meditation. Mindfulness meditation involves focusing your attention on the present moment without judgment. Find a quiet space, sit comfortably, and bring your attention to your breath or a specific sensation in your body. When your mind wanders, gently bring your focus back to the present moment. Regular practice of mindfulness meditation can help reduce stress and improve overall well-being. 6.4.3 Engage in regular physical activity. Physical activity is not only beneficial for your physical health but also plays a crucial role in managing stress. Engaging in regular exercise releases endorphins, which are natural mood boosters. It can also help reduce anxiety and improve sleep quality, both of which can contribute to stress reduction. Find physical activities that you enjoy and incorporate them into your daily routine. It could be walking, jogging, swimming, dancing, or any other form of exercise that gets your body moving. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Remember, even small bursts of physical activity throughout the day can make a difference in managing stress. 6.4.4 Prioritize self-care. Self-care is essential for managing stress and maintaining overall well-being. It involves taking intentional actions to nurture and care for yourself. Here are some self-care practices that can help individuals with ADHD reduce stress. Establish a consistent sleep routine. Getting enough quality sleep is crucial for managing stress. Establish a consistent sleep routine by going to bed and waking up at the same time each day. Create a relaxing bedtime routine that includes activities such as reading, taking a warm bath, or practicing relaxation techniques. Avoid stimulating activities, such as using electronic devices, close to bedtime. Eat a balanced diet. A healthy diet plays a significant role in managing stress levels. Aim to eat a balanced diet that includes a variety of fruits, vegetables, whole grains, lean proteins, and healthy fats. Avoid excessive consumption of caffeine, sugary foods, and processed snacks, as they can contribute to increased anxiety and stress. Engage in activities you enjoy. Make time for activities that bring you joy and relaxation. Engaging in hobbies, spending time in nature, listening to music, or practicing creative outlets can all help reduce stress. Find activities that allow you to unwind and recharge, and make them a regular part of your routine. 6.4.5 Seek support. Managing stress can be challenging, but you don't have to do it alone. Seek support from friends, family, or support groups who understand and empathize with your experiences. Sharing your feelings and concerns with others can provide a sense of relief and help you gain new perspectives on managing stress. Consider reaching out to a mental health professional who specializes in ADHD. They can provide guidance, support, and additional stress management techniques tailored to your specific needs. Therapy or counseling can be an invaluable resource for learning effective coping strategies and developing resilience in the face of stress. 6.4.6 Time management and organization. Effective time management and organization skills can significantly reduce stress levels for individuals with ADHD. By implementing strategies such as creating to-do lists, using calendars or planners, and breaking tasks into smaller, manageable steps, you can better manage your time and reduce the feeling of being overwhelmed. Develop a system that works for you and helps you stay organized. Use reminders, alarms, or digital tools to help you stay on track with deadlines and appointments. Prioritize tasks based on importance and urgency, and break them down into smaller, achievable goals. By managing your time effectively, you can reduce stress and increase productivity. In conclusion, managing stress is crucial for individuals with ADHD to maintain their overall well-being. By identifying and understanding your stress triggers, practicing relaxation techniques, engaging in regular physical activity, prioritizing self-care, seeking support, and implementing effective time management strategies, you can effectively manage stress and improve your ability to cope with ADHD. Remember, it's essential to find what works best for you and make stress management a priority in your daily life. 7. Improving social skills. 7.1 Understanding social difficulties. Social difficulties are a common challenge for individuals with ADHD. These difficulties can arise due to the core symptoms of ADHD, such as impulsivity, inattention, and hyperactivity, which can affect social interactions and relationships. Understanding the social difficulties associated with ADHD is crucial for developing effective strategies to improve social skills and enhance social functioning. 7.1.1 Social skills deficits. One of the primary reasons individuals with ADHD experience social difficulties is due to deficits in social skills. Social skills encompass a range of abilities, including communication, empathy, perspective taking, and understanding social cues. Individuals with ADHD may struggle with these skills, leading to misunderstandings, misinterpretations, and difficulties in forming and maintaining relationships. 7.1.1.1 Communication challenges. Communication challenges are common among individuals with ADHD. They may have difficulty expressing themselves clearly, maintaining conversations, or understanding social nuances. They may interrupt others, struggle with turn-taking, or have difficulty listening attentively. These challenges can lead to misunderstandings and frustration in social interactions. 7.1.1.2 Impulsivity and social interactions. Impulsivity, a core symptom of ADHD, can significantly impact social interactions. Individuals with ADHD may struggle with impulse control, leading to impulsive behaviors or comments that can be perceived as rude or inappropriate. This impulsivity can strain relationships and make it challenging to establish and maintain social connections. 7.1.1.3 Difficulty with perspective taking and empathy. Perspective taking and empathy are essential components of social interactions. Individuals with ADHD may have difficulty understanding others' perspectives, which can lead to misunderstandings and conflicts. They may struggle to recognize and respond appropriately to others' emotions, making it challenging to establish and maintain meaningful relationships. 7.1.2 Social rejection and isolation. The social difficulties associated with ADHD can often result in social rejection and isolation. Individuals with ADHD may experience difficulties fitting in, making friends, or being accepted by their peers. This rejection and isolation can have a significant impact on their self-esteem, mental health, and overall well-being. 7.1.2.1 Bullying and stigmatization. Children and adults with ADHD are at a higher risk of experiencing bullying and stigmatization. Their differences in behavior and social skills may make them targets for teasing, ridicule, or exclusion. This bullying and stigmatization can further exacerbate their social difficulties and negatively impact their self-confidence and mental health. 7.1.2.2 Social anxiety. Social difficulties can also contribute to the development of social anxiety in individuals with ADHD. The fear of social rejection, embarrassment, or judgment can lead to avoidance of social situations and isolation. Social anxiety can further impair social functioning and hinder the development of healthy relationships. 7.1.3 Strategies for improving social skills. While social difficulties can present significant challenges for individuals with ADHD, there are strategies that can help improve social skills and enhance social functioning. 7.1.3.1 Social Skills Training. Social skills training programs can be beneficial for individuals with ADHD. These programs focus on teaching specific social skills, such as active listening, conversation skills, and empathy. Through structured practice and feedback, individuals can learn and develop the necessary skills to navigate social interactions successfully. 7.1.3.2 Cognitive Behavioral Therapy, CBT. Cognitive behavioral therapy can help individuals with ADHD address and modify negative thought patterns and behaviors that contribute to social difficulties. CBT can assist in improving self-awareness, impulse control, and perspective taking, leading to more effective social interactions. 7.1.3.3 Social Coaching and Support. Social coaching and support can provide individuals with ADHD with guidance and assistance in navigating social situations. Coaches or mentors can offer feedback, role-playing exercises, and support in developing and practicing social skills. Support groups or therapy groups can also provide a safe space for individuals to share experiences, learn from others, and build social connections. 7.1.3.4 Mindfulness and Emotional Regulation. Practicing mindfulness and developing emotional regulation skills can also be beneficial for improving social skills. Mindfulness techniques can help individuals with ADHD become more present and attentive in social interactions, reducing impulsive behaviors and improving communication. Emotional regulation skills can assist in managing emotions and responding appropriately in social situations. 7.1.4 Nurturing supportive relationships. Building and maintaining supportive relationships is essential for individuals with ADHD. Supportive relationships can provide understanding, acceptance, and encouragement, which can help individuals navigate social difficulties more effectively. 7.1.4.1 Educating others about ADHD. Educating friends, family, and peers about ADHD can help foster understanding and empathy. By explaining the challenges associated with ADHD, individuals can help others recognize and accommodate their unique needs, reducing misunderstandings and promoting positive social interactions. 7.1.4.2 Seeking supportive environments. Seeking out supportive environments, such as ADHD support groups or communities, can provide individuals with opportunities to connect with others who share similar experiences. These environments can offer a sense of belonging, understanding, and validation, which can be instrumental in building supportive relationships. 7.1.4.3 Open communication and advocacy. Open communication and self-advocacy are crucial for individuals with ADHD to express their needs and concerns in social relationships. By openly communicating their challenges and seeking support when needed, individuals can foster understanding and build stronger, more supportive relationships. In conclusion, understanding the social difficulties associated with ADHD is essential for individuals with ADHD and their loved ones. By recognizing the social skills deficits, addressing social rejection and isolation, implementing strategies to improve social skills, and nurturing supportive relationships, individuals with ADHD can enhance their social functioning and overall well-being. 7.2 Developing communication skills. Effective communication is a crucial skill for individuals with ADHD. Difficulties in communication can often arise due to challenges in attention, impulsivity, and social interactions. However, by developing specific strategies and techniques, individuals with ADHD can improve their communication skills and enhance their relationships with others. In this section, we will explore various strategies to help individuals with ADHD develop effective communication skills. 7.2.1 Active listening. Active listening is a fundamental aspect of effective communication. It involves fully engaging with the speaker and understanding their message. For individuals with ADHD, active listening can be challenging due to difficulties in sustaining attention. However, there are several techniques that can help improve active listening skills. Minimize distractions. Find a quiet and calm environment to have conversations. Turn off or put away any electronic devices that may cause distractions. Maintain eye contact. Make an effort to maintain eye contact with the speaker. This not only shows that you are actively listening but also helps you stay focused on the conversation. Paraphrase and summarize. Repeat or summarize what the speaker has said to ensure that you have understood their message correctly. This also demonstrates that you are actively engaged in the conversation. Ask clarifying questions. If you are unsure about something the speaker said, don't hesitate to ask for clarification. It is better to seek clarification than to make assumptions. 7.2.2 Nonverbal communication. Nonverbal communication plays a significant role in conveying messages and understanding others. Individuals with ADHD may struggle with interpreting nonverbal cues, such as facial expressions and body language. Here are some strategies to improve nonverbal communication skills. Observe and learn. Pay attention to the nonverbal cues of others during conversations. Observe their facial expressions, gestures, and body language to better understand their emotions and intentions. Practice mirroring. Mirroring is the act of subtly imitating the body language and gestures of the person you are communicating with. This can help establish rapport and make the other person feel more comfortable. Use appropriate facial expressions. Be mindful of your own facial expressions and try to match them with the emotions you are trying to convey. This can help others understand your feelings and intentions more accurately. Maintain appropriate personal space. Respect personal boundaries and maintain an appropriate distance during conversations. Invading someone's personal space can make them feel uncomfortable. 7.2.3 Verbal communication. Verbal communication involves the use of words and language to convey messages. Individuals with ADHD may struggle with impulsivity and may find it challenging to express themselves clearly. Here are some strategies to improve verbal communication skills. Slow down and think before speaking. Take a moment to gather your thoughts before responding. This can help you articulate your ideas more clearly and avoid impulsive or tangential responses. Use visual aids. If you find it difficult to express your thoughts verbally, consider using visual aids such as diagrams, charts, or drawings to supplement your communication. Visual aids can help others understand your ideas more easily. Practice active vocabulary building. Expand your vocabulary by actively learning new words and phrases. This can help you express yourself more precisely and effectively. Use concise and clear language. Keep your sentences short and to the point. Avoid using complex or convoluted language that may confuse the listener. 7.2.4 Conflict resolution. Conflict is a natural part of any relationship, but individuals with ADHD may find it challenging to navigate conflicts effectively. Here are some strategies to improve conflict resolution skills. Take a step back. When conflicts arise, take a moment to calm yourself before responding. This can help you approach the situation with a clear mind and avoid impulsive reactions. Practice active listening. During conflicts, actively listen to the other person's perspective without interrupting. This shows respect and allows for a more productive conversation. Use I statements. When expressing your feelings or concerns, use I statements to avoid sounding accusatory. For example, say, I feel frustrated when, instead of, you always. Seek compromise. Look for mutually beneficial solutions and be open to finding a middle ground. This can help resolve conflicts and maintain positive relationships. 7.2.5 Seeking professional help. If you continue to struggle with communication despite implementing these strategies, it may be beneficial to seek professional help. Speech therapists, counselors, or ADHD coaches can provide guidance and support in developing effective communication skills. They can offer personalized strategies and techniques tailored to your specific needs. Remember, developing effective communication skills takes time and practice. By implementing these strategies and seeking support when needed, individuals with ADHD can improve their communication abilities and build stronger relationships with others. 7.3 Building empathy and perspective taking. Building empathy and perspective taking skills is crucial for individuals with ADHD. These skills help them understand and relate to the experiences and emotions of others, which can greatly improve their social interactions and relationships. Empathy allows individuals with ADHD to develop a deeper understanding of others, while perspective taking helps them see situations from different viewpoints. By honing these skills, individuals with ADHD can enhance their social interactions, build stronger connections, and navigate social situations more effectively. 7.3.1 The importance of empathy. Empathy is the ability to understand and share the feelings of others. It involves recognizing and acknowledging the emotions someone else is experiencing. For individuals with ADHD, developing empathy can be challenging due to their tendency to be impulsive and struggle with social cues. However, with practice and effort, empathy can be cultivated. Empathy is essential for building and maintaining healthy relationships. It allows individuals with ADHD to connect with others on a deeper level, fostering understanding and compassion. By empathizing with others, individuals with ADHD can better navigate social situations, resolve conflicts, and offer support to those around them. 7.3.2 Developing empathy. Developing empathy requires active effort and practice. Here are some strategies that can help individuals with ADHD enhance their empathy skills. 1. Active listening. Active listening involves fully focusing on and understanding what someone else is saying. It requires giving the speaker your full attention, maintaining eye contact, and avoiding distractions. By actively listening, individuals with ADHD can better understand the emotions and experiences being shared, allowing them to respond with empathy. 2. Perspective-taking exercises. Engaging in perspective-taking exercises can help individuals with ADHD understand different viewpoints. These exercises involve imagining oneself in someone else's shoes and considering their thoughts, feelings, and experiences. This practice helps individuals with ADHD develop a broader understanding of others' perspectives, fostering empathy and compassion. 3. Reading fiction and watching movies. Reading fiction books and watching movies can be powerful tools for developing empathy. These mediums allow individuals with ADHD to immerse themselves in different characters' lives and experiences. By connecting with the characters' emotions and motivations, individuals with ADHD can expand their understanding of others' perspectives. 4. Seeking diverse experiences. Actively seeking out diverse experiences can broaden individuals' perspectives and enhance their empathy. This can involve engaging with people from different backgrounds, cultures, and experiences. By exposing themselves to diverse perspectives, individuals with ADHD can develop a more comprehensive understanding of others' emotions and experiences. 7.3.3 Benefits of perspective taking. Perspective taking is closely related to empathy and involves understanding and considering different viewpoints. By practicing perspective taking, individuals with ADHD can experience several benefits. 1. Improved communication. Understanding different perspectives allows individuals with ADHD to communicate more effectively. By considering others' viewpoints, they can tailor their communication style to be more inclusive and considerate. This leads to better understanding and reduces the likelihood of misunderstandings or conflicts. 2. Enhanced problem-solving skills. Perspective taking helps individuals with ADHD approach problem-solving from different angles. By considering multiple viewpoints, they can generate more creative and effective solutions. This skill is particularly valuable in group settings or collaborative projects where diverse perspectives can lead to innovative problem-solving. 3. Strengthened relationships. Building empathy and perspective-taking skills strengthens relationships by fostering understanding and connection. When individuals with ADHD can understand and appreciate others' perspectives, they can build stronger bonds and navigate conflicts more effectively. This leads to more fulfilling and supportive relationships. 4. Increased emotional intelligence. Emotional intelligence refers to the ability to recognize, understand, and manage one's own emotions and the emotions of others. By practicing empathy and perspective-taking, individuals with ADHD can enhance their emotional intelligence. This allows them to navigate social situations with greater ease, respond empathetically to others' emotions, and regulate their own emotions more effectively. 7.3.4 Practicing empathy and perspective-taking in daily life. To incorporate empathy and perspective-taking into daily life, individuals with ADHD can practice active listening in conversations, focusing on understanding the speaker's emotions and experiences. Engage in perspective-taking exercises regularly, imagining themselves in others' situations. Read books or watch movies that explore diverse perspectives and experiences. Seek out opportunities to interact with people from different backgrounds and cultures. Reflect on their own emotions and experiences, considering how they might impact their understanding of others. By consistently practicing empathy and perspective-taking, individuals with ADHD can enhance their social skills, build stronger relationships, and navigate social situations with greater ease. These skills not only benefit their interactions with others but also contribute to their overall personal growth and well-being. 7.4 Navigating social situations. Social situations can be challenging for individuals with ADHD. The difficulties in social interactions can stem from impulsivity, inattention, and hyperactivity, which can affect communication, understanding social cues, and maintaining relationships. However, with the right strategies and support, individuals with ADHD can learn to navigate social situations more effectively and build meaningful connections with others. 7.4.1 Understanding social cues. One of the key challenges for individuals with ADHD in social situations is understanding and interpreting social cues. Social cues include verbal and nonverbal signals that convey information about a person's thoughts, feelings, and intentions. These cues can be subtle and require careful observation and interpretation. To improve your ability to understand social cues, it can be helpful to practice active listening, pay close attention to the speaker, maintain eye contact, and show interest through nodding or appropriate facial expressions. This will help you pick up on important verbal and nonverbal cues. Observe body language. Pay attention to the speaker's body language, such as facial expressions, gestures, and posture. These cues can provide valuable insights into their emotions and intentions. Ask for clarification. If you're unsure about someone's message or intention, don't hesitate to ask for clarification. It's better to seek clarification than to make assumptions that may lead to misunderstandings. Seek feedback. Ask trusted friends or family members for feedback on your social interactions. They can provide insights into areas where you may need improvement and offer suggestions for enhancing your social skills. 7.4.2 Effective communication strategies. Effective communication is essential for successful social interactions. Individuals with ADHD may struggle with impulsivity, interrupting others, or difficulty expressing themselves clearly. By practicing and implementing effective communication strategies, you can improve your ability to express yourself and understand others. Here are some strategies to enhance your communication skills. Practice active listening. Give your full attention to the speaker, maintain eye contact, and avoid interrupting. Reflect back on what the speaker has said to ensure you understand their message accurately. Use clear and concise language. When expressing your thoughts or ideas, try to be clear and concise. Avoid using excessive details or going off on tangents, as this can make it harder for others to follow your train of thought. Take turns in conversation. Allow others to speak without interruption and wait for your turn to contribute. Practice patience and avoid the urge to interject or finish others' sentences. Ask open-ended questions. Engage in conversations by asking open-ended questions that encourage others to share their thoughts and feelings. This can help you build deeper connections and show genuine interest in others. Use visual aids. If you struggle with organizing your thoughts during conversations, consider using visual aids such as diagrams or mind maps to help structure your ideas. This can make it easier for others to follow your train of thought. Practice empathy. Put yourself in the other person's shoes and try to understand their perspective. Show empathy by acknowledging their feelings and validating their experiences. 7.4.3 Managing impulsivity in social situations. Impulsivity can significantly impact social interactions for individuals with ADHD. It can lead to interrupting others, speaking without thinking, or engaging in impulsive behaviors that may be socially inappropriate. Managing impulsivity is crucial for maintaining positive relationships and avoiding misunderstandings. Here are some strategies to help manage impulsivity in social situations. Pause before responding. Take a moment to pause and think before responding to someone. This can help you avoid impulsive reactions or comments that may be regrettable. Practice self-awareness. Pay attention to your own impulsive tendencies and triggers. By being aware of situations that may lead to impulsive behavior, you can better prepare yourself to respond in a more controlled manner. Use self-regulation techniques. Develop strategies to help regulate your impulses, such as deep breathing exercises, counting to 10, or mentally rehearsing your response before speaking. Seek support. Inform close friends or family members about your struggles with impulsivity and ask for their support in gently reminding you to pause and think before responding. Engage in mindfulness practices. Mindfulness exercises, such as meditation or yoga, can help improve self-awareness and impulse control. Regular practice can enhance your ability to manage impulsivity in social situations. 7.4.4 Building and maintaining relationships. Building and maintaining relationships can be challenging for individuals with ADHD, but it is not impossible. With the right strategies and support, you can develop meaningful connections with others. Here are some tips for building and maintaining relationships. Be open and honest. Share your ADHD diagnosis with trusted friends or potential partners. Being open about your challenges can help others understand and support you better. Focus on quality over quantity. Instead of trying to maintain numerous relationships, prioritize a few close and meaningful connections. Quality relationships can provide the support and understanding you need. Practice active listening. Show genuine interest in others by actively listening to their thoughts and feelings. This can help strengthen your bond and build trust. Be reliable. Strive to be reliable and follow through on your commitments. This will help build trust and demonstrate your dedication to the relationship. Seek support from ADHD support groups. Joining support groups or online communities specifically for individuals with ADHD can provide a valuable network of understanding individuals who can offer support and advice. Remember, building and maintaining relationships takes time and effort. Be patient with yourself and others, and don't be afraid to seek professional help if needed. Conclusion. Navigating social situations can be challenging for individuals with ADHD, but with the right strategies and support, it is possible to improve social skills and build meaningful connections. By understanding social cues, practicing effective communication, managing impulsivity, and investing in relationships, individuals with ADHD can thrive in social settings and enjoy fulfilling relationships with others. 8. Enhancing academic performance. 8.1 Effective study strategies. When it comes to managing ADHD, one of the key areas that individuals often struggle with is studying. The ability to focus, stay organized, and retain information can be challenging for those with ADHD. However, with the right strategies and techniques, it is possible to improve study skills and enhance academic performance. In this section, we will explore effective study strategies specifically tailored for individuals with ADHD. 8.1.1 Creating a study-friendly environment. Creating a study-friendly environment is crucial for individuals with ADHD. Here are some tips to help you set up an environment that promotes focus and concentration. Minimize distractions. Find a quiet and clutter-free space where you can study without interruptions. Turn off or silence your phone, close unnecessary tabs on your computer, and remove any other potential distractions from your study area. Organize your materials. Keep your study materials well organized and easily accessible. Use folders, binders, or digital tools to categorize and store your notes, textbooks, and other resources. This will help you locate and retrieve information more efficiently. Use visual cues. Visual cues can be helpful for individuals with ADHD. Consider using color-coded folders or sticky notes to categorize and prioritize your study materials. This can make it easier to locate specific information and stay organized. Set up a comfortable workspace. Ensure that your study area is comfortable and ergonomically designed. Use a supportive chair, adjust the lighting to reduce eye strain, and maintain a comfortable temperature. A comfortable workspace can help you stay focused and engaged for longer periods. 8.1.2 Planning and organizing study sessions. Effective planning and organization are essential for successful studying. Here are some strategies to help you plan and structure your study sessions. Create a study schedule. Establish a consistent study routine by creating a schedule that includes dedicated study times. Break your study sessions into manageable chunks, and allocate specific time slots for different subjects or topics. This will help you stay on track and ensure that you cover all the necessary material. Set goals. Set clear and achievable goals for each study session. Break down larger tasks into smaller, more manageable goals. This will provide a sense of accomplishment and motivation as you complete each goal, helping you stay focused and engaged. Use a planner or digital tools. Utilize a planner or digital tools to keep track of assignments, deadlines, and important dates. Write down due dates, exam dates, and other commitments to ensure that you stay organized and manage your time effectively. Prioritize tasks. Prioritize your study tasks based on importance and urgency. Identify the most critical topics or assignments and tackle them first. This will help you allocate your time and energy efficiently, ensuring that you focus on the most essential material. 8.1.3 Active Learning Techniques. Active learning techniques can be particularly beneficial for individuals with ADHD, as they engage the mind and promote better retention of information. Here are some active learning strategies to incorporate into your study routine. Take breaks. Break up your study sessions with short, frequent breaks. Research suggests that taking regular breaks can improve focus and prevent mental fatigue. Use these breaks to stretch, move around, or engage in a quick relaxation exercise. Use multisensory approaches. Engage multiple senses while studying to enhance learning and retention. For example, read aloud to yourself, use flashcards with visual cues, or create mind maps to visually organize information. By incorporating different senses, you can make studying more engaging and memorable. Teach the material. Explaining concepts or teaching the material to someone else can be an effective way to reinforce your understanding. Find a study partner or use online platforms to discuss and explain the material. Teaching others not only helps solidify your knowledge but also provides an opportunity for active engagement. Practice retrieval. Instead of simply rereading or reviewing notes, actively test your knowledge by practicing retrieval. Use flashcards, create practice quizzes, or engage in active recall exercises. This will help reinforce your memory and improve long-term retention. 8.1.4 Time Management and Study Techniques. Time management is crucial for individuals with ADHD, as it helps ensure that you allocate sufficient time to each task and avoid procrastination. Here are some time management and study techniques to consider. Use timers or alarms. Set timers or alarms to help you stay on track and manage your time effectively. Break your study sessions into smaller intervals, and use a timer to allocate specific time periods for each task. This can help you maintain focus and prevent time from slipping away. Chunking. Break larger tasks or assignments into smaller, more manageable chunks. This can make studying feel less overwhelming and more achievable. Focus on completing one chunk at a time, and reward yourself after each accomplishment. Pomodoro Technique. The Pomodoro technique involves working in short bursts of intense focus, followed by short breaks. Set a timer for 25 minutes and work on a specific task with full concentration. After the timer goes off, take a 5-minute break. Repeat this cycle several times, and take a longer break after completing a set number of cycles. Review and summarize. Regularly review and summarize the material you have studied. Summarizing information in your own words can help reinforce understanding and improve retention. Consider creating concise summaries, mind maps, or flashcards to review key concepts. By implementing these effective study strategies, individuals with ADHD can enhance their ability to focus, retain information, and perform better academically. Experiment with different techniques to find what works best for you, and don't hesitate to seek support from teachers, tutors, or educational professionals if needed. Remember, with practice and perseverance, you can overcome the challenges associated with ADHD and achieve academic success. 8.2 Note-taking techniques. Taking effective notes is an essential skill for individuals with ADHD. It can help improve focus, comprehension, and retention of information. In this section, we will explore various note-taking techniques that can be beneficial for individuals with ADHD. 8.2.1 Active listening. Active listening is the foundation of effective note-taking. When listening to a lecture or participating in a discussion, it is crucial to engage actively with the material. Here are some strategies to enhance active listening. Stay engaged, maintain eye contact with the speaker, nod in agreement, and ask questions when necessary. This will help you stay focused and actively involved in the conversation. Use visual cues. Highlight key points, underline important information, or use symbols and diagrams to represent concepts. Visual cues can help you remember and organize information more effectively. Summarize in your own words. After the speaker has finished a point or concept, take a moment to summarize it in your own words. This will help reinforce your understanding and retention of the material. 8.2.2 Structured note-taking. Creating a structured note-taking system can help individuals with ADHD organize their thoughts and information more effectively. Here are some techniques to consider. Cornell method. The Cornell method involves dividing your paper into 3 sections, a narrow left-hand column, a wider right-hand column, and a bottom section. During the lecture or reading, take notes in the right-hand column. Afterward, use the left-hand column to write down key points or questions related to the material. Finally, use the bottom section to summarize the main ideas. Mind mapping. Mind mapping is a visual note-taking technique that allows you to connect ideas and concepts in a nonlinear way. Start by writing the main topic in the center of the page and branch out with subtopics and related ideas. Use colors, symbols, and images to make the mind map more engaging and memorable. Outlining. Outlining is a hierarchical note-taking method that involves organizing information in a structured format. Start with the main topic and use headings, subheadings, and bullet points to break down the information. This method helps you see the relationships between different ideas and facilitates comprehension and retention. 8.2.3 Simplification and Organization. Simplifying and organizing your notes can make them more accessible and easier to review. Here are some strategies to simplify and organize your notes effectively. Use abbreviations and symbols. Develop a set of abbreviations and symbols that you can use to write faster and save time. For example, use arrows to indicate cause and effect relationships or asterisks to highlight important points. Color coding. Assign different colors to different categories or topics. For example, use one color for definitions, another for examples, and another for key concepts. Color coding can help you quickly identify and review specific information. Create a summary. After each lecture or study session, take a few minutes to create a summary of the main points. This will help reinforce your understanding and serve as a quick reference when reviewing the material later. 8.2.4 Technology Tools. In today's digital age, there are numerous technology tools available that can enhance note-taking for individuals with ADHD. Here are some tools to consider. Note-taking apps. There are various note-taking apps available that allow you to take notes digitally and organize them efficiently. Some popular options include Evernote, Microsoft OneNote, and Google Keep. These apps often offer features like voice recording, syncing across devices, and search capabilities. Speech-to-text software. If you find it challenging to write or type quickly, speech-to-text software can be a valuable tool. Programs like Dragon Naturally Speaking or the voice recognition feature on your smartphone can transcribe your spoken words into text, allowing you to capture information more efficiently. Digital flashcards. Flashcards are a useful study tool, and digital flashcard apps like Quizlet or Anki can make the process even more convenient. These apps allow you to create, review, and organize flashcards on your computer or smartphone, making it easier to study and reinforce important information. Remember, the key to effective note-taking is finding a method that works best for you. Experiment with different techniques and tools to discover what helps you stay engaged, organized, and focused. Regular practice and consistent implementation of these strategies will improve your note-taking skills and ultimately enhance your academic performance. 8.3 Test-taking strategies. Tests can be a source of anxiety and stress for individuals with ADHD. The pressure to perform well, the time constraints, and the need to focus can make test-taking particularly challenging. However, with the right strategies and preparation, individuals with ADHD can improve their test-taking skills and achieve better results. In this section, we will explore various strategies that can help individuals with ADHD effectively navigate tests and exams. 8.3.1 Preparing for tests. Understand the test format. Before the test, it is essential to familiarize yourself with the format and structure of the exam. Understand whether it will be multiple choice, short answer, or essay-based. Knowing the format will help you allocate your time effectively and tailor your study strategies accordingly. Create a study plan. Developing a study plan is crucial for individuals with ADHD. Break down the material into manageable chunks and create a schedule that allows for regular study sessions. Set specific goals for each study session and use techniques such as the Pomodoro technique, working in short bursts with breaks in between, to maintain focus and productivity. Use multisensory learning techniques. Engaging multiple senses while studying can enhance memory retention. Incorporate visual aids, such as diagrams or flashcards, to help reinforce concepts. Reading aloud or discussing the material with a study partner can also be beneficial for auditory learners. Practice active learning. Passive reading is not an effective study strategy for individuals with ADHD. Instead, practice active learning techniques such as summarizing the material in your own words, teaching the concepts to someone else, or creating mnemonic devices to aid memory recall. Engaging with the material actively will help improve understanding and retention. 8.3.2 Managing test anxiety. Practice relaxation techniques. Test anxiety can hinder performance and focus. Prior to the test, practice relaxation techniques such as deep breathing, progressive muscle relaxation, or mindfulness meditation. These techniques can help calm the mind and reduce anxiety levels. Positive self-talk. Replace negative thoughts and self-doubt with positive affirmations. Remind yourself of your capabilities and strengths. Repeat positive statements such as, "I am prepared, I can do this," or, "I have studied diligently." Positive self-talk can help boost confidence and reduce anxiety. Visualize success. Visualization is a powerful technique that can help individuals with ADHD overcome test anxiety. Close your eyes and imagine yourself entering the test environment feeling calm, focused, and confident. Visualize yourself answering questions accurately and completing the test successfully. This mental rehearsal can help alleviate anxiety and increase self-assurance. 8.3.3 Test-taking strategies. Read instructions carefully. Before diving into the questions, take a moment to read the instructions thoroughly. Understand the requirements and any specific guidelines provided. Pay attention to details such as the number of questions, point allocations, and time limits. Skim the test. Before answering any questions, quickly skim through the entire test to get an overview of the content. This will help you plan your time effectively and identify any challenging sections that may require more attention. Answer easy questions first. Start by answering the questions that you find easy and straightforward. This will help build momentum and boost your confidence. It also ensures that you secure the points for the questions you know well before tackling more challenging ones. Manage your time. Time management is crucial during tests. Allocate a specific amount of time for each section or question, and stick to it. If you find yourself spending too much time on a particular question, move on and come back to it later if time allows. Prioritize questions that carry more weightage or require more critical thinking. Use process of elimination. When faced with multiple choice questions, use the process of elimination to narrow down your options. Cross out the choices that are clearly incorrect, increasing your chances of selecting the correct answer. This strategy can help you make educated guesses when unsure. Show your work. If the test involves problem solving or calculations, show your work. Even if you make a mistake in the final answer, you may still receive partial credit for your logical approach. Showing your work also helps you identify any errors and correct them if time permits. Review your answers. If time allows, review your answers before submitting the test. Look for any errors or omissions. Pay attention to details such as spelling, grammar, and formatting. Use the remaining time to make any necessary corrections or additions. 8.3.4 Post-test reflection. Analyze your performance. After completing the test, take some time to reflect on your performance. Identify areas where you excelled and areas that need improvement. Understanding your strengths and weaknesses can help you adjust your study strategies for future tests. Seek feedback. If possible, seek feedback from your instructor or peers regarding your test performance. Understanding the areas where you may have made mistakes or could have improved can provide valuable insights for future test taking. Adjust study strategies. Based on your test performance and feedback, make adjustments to your study strategies. Identify areas that require more attention and develop targeted study plans to strengthen your understanding of those topics. Remember, test taking is a skill that can be improved with practice and the right strategies. By implementing these test-taking strategies and managing test anxiety effectively, individuals with ADHD can enhance their performance and achieve better results. 8.4 Time management for school. Effective time management is crucial for students with ADHD to succeed academically. Poor time management skills can lead to missed deadlines, incomplete assignments, and increased stress. However, with the right strategies and techniques, students with ADHD can learn to manage their time effectively and stay on top of their schoolwork. In this section, we will explore various time management strategies specifically tailored for students with ADHD. 8.4.1 Creating a schedule. One of the most effective ways to manage time is by creating a schedule. A schedule provides structure and helps students stay organized. Here are some tips for creating a schedule. Use a planner or digital calendar. Find a method that works best for you, whether it's a physical planner or a digital calendar app. Write down all your assignments, deadlines, and important dates. Break tasks into smaller chunks. Large tasks can be overwhelming, so break them down into smaller, more manageable tasks. This will make it easier to allocate time for each task and prevent procrastination. Prioritize tasks. Determine which tasks are most important and need to be completed first. Prioritizing will help you focus on what needs to be done and avoid feeling overwhelmed. Set realistic goals. Be realistic about what you can accomplish in a given time frame. Avoid overloading your schedule with too many tasks, as this can lead to burnout and decreased productivity. Include breaks. It's important to include regular breaks in your schedule to rest and recharge. Breaks can help improve focus and prevent mental fatigue. 8.4.2 Time blocking. Time blocking is a technique that involves assigning specific blocks of time for different tasks or activities. This method can be particularly helpful for students with ADHD who struggle with time management. Here's how to implement time blocking. Identify your most productive times. Determine when you are most alert and focused. Schedule your most challenging tasks during these times to maximize productivity. Allocate specific time blocks for different activities. Divide your day into blocks of time and assign specific tasks or activities to each block. For example, you might allocate a block of time for studying, another for completing assignments, and another for extracurricular activities. Set timers or alarms. Use timers or alarms to help you stay on track and transition between tasks. This can help you stay focused and prevent time from slipping away. Avoid multitasking. While it may seem efficient, multitasking can actually decrease productivity and lead to mistakes. Focus on one task at a time during each time block to ensure better concentration and quality work. 8.4.3 Breaking down assignments. Long-term assignments can be overwhelming for students with ADHD. Breaking them down into smaller, more manageable tasks can make them less daunting. Here's how to break down assignments effectively. Read the assignment instructions carefully. Make sure you understand what is expected of you. If you have any questions, don't hesitate to ask your teacher for clarification. Create a task list. break down the assignment into smaller tasks or steps. Write them down in a task list or use a digital task management tool. Estimate time for each task. Estimate how much time you think each task will take. This will help you allocate time for each task in your schedule. Set deadlines for each task. Assign deadlines for each task to ensure you stay on track. Be realistic with your deadlines and give yourself some buffer time for unexpected challenges. Monitor your progress. Keep track of your progress as you complete each task. This will help you stay motivated and ensure that you are making steady progress towards completing the assignment. 8.4.4 Minimizing distractions. Distractions can significantly impact your ability to manage time effectively. Here are some strategies to minimize distractions. Create a dedicated study space. Designate a specific area for studying that is free from distractions. Remove any items or devices that may tempt you to veer off task. Turn off notifications. Silence your phone or put it in a different room to avoid being distracted by notifications. Consider using apps or browser extensions that block distracting websites or limit your access to social media during study sessions. Use noise-canceling headphones. If you are easily distracted by noise, consider using noise-canceling headphones to block out background sounds and create a more focused environment. Break tasks into shorter intervals. If you find it difficult to concentrate for long periods, break your tasks into shorter intervals. For example, you could work for 25 minutes and then take a 5-minute break. This technique, known as the Pomodoro technique, can help improve focus and productivity. 8.4.5 Seeking support. Managing time effectively can be challenging, especially for students with ADHD. Don't hesitate to seek support from teachers, parents, or school counselors. They can provide guidance, offer strategies, and help you stay accountable. Additionally, consider joining a study group or finding a study buddy who can help keep you motivated and on track. Remember, effective time management is a skill that takes practice. Be patient with yourself as you develop these strategies and techniques. With consistency and perseverance, you can improve your time management skills and achieve academic success. 9. Supporting ADHD in children. 9.1 Parenting strategies. Parenting a child with ADHD can present unique challenges. It requires patience, understanding, and a proactive approach to help your child manage their symptoms and thrive. In this section, we will explore effective parenting strategies that can support your child with ADHD. 9.1.1 Establishing structure and routine. Children with ADHD often struggle with impulsivity and disorganization. Establishing a structured and predictable routine can help them feel more secure and in control. Create a daily schedule that includes specific times for waking up, meals, homework, playtime, and bedtime. Display the schedule in a visible place, such as a whiteboard or a calendar, so your child can refer to it throughout the day. Consistency is key when implementing routines. Stick to the schedule as much as possible, but also be flexible when necessary. Provide gentle reminders and cues to help your child transition between activities. For example, you can use a timer or a visual countdown to signal when it's time to switch tasks. 9.1.2 Clear and concise communication. Effective communication is crucial when parenting a child with ADHD. Keep your instructions clear, concise, and specific. Break down tasks into smaller, manageable steps, and provide one instruction at a time. Use simple language and avoid lengthy explanations or complex instructions that can overwhelm your child. When giving directions, make eye contact and ensure that your child is paying attention. You can also use visual aids, such as pictures or written lists, to reinforce your instructions. Encourage your child to repeat the instructions back to you to ensure understanding. 9.1.3 Positive reinforcement and rewards. Children with ADHD often respond well to positive reinforcement and rewards. Acknowledge and praise their efforts and achievements, no matter how small. Focus on their strengths and highlight their progress. This positive feedback can boost their self-esteem and motivate them to continue working towards their goals. Consider implementing a reward system to encourage desired behaviors. Set clear expectations and establish a system where your child can earn points or tokens for completing tasks or demonstrating positive behaviors. These points can be exchanged for privileges, small rewards, or special activities. Be consistent with the rewards and provide immediate reinforcement to reinforce the connection between the behavior and the reward. 9.1.4 Consistent discipline and boundaries. While positive reinforcement is important, it is equally crucial to establish consistent discipline and boundaries. Children with ADHD may struggle with impulse control and may test limits. Set clear rules and expectations, and enforce them consistently. Use calm and firm discipline strategies, such as timeouts or loss of privileges, when necessary. It is important to remember that discipline should focus on teaching and guiding rather than punishment. Explain the reasons behind the rules and help your child understand the consequences of their actions. Use discipline as an opportunity for learning and growth, and provide guidance on alternative behaviors. 9.1.5 Breaks and physical activity. Children with ADHD often have excess energy and may struggle with sitting still for extended periods. Incorporating regular breaks and physical activity into their daily routine can help them release energy and improve focus. Encourage your child to engage in physical activities that they enjoy, such as sports, dancing, or bike riding. Plan breaks during homework or study sessions, allowing them to take short movement breaks to stretch or engage in a physical activity. These breaks can help refresh their mind and improve concentration when they return to their tasks. 9.1.6 Collaborating with teachers and professionals. Collaboration with your child's teachers and other professionals is essential in supporting their ADHD management. Maintain open lines of communication with teachers and inform them about your child's diagnosis and any specific strategies that work well at home. Share information about your child's strengths, challenges, and any accommodations or modifications that may be helpful in the classroom. Attend parent-teacher meetings and actively participate in your child's education. Work together with the school to develop an individualized education program, IEP, or a 504 plan that outlines specific accommodations and support for your child's learning needs. Regularly check in with teachers to monitor your child's progress and address any concerns that may arise. 9.1.7 Self-care for parents. Parenting a child with ADHD can be demanding and emotionally challenging. It is important to prioritize self-care to ensure you have the energy and resilience to support your child effectively. Take time for yourself to engage in activities that you enjoy and help you relax. Seek support from friends, family, or support groups who understand the unique challenges of parenting a child with ADHD. Maintain a healthy lifestyle by getting enough sleep, eating nutritious meals, and engaging in regular exercise. Practice stress management techniques, such as deep breathing, mindfulness, or meditation, to help you cope with the daily stressors. Remember that taking care of yourself is not selfish but necessary for your well-being and your ability to support your child. By implementing these parenting strategies, you can create a supportive and nurturing environment for your child with ADHD. Remember that every child is unique, and it may take time to find the strategies that work best for your child. Stay patient, flexible, and open to trying new approaches as you navigate the journey of parenting a child with ADHD. 9.2 Advocating for your child. Advocating for your child with ADHD is an essential part of ensuring they receive the support and accommodations they need to thrive. As a parent, you play a crucial role in advocating for your child's rights and ensuring they have access to the resources and opportunities necessary for their success. This section will provide you with guidance on how to effectively advocate for your child with ADHD. 9.2.1 Understanding your child's rights. Before you can effectively advocate for your child, it is important to understand their rights. Familiarize yourself with the laws and regulations that protect individuals with ADHD, such as the Individuals with Disabilities Education Act (IDEA) and Section 504 of the Rehabilitation Act. These laws ensure that children with disabilities, including ADHD, receive appropriate accommodations and support in educational settings. 9.2.2 Building a strong partnership with the school. Collaborating with your child's school is crucial in advocating for their needs. Establish open lines of communication with your child's teachers, counselors, and administrators. Share information about your child's ADHD diagnosis, including any relevant documentation or evaluations. Discuss your child's strengths, challenges, and any specific accommodations or modifications they may require. Work together with the school to develop an individualized education program, IEP, or a Section 504 plan. These plans outline the specific accommodations, services, and supports your child needs to succeed academically and socially. Regularly review and update these plans to ensure they reflect your child's evolving needs. 9.2.3 Communicating effectively. Effective communication is key to advocating for your child. Be proactive in reaching out to teachers and school staff to discuss your child's progress, challenges, and any concerns you may have. Share any relevant information about your child's ADHD, including strategies that have been successful in managing their symptoms. When communicating with school personnel, be clear, concise, and specific about your child's needs. Use objective language and provide examples to illustrate your points. Be open to listening to the perspectives of teachers and administrators, and work together to find solutions that benefit your child. 9.2.4 Requesting accommodations and modifications. Advocate for the accommodations and modifications that will best support your child's learning and development. These may include extended time on tests, preferential seating, access to assistive technology, or additional support from a special education teacher or counselor. Be prepared to provide documentation from healthcare professionals to support your requests. It is important to remember that each child with ADHD is unique, and their needs may vary. Advocate for accommodations and modifications that are tailored to your child's specific strengths and challenges. Regularly assess the effectiveness of these accommodations and modifications and make adjustments as necessary. 9.2.5 Monitoring your child's progress. Stay actively involved in monitoring your child's progress in school. Regularly communicate with teachers to discuss your child's academic and social development. Request progress reports and attend parent-teacher conferences to gain a comprehensive understanding of your child's strengths and areas for improvement. If you notice any concerns or changes in your child's behavior or academic performance, address them promptly with the school. Collaborate with teachers and administrators to develop strategies to support your child's ongoing progress. 9.2.6 Seeking additional support. In some cases, advocating for your child may require seeking additional support outside of the school. Consider connecting with local support groups or organizations that specialize in ADHD. These groups can provide valuable resources, guidance, and a network of individuals who have experience advocating for children with ADHD. Additionally, consider consulting with professionals such as psychologists, therapists, or educational consultants who specialize in ADHD. They can provide expert advice and guidance on advocating for your child's needs. 9.2.7 Empowering your child. As your child grows older, it is important to involve them in the advocacy process. Teach them about their rights and encourage them to express their needs and preferences. Help them develop self-advocacy skills, such as effectively communicating their needs, requesting accommodations, and seeking support when necessary. By empowering your child to advocate for themselves, you are equipping them with valuable skills that will serve them well throughout their lives. Encourage them to take an active role in their education and to speak up for themselves when they need support. 9.2.8 Resolving conflicts. In the advocacy process, conflicts may arise. It is important to approach conflicts with a collaborative mindset and a focus on finding solutions that benefit your child. Maintain open lines of communication with school personnel and be willing to engage in constructive dialogue. If conflicts persist, consider seeking mediation or involving a neutral third party, such as a special education advocate or an educational attorney, to help resolve the issues. These professionals can provide guidance and support in navigating complex situations and ensuring your child's rights are protected. 9.2.9 Celebrating your child's successes. Throughout the advocacy journey, it is important to celebrate your child's successes. Recognize and acknowledge their achievements, both big and small. Celebrate their progress and growth, and remind them of their strengths and abilities. Advocating for your child with ADHD can be challenging at times, but it is a vital role that can make a significant difference in their educational experience and overall well-being. By understanding your child's rights, building strong partnerships with the school, and effectively communicating their needs, you can ensure they receive the support and accommodations they need to thrive. 9.3 Working with schools and educators. When it comes to managing ADHD in children, working collaboratively with schools and educators is crucial. The school environment plays a significant role in a child's academic success and overall well-being. By establishing open lines of communication and implementing effective strategies, parents can ensure that their child receives the support they need to thrive in the educational setting. In this section, we will explore various ways to work with schools and educators to support children with ADHD. 9.3.1 Establishing communication channels. Open and regular communication between parents and educators is essential for the successful management of ADHD in the school setting. Here are some strategies to establish effective communication channels. Introduce yourself. At the beginning of the school year, introduce yourself to your child's teacher and other relevant school staff. Share information about your child's ADHD diagnosis, their strengths, challenges, and any accommodations or strategies that have been helpful in the past. Schedule meetings. Request regular meetings with your child's teacher to discuss their progress, challenges, and any necessary adjustments to their educational plan. These meetings can provide an opportunity to share updates, address concerns, and collaborate on strategies to support your child's learning. Utilize communication tools. Many schools use online platforms or apps to facilitate communication between parents and educators. Stay informed about your child's assignments, grades, and behavior through these tools. Use them to communicate with teachers and ask questions or provide updates. Share information. Keep educators informed about any changes in your child's medication, therapy, or other interventions. This information can help them understand your child's current needs and make appropriate adjustments in the classroom. 9.3.2 Collaborating on individualized education plans, IEPs, and 504 plans. Individualized education plans, IEPs, and 504 plans are legal documents that outline the specific accommodations and support services a child with ADHD requires in the educational setting. Collaborating with schools and educators to develop and implement these plans is crucial. Here are some steps to ensure effective collaboration. Gather documentation. Provide the school with any relevant documentation, such as medical reports or evaluations, to support your child's eligibility for an IEP or 504 plan. These documents should clearly outline your child's ADHD diagnosis and its impact on their learning. Attend meetings. Participate actively in meetings to discuss and develop the IEP or 504 plan. Share your insights, concerns, and goals for your child's education. Collaborate with the school team to identify appropriate accommodations, modifications, and support services. Review and revise. Regularly review and revise the IEP or 504 plan to ensure it remains relevant and effective. As your child's needs change, adjustments may be necessary. Stay in close contact with the school team to monitor your child's progress and make any necessary modifications. Educate educators. Provide educators with information about ADHD, its symptoms, and strategies that have been effective for your child. This knowledge can help them better understand and support your child's unique needs. 9.3.3 Promoting classroom accommodations and strategies. Collaborating with educators to implement classroom accommodations and strategies can significantly benefit children with ADHD. Here are some suggestions for promoting a supportive learning environment. Visual supports. Visual aids, such as schedules, checklists, and visual reminders, can help children with ADHD stay organized and focused. Work with educators to incorporate these supports into the classroom. Flexible seating. Some children with ADHD benefit from flexible seating options, such as standing desks or stability balls. Discuss these options with the school to determine if they can be implemented. Chunking and breaking tasks. Breaking down assignments or tasks into smaller, manageable parts can help children with ADHD stay focused and complete their work more effectively. Collaborate with educators to implement this strategy in the classroom. Frequent breaks. Children with ADHD may benefit from regular breaks to release excess energy and maintain focus. Work with educators to establish a system that allows your child to take short breaks when needed. Positive reinforcement. Encourage educators to use positive reinforcement strategies, such as praise and rewards, to motivate and reinforce desired behaviors in the classroom. This can help children with ADHD stay engaged and motivated. 9.3.4 Supporting homework and study habits. Homework and studying can be challenging for children with ADHD. Collaborating with schools and educators to support these activities can make a significant difference. Here are some strategies to consider. Establish a homework routine. Work with educators to establish a consistent homework routine that includes specific times and locations for completing assignments. This structure can help children with ADHD stay focused and organized. Provide clear instructions. Ensure that educators provide clear and concise instructions for homework assignments. If necessary, request written instructions or checklists to help your child stay on track. Break tasks into manageable chunks. Help your child break down larger assignments into smaller, more manageable tasks. This approach can prevent overwhelm and improve their ability to complete homework independently. Minimize distractions. Collaborate with educators to create a distraction-free homework environment. This may involve finding a quiet space, removing electronic devices, or using noise-canceling headphones. Encourage regular breaks. Just like in the classroom, encourage your child to take short breaks during homework sessions to release energy and maintain focus. Set a timer to remind them when it's time to take a break and when to resume their work. By working closely with schools and educators, parents can ensure that their child with ADHD receives the necessary support and accommodations to succeed academically. Open communication, collaboration on IEPs and 504 plans, implementing classroom accommodations, and supporting homework and study habits are all essential components of effectively managing ADHD in the school setting. 9.4 Building self-esteem and resilience. Building self-esteem and resilience is crucial for individuals with ADHD. The challenges and difficulties associated with ADHD can often lead to feelings of frustration, low self-worth, and a lack of confidence. However, by implementing certain strategies and adopting a positive mindset, individuals with ADHD can develop a strong sense of self-esteem and resilience that will help them navigate through life more effectively. 9.4.1 Recognizing strengths and accomplishments. One of the first steps in building self-esteem is recognizing and acknowledging one's strengths and accomplishments. Individuals with ADHD often focus on their weaknesses and the things they struggle with, which can lead to a negative self-perception. By shifting the focus to their strengths and achievements, individuals can start to build a more positive self-image. It can be helpful to make a list of personal strengths and accomplishments. This can include both big and small achievements, such as completing a project, overcoming a challenge, or receiving positive feedback. By regularly reviewing this list, individuals can remind themselves of their capabilities and build confidence in their abilities. 9.4.2 Setting realistic goals. Setting realistic goals is another important aspect of building self-esteem and resilience. Individuals with ADHD may often feel overwhelmed by the demands and expectations placed upon them. By setting achievable goals, individuals can experience a sense of accomplishment and boost their self-esteem. When setting goals, it is important to break them down into smaller, manageable tasks. This not only makes the goals more attainable but also provides a sense of progress and achievement along the way. Celebrating each milestone reached can further enhance self-esteem and motivation. 9.4.3 Embracing mistakes and learning opportunities. Mistakes are a natural part of life, and individuals with ADHD may be more prone to making them. However, it is essential to view mistakes as learning opportunities rather than failures. By embracing mistakes and using them as a chance to grow and improve, individuals can develop resilience and a positive mindset. When faced with a mistake or setback, it can be helpful to reflect on what went wrong and identify areas for improvement. This self-reflection can lead to valuable insights and help individuals develop strategies to prevent similar mistakes in the future. By reframing mistakes as opportunities for growth, individuals can build resilience and bounce back from setbacks more effectively. 9.4.4 Practicing self-compassion. Self-compassion is a vital component of building self-esteem and resilience. Individuals with ADHD may often be hard on themselves, criticizing their perceived shortcomings and mistakes. Practicing self-compassion involves treating oneself with kindness, understanding, and acceptance. Instead of engaging in negative self-talk, individuals can practice self-compassion by offering themselves words of encouragement and support. They can remind themselves that everyone makes mistakes and that they are doing their best. Engaging in self-care activities, such as practicing mindfulness, engaging in hobbies, or seeking support from loved ones, can also contribute to building self-compassion. 9.4.5 Seeking support and building a supportive network. Building self-esteem and resilience is not a journey that individuals have to undertake alone. Seeking support from others who understand and empathize with their experiences can be incredibly beneficial. This support can come from friends, family members, support groups, or mental health professionals. By surrounding themselves with a supportive network, individuals with ADHD can receive encouragement, validation, and guidance. Sharing experiences and learning from others who have faced similar challenges can help individuals build resilience and develop coping strategies. Additionally, having a support system in place can provide a sense of belonging and reduce feelings of isolation. 9.4.6 Celebrating progress and small victories. Celebrating progress and small victories is an essential part of building self-esteem and resilience. It is important to acknowledge and appreciate the effort put into overcoming challenges and achieving goals, no matter how small they may seem. By celebrating progress, individuals can reinforce their belief in their abilities and boost their self-esteem. This can be done through self-reflection, journaling, or sharing achievements with a trusted friend or family member. Recognizing and celebrating small victories can provide motivation and a sense of accomplishment, further strengthening resilience. 9.4.7 Practicing mindfulness and stress management. Practicing mindfulness and stress management techniques can significantly contribute to building self-esteem and resilience. Mindfulness involves being fully present in the moment, without judgment or attachment to thoughts or emotions. By practicing mindfulness, individuals can develop a greater sense of self-awareness and learn to manage stress more effectively. Engaging in activities such as meditation, deep breathing exercises, or yoga can help individuals with ADHD reduce stress and increase their ability to focus. These practices can also enhance self-esteem by promoting self-acceptance and self-compassion. By incorporating mindfulness and stress management techniques into their daily routine, individuals can build resilience and improve their overall well-being. 9.4.8 Celebrating individuality and embracing differences. Individuals with ADHD often face challenges that can make them feel different from others. However, it is important to celebrate individuality and embrace differences as strengths rather than weaknesses. Each person with ADHD has unique talents, perspectives, and abilities that can contribute positively to their lives and the lives of others. By embracing their individuality, individuals with ADHD can develop a sense of self-worth and pride in who they are. Recognizing that their differences make them special and valuable can boost self-esteem and resilience. Surrounding themselves with a supportive community that appreciates and celebrates their individuality can further enhance their sense of self-worth. In conclusion, building self-esteem and resilience is essential for individuals with ADHD to thrive. By recognizing strengths, setting realistic goals, embracing mistakes, practicing self-compassion, seeking support, celebrating progress, practicing mindfulness, and embracing individuality, individuals with ADHD can develop a strong sense of self-esteem and resilience that will empower them to overcome challenges and lead fulfilling lives. 10. ADHD in adolescence and adulthood. 10.1 Transitioning to adolescence. Adolescence is a period of significant change and development for individuals with ADHD. As they navigate the transition from childhood to adulthood, they may encounter new challenges and responsibilities. This chapter will explore the unique aspects of managing ADHD during adolescence and provide strategies to support teenagers in this stage of life. 10.1.1 Understanding the impact of ADHD in adolescence. During adolescence, individuals with ADHD may face additional difficulties due to the physical, emotional, and social changes that occur during this period. The symptoms of ADHD, such as impulsivity, inattention, and hyperactivity, can become more pronounced and interfere with academic performance, social relationships, and overall well-being. Academic challenges. Adolescents with ADHD may struggle with organization, time management, and completing assignments. They may have difficulty focusing in class, following instructions, and staying on task. These challenges can lead to lower grades, increased frustration, and a negative impact on self-esteem. Social and emotional difficulties. Adolescents with ADHD may experience difficulties in social interactions and forming meaningful relationships. They may struggle with impulse control, emotional regulation, and understanding social cues. These challenges can lead to feelings of isolation, rejection, and low self-confidence. Increased independence and responsibility. Adolescence is a time when individuals are expected to take on more responsibilities and make independent decisions. However, teenagers with ADHD may struggle with planning, organization, and time management skills, making it challenging for them to meet these expectations. 10.1.2 Strategies for managing ADHD in high school and college. Managing ADHD during high school and college requires a combination of self-awareness, effective strategies, and support from parents, educators, and healthcare professionals. Here are some strategies that can help teenagers with ADHD thrive academically and personally. Develop a routine. Establishing a consistent daily routine can provide structure and help teenagers with ADHD manage their time effectively. Encourage them to create a schedule that includes time for studying, completing assignments, engaging in extracurricular activities, and getting enough sleep. Use visual aids and organizational tools. Visual aids, such as calendars, to-do lists, and color-coded schedules, can help teenagers with ADHD stay organized and remember important tasks and deadlines. Encourage them to use digital tools and apps designed for organization and time management. Break tasks into manageable steps. Large tasks can be overwhelming for individuals with ADHD. Teach teenagers to break down assignments and projects into smaller, more manageable steps. This approach can make tasks feel less daunting and increase the likelihood of completion. Utilize supportive study strategies. Help teenagers with ADHD develop effective study strategies, such as creating a quiet and distraction-free study environment, using mnemonic devices to aid memory retention, and practicing active reading techniques like highlighting and summarizing. Seek accommodations and support. Encourage teenagers with ADHD to advocate for themselves and seek accommodations in school or college. These accommodations may include extended time for exams, preferential seating, or access to note-taking services. Additionally, consider involving a guidance counselor or learning support specialist who can provide additional support and resources. Practice self-care. Adolescents with ADHD can benefit from engaging in regular physical exercise, practicing stress management techniques like deep breathing or mindfulness, and getting enough sleep. Encourage them to prioritize self-care activities that promote overall well-being. 10.1.3 Building healthy relationships. Navigating relationships can be challenging for teenagers with ADHD. However, with the right strategies and support, they can develop healthy and meaningful connections with peers, family members, and romantic partners. Here are some tips for building healthy relationships. Communication skills. Teach teenagers effective communication skills, such as active listening, expressing thoughts and feelings clearly, and using I statements to express needs and concerns. Encourage them to practice these skills in various social situations. Empathy and perspective taking. Help teenagers develop empathy by encouraging them to consider other people's perspectives and feelings. This can enhance their ability to understand and connect with others on a deeper level. Social skills training. Consider enrolling teenagers in social skills training programs or workshops that focus on specific areas of social interaction, such as initiating conversations, maintaining eye contact, and interpreting nonverbal cues. These programs can provide valuable guidance and practice opportunities. Choosing supportive friends. Encourage teenagers to surround themselves with friends who are understanding, supportive, and accepting of their ADHD. Positive peer relationships can provide a sense of belonging and reduce feelings of isolation. Open communication with parents. Maintain open lines of communication between teenagers and their parents. Encourage teenagers to share their thoughts, concerns, and experiences related to their ADHD. This can foster a supportive and understanding environment at home. By implementing these strategies and seeking appropriate support, teenagers with ADHD can successfully navigate the challenges of adolescence and develop the skills necessary for a successful transition into adulthood. 10.2 Managing ADHD in high school and college. Managing ADHD in high school and college can present unique challenges for students. The demands of academic work, increased responsibilities, and social pressures can all contribute to difficulties in managing symptoms of ADHD. However, with the right strategies and support, students with ADHD can thrive in these educational settings. This section will provide guidance on managing ADHD in high school and college, including tips for organization, time management, studying, and seeking support. 10.2.1 Organization and time management. One of the key challenges for students with ADHD is staying organized and managing their time effectively. Here are some strategies that can help. Use a planner or digital calendar. Having a visual representation of your schedule can help you stay on top of assignments, deadlines, and appointments. Make sure to include both academic and personal commitments. Break tasks into smaller steps. Large projects or assignments can feel overwhelming, so break them down into smaller, more manageable tasks. This will make it easier to stay focused and track your progress. Prioritize tasks. Determine which tasks are most important and tackle those first. This will help you avoid procrastination and ensure that you complete your most critical assignments on time. Set reminders and alarms. Use reminders and alarms on your phone or computer to help you remember important deadlines, appointments, and tasks. This can be especially helpful for individuals with ADHD who struggle with time management. Create a study schedule. Establish a consistent study routine that works for you. Find a quiet and comfortable space, eliminate distractions, and allocate specific blocks of time for studying. Stick to your schedule as much as possible to develop good study habits. 10.2.2 Effective study strategies. Studying can be particularly challenging for students with ADHD, but there are several strategies that can help improve focus and retention. Find a study environment that works for you. Experiment with different study environments to determine where you can concentrate best. Some students find it helpful to study in a quiet library, while others prefer background noise in a coffee shop. Discover what works for you and create a consistent study environment. Use active learning techniques. Passive reading and highlighting may not be effective for individuals with ADHD. Instead, engage with the material actively by taking notes, summarizing key points, and asking questions. This will help you stay engaged and improve comprehension. Break up study sessions. Instead of cramming for long periods, break up your study sessions into shorter, focused blocks of time. Take short breaks in between to recharge and maintain concentration. Utilize visual aids. Visual aids, such as diagrams, charts, and flashcards, can help you better understand and remember information. Use color coding and visual organization techniques to enhance your study materials. Seek support from classmates or tutors. If you're struggling with a particular subject, don't hesitate to seek help. Form study groups with classmates or consider working with a tutor who can provide additional guidance and support. 10.2.3 Seeking support. Managing ADHD in high school and college can be challenging, but seeking support can make a significant difference. Here are some avenues to consider. Communicate with your teachers or professors. Let your teachers or professors know about your ADHD diagnosis and any accommodations you may need. They can provide additional support, such as extended time for exams or assignments, preferential seating, or access to note-taking resources. Utilize campus resources. Many high schools and colleges offer resources specifically for students with ADHD. These may include academic support centers, counseling services, or disability support offices. Take advantage of these resources to access additional support and accommodations. Build a support network. Connect with other students who have ADHD or join support groups on campus. Sharing experiences and strategies with others who understand can provide valuable support and encouragement. Consider therapy or coaching. Therapy or coaching can be beneficial for managing ADHD symptoms and developing effective coping strategies. Cognitive behavioral therapy, CBT, and executive function coaching can help you address challenges and develop skills to succeed academically and personally. Remember, managing ADHD in high school and college is a journey, and it may take time to find the strategies and support that work best for you. Be patient with yourself, celebrate your successes, and don't hesitate to reach out for help when needed. With the right tools and support, you can thrive academically and personally. 10.3 ADHD in the workplace. Having ADHD can present unique challenges in the workplace. However, with the right strategies and support, individuals with ADHD can thrive and succeed in their careers. In this section, we will explore various techniques and tips to effectively manage ADHD in the workplace. 10.3.1 Understanding ADHD in the workplace. ADHD can impact various aspects of work performance, including attention, organization, time management, and task completion. Individuals with ADHD may struggle with staying focused on tasks, meeting deadlines, and maintaining consistent productivity. They may also find it challenging to prioritize tasks and manage their time effectively. It is important to remember that ADHD is a neurodevelopmental disorder and not a reflection of intelligence or capability. With the right accommodations and strategies, individuals with ADHD can excel in their professional lives. 10.3.2 Disclosing ADHD in the workplace. Deciding whether or not to disclose your ADHD diagnosis to your employer is a personal choice. While some individuals may choose to disclose their condition to seek accommodations and support, others may prefer to keep it private. It is essential to understand your rights and the potential benefits and drawbacks of disclosure before making a decision. If you decide to disclose your ADHD, it is crucial to have a conversation with your employer or human resources department. Provide them with information about ADHD, how it affects you, and any specific accommodations you may need. This could include flexible work hours, a quiet workspace, or written instructions for tasks. 10.3.3 Time management and organization. Effective time management and organization skills are crucial for individuals with ADHD in the workplace. Here are some strategies to help you stay organized and manage your time effectively. Use a planner or digital calendar to keep track of deadlines, meetings, and tasks. Set reminders to help you stay on track. Break down larger tasks into smaller, more manageable steps. This can help prevent feeling overwhelmed and make it easier to focus on one task at a time. Prioritize tasks based on importance and deadlines. Focus on completing high-priority tasks first before moving on to less urgent ones. Create a daily or weekly to-do list. This can help you stay organized and ensure that important tasks are not forgotten. Minimize distractions in your workspace. Find a quiet area, use noise-canceling headphones if necessary, and remove any unnecessary items that may divert your attention. 10.3.4 Managing focus and attention. Maintaining focus and attention can be challenging for individuals with ADHD. Here are some strategies to help improve focus and productivity in the workplace. Break tasks into smaller, more manageable chunks. Set specific goals for each segment and reward yourself upon completion. Use timers or alarms to create structured work intervals. Set a timer for a specific amount of time, e.g., 25 minutes, and work on a task until the timer goes off. Take short breaks in between to recharge. Find a work environment that suits your needs. Some individuals with ADHD may benefit from a quiet and organized workspace, while others may prefer a more dynamic and stimulating environment. Practice mindfulness and relaxation techniques. Taking short breaks to engage in deep breathing exercises or meditation can help clear your mind and improve focus. 10.3.5 Communication and collaboration. Effective communication and collaboration are essential in any workplace. Here are some tips to enhance your communication skills. Be proactive in seeking clarification. If you are unsure about a task or instruction, don't hesitate to ask for clarification. It is better to ask questions upfront than to make mistakes later. Practice active listening. Pay attention to what others are saying, ask questions, and summarize key points to ensure understanding. Use visual aids and written instructions. Taking notes during meetings or using visual aids can help you remember important information and stay organized. Advocate for yourself. If you require specific accommodations or support, communicate your needs to your supervisor or human resources department. 10.3.6 Managing stress and self-care. Work-related stress can be particularly challenging for individuals with ADHD. Here are some strategies to manage stress and prioritize self-care. Take regular breaks throughout the day. Short breaks can help you recharge and maintain focus. Engage in physical activity. Regular exercise can help reduce stress, improve focus, and boost overall well-being. Practice stress management techniques such as deep breathing exercises, meditation, or journaling. Establish a healthy work-life balance. Set boundaries between work and personal life to prevent burnout. Remember, managing ADHD in the workplace is a continuous process of learning and adapting. Experiment with different strategies and techniques to find what works best for you. Seek support from professionals, such as therapists or coaches specializing in ADHD, to help you navigate the challenges and maximize your potential in the workplace. 10.4 Building healthy relationships. Living with ADHD can present unique challenges when it comes to building and maintaining healthy relationships. The symptoms of ADHD, such as impulsivity, inattention, and hyperactivity, can sometimes strain relationships with family, friends, romantic partners, and colleagues. However, with understanding, communication, and some strategies, it is possible to build strong and fulfilling relationships. 10.4.1 Understanding the impact of ADHD on relationships. ADHD can affect relationships in various ways. Individuals with ADHD may struggle with listening attentively, remembering important details, and staying organized, which can lead to misunderstandings and frustration. They may also have difficulty managing their emotions, which can result in impulsive reactions or emotional outbursts. These challenges can strain relationships and create tension. It is important for both individuals with ADHD and their loved ones to understand that these difficulties are not intentional. ADHD is a neurodevelopmental disorder that affects the brain's executive functions, including attention, impulse control, and emotional regulation. By recognizing the impact of ADHD on relationships, both parties can work together to find strategies that promote understanding and support. 10.4.2 Open and honest communication. Effective communication is the foundation of any healthy relationship, and it becomes even more crucial when ADHD is involved. Openly discussing the challenges and strengths associated with ADHD can help both parties gain a better understanding of each other's perspectives. For individuals with ADHD, it is important to communicate their needs and limitations to their loved ones. This may involve explaining how ADHD symptoms affect their daily life, such as forgetfulness or difficulty with time management. By sharing this information, loved ones can better understand the challenges faced by individuals with ADHD and offer support and patience. On the other hand, loved ones should also express their concerns and feelings in a non-judgmental manner. It is essential to approach these conversations with empathy and understanding, focusing on finding solutions rather than placing blame. By fostering open and honest communication, both parties can work together to navigate the challenges of ADHD and build a stronger relationship. 10.4.3 Managing impulsivity and emotional regulation. Impulsivity and emotional dysregulation are common symptoms of ADHD that can impact relationships. Individuals with ADHD may struggle with controlling their impulses, leading to impulsive decisions or interrupting others during conversations. Additionally, emotional dysregulation can result in intense emotional reactions that may be difficult for loved ones to understand or manage. To manage impulsivity, individuals with ADHD can practice techniques such as pausing before responding, taking deep breaths, or counting to 10. These strategies can help create a moment of reflection and reduce impulsive reactions. It is also beneficial to communicate with loved ones about the challenges faced in managing impulsivity, so they can provide support and understanding. For emotional regulation, individuals with ADHD can explore techniques such as mindfulness, deep breathing exercises, or engaging in physical activities to release pent-up emotions. Seeking therapy or counseling can also be helpful in developing strategies to manage emotions effectively. Loved ones can play a supportive role by offering a listening ear, validating emotions, and encouraging healthy coping mechanisms. 10.4.4 Establishing structure and routine. Creating structure and routine can be beneficial for individuals with ADHD in managing their symptoms and maintaining healthy relationships. By establishing predictable patterns, individuals with ADHD can better manage their time, stay organized, and reduce stress. It is helpful to work together with loved ones to develop a routine that accommodates the needs of both parties. This may involve setting regular times for meals, chores, and leisure activities. Using visual aids, such as calendars or to-do lists, can also assist in keeping track of responsibilities and commitments. Additionally, creating a clutter-free and organized environment can help individuals with ADHD stay focused and reduce distractions. Loved ones can support this by providing assistance in organizing spaces and minimizing clutter. 10.4.5 Seeking professional support. Sometimes, managing ADHD in relationships may require professional support. Couples therapy or family therapy can provide a safe space for open communication, conflict resolution, and learning effective strategies to navigate the challenges of ADHD together. Individual therapy can also be beneficial for individuals with ADHD to address personal challenges, develop coping mechanisms, and improve self-esteem. Therapists can provide guidance on managing symptoms, improving communication skills, and building healthy relationships. 10.4.6 Patience, understanding, and support. Building healthy relationships when ADHD is involved requires patience, understanding, and ongoing support from both parties. It is essential to remember that ADHD is a lifelong condition, and managing its symptoms can be a continuous process. Loved ones should strive to be patient and understanding, recognizing that individuals with ADHD may have good intentions but struggle with certain aspects of their behavior. Celebrating strengths and accomplishments, no matter how small, can also contribute to a positive and supportive environment. Individuals with ADHD should also practice self-compassion and seek support when needed. Building a network of understanding friends, joining support groups, or connecting with others who have ADHD can provide a sense of community and validation. By working together, communicating openly, and implementing strategies to manage ADHD symptoms, individuals with ADHD and their loved ones can build strong and fulfilling relationships that thrive despite the challenges. 11. Addressing company existing conditions. 11.1 ADHD and anxiety. Anxiety is a common coexisting condition that often accompanies ADHD. Many individuals with ADHD experience symptoms of anxiety, such as excessive worry, restlessness, and difficulty concentrating. The relationship between ADHD and anxiety is complex, with each condition influencing and exacerbating the symptoms of the other. In this section, we will explore the connection between ADHD and anxiety and discuss strategies for managing anxiety in individuals with ADHD. Understanding the connection. ADHD and anxiety often go hand in hand, and research suggests that there may be a biological and genetic link between the two conditions. Both ADHD and anxiety are associated with imbalances in certain neurotransmitters, such as dopamine and norepinephrine, which play a crucial role in regulating attention, mood, and anxiety levels. The symptoms of ADHD, such as impulsivity, inattention, and hyperactivity, can contribute to feelings of anxiety. For example, individuals with ADHD may worry about forgetting important tasks or making mistakes due to their difficulty with organization and attention to detail. Additionally, the challenges in social interactions and academic performance that often accompany ADHD can also lead to increased anxiety. On the other hand, anxiety can also worsen the symptoms of ADHD. When individuals with ADHD experience anxiety, it can further impair their ability to focus, concentrate, and regulate their emotions. Anxiety can also increase restlessness and impulsivity, making it even more challenging to manage ADHD symptoms effectively. Recognizing the symptoms. It is essential to recognize the symptoms of anxiety in individuals with ADHD to provide appropriate support and intervention. Some common symptoms of anxiety in individuals with ADHD include excessive worry or fear about everyday situations, restlessness and difficulty sitting still, racing thoughts and difficulty concentrating, physical symptoms such as rapid heartbeat, sweating, and stomachaches, avoidance of certain situations or activities due to fear or anxiety, sleep disturbances, such as difficulty falling asleep or staying asleep. It is important to note that anxiety symptoms can vary from person to person, and not everyone with ADHD will experience anxiety in the same way. Some individuals may have more generalized anxiety, while others may have specific phobias or social anxiety. Strategies for managing ADHD and anxiety. Managing anxiety in individuals with ADHD requires a comprehensive approach that addresses both conditions simultaneously. Here are some strategies that can be helpful. 1. Education and awareness. Understanding the relationship between ADHD and anxiety is the first step in managing both conditions effectively. Educate yourself and your loved ones about the symptoms and challenges associated with ADHD and anxiety. By increasing awareness, you can develop a better understanding of how these conditions interact and find appropriate strategies for managing them. 2. Cognitive behavioral therapy, CBT. Cognitive behavioral therapy is a widely recognized and effective treatment for both ADHD and anxiety. CBT helps individuals identify and challenge negative thought patterns and develop coping strategies to manage anxiety symptoms. It can also help individuals with ADHD improve their executive functioning skills, such as organization and time management, which can reduce anxiety. 3. Medication. In some cases, medication may be prescribed to manage both ADHD and anxiety symptoms. Stimulant medications commonly used to treat ADHD, such as methylphenidate or amphetamines, can also help reduce anxiety symptoms. However, it is essential to work closely with a healthcare professional to find the right medication and dosage that works best for each individual. 4. Stress management techniques. Learning and practicing stress management techniques can be beneficial for individuals with ADHD and anxiety. Techniques such as deep breathing exercises, mindfulness meditation, and physical exercise can help reduce anxiety levels and promote relaxation. Regular exercise, in particular, has been shown to have a positive impact on both ADHD and anxiety symptoms. 5. Supportive environment. Creating a supportive and understanding environment is crucial for individuals with ADHD and anxiety. Surround yourself with people who are knowledgeable about ADHD and anxiety and who can provide support and encouragement. Seek out support groups or therapy groups specifically designed for individuals with ADHD and anxiety to connect with others who may be experiencing similar challenges. 6. Time management and organization. Developing effective time management and organizational skills can help reduce anxiety and improve overall functioning. Use tools such as planners, calendars, and reminders to stay organized and manage tasks effectively. Breaking tasks into smaller, manageable steps can also help reduce feelings of overwhelm and anxiety. 7. Self-care. Taking care of oneself is essential for managing both ADHD and anxiety. Make sure to prioritize self-care activities such as getting enough sleep, eating a balanced diet, and engaging in activities that bring joy and relaxation. Engaging in hobbies or activities that promote mindfulness, such as yoga or art, can also be beneficial for reducing anxiety. Conclusion. Managing anxiety in individuals with ADHD requires a comprehensive approach that addresses both conditions simultaneously. By understanding the connection between ADHD and anxiety and implementing strategies such as cognitive behavioral therapy, stress management techniques, and creating a supportive environment, individuals with ADHD can effectively manage their anxiety symptoms and improve their overall well-being. Remember, seeking professional help and support is crucial in developing an individualized plan for managing ADHD and anxiety. 11.2 ADHD and depression. Depression is a common coexisting condition that often accompanies ADHD. Individuals with ADHD are at a higher risk of developing depression compared to those without ADHD. The symptoms of ADHD, such as difficulty concentrating, impulsivity, and hyperactivity, can contribute to feelings of frustration, low self-esteem, and a sense of being overwhelmed. These factors can increase the likelihood of developing depression. 11.2.1 Understanding depression. Depression is a mental health disorder characterized by persistent feelings of sadness, hopelessness, and a loss of interest in activities. It affects how a person thinks, feels, and behaves, and can have a significant impact on their daily life. Depression can manifest in different ways, and the symptoms can vary from person to person. Some common symptoms of depression include persistent feelings of sadness or emptiness, loss of interest or pleasure in activities once enjoyed, changes in appetite and weight, sleep disturbances, such as insomnia or excessive sleeping, fatigue or loss of energy. Difficulty concentrating or making decisions, feelings of worthlessness or excessive guilt, recurrent thoughts of death or suicide. 11.2.2 The relationship between ADHD and depression. The relationship between ADHD and depression is complex and multifaceted. Several factors contribute to the increased risk of depression in individuals with ADHD. These factors include neurochemical imbalances. Both ADHD and depression are associated with imbalances in certain neurotransmitters, such as dopamine and serotonin, which play a crucial role in regulating mood and emotions. Chronic stress. The challenges and difficulties associated with managing ADHD symptoms can lead to chronic stress. Prolonged stress can disrupt the body's stress response system and contribute to the development of depression. Negative self-perception. Individuals with ADHD often face criticism and negative feedback due to their symptoms. This can lead to feelings of low self-esteem, shame, and a negative self-perception, which can increase the risk of depression. Social difficulties. ADHD can affect social interactions and relationships, leading to feelings of isolation and loneliness. The lack of social support and the challenges in forming and maintaining relationships can contribute to the development of depression. 11.2.3 Recognizing and managing ADHD-related depression. It is essential to recognize the signs of depression in individuals with ADHD and seek appropriate support and treatment. Here are some strategies for managing ADHD-related depression. Seek professional help. If you suspect that you or your loved one is experiencing depression, it is crucial to consult a mental health professional. They can provide an accurate diagnosis and develop a personalized treatment plan. Medication. In some cases, medication may be prescribed to manage both ADHD and depression symptoms. Antidepressant medications can help regulate mood and alleviate depressive symptoms. It is important to work closely with a healthcare provider to find the right medication and dosage. Therapy. Psychotherapy, such as cognitive behavioral therapy, CBT, can be beneficial in managing both ADHD and depression. CBT helps individuals identify and change negative thought patterns and develop coping strategies to manage symptoms. Support groups. Joining support groups or seeking peer support can provide a sense of belonging and understanding. Connecting with others who have similar experiences can be empowering and help reduce feelings of isolation. Healthy lifestyle habits. Engaging in regular exercise, maintaining a balanced diet, and getting enough sleep can have a positive impact on both ADHD and depression symptoms. These lifestyle habits can help regulate mood, improve overall well-being, and reduce the risk of depressive episodes. Stress management techniques. Learning and practicing stress management techniques, such as deep breathing exercises, mindfulness, and relaxation techniques, can help reduce stress levels and improve mood. Self-care. Prioritizing self-care activities, such as engaging in hobbies, practicing self-compassion, and setting boundaries, can help individuals with ADHD manage their symptoms and reduce the risk of depression. 11.2.4 The importance of support and understanding. Living with both ADHD and depression can be challenging, but with the right support and understanding, individuals can effectively manage their symptoms and improve their overall well-being. It is crucial for individuals with ADHD and depression to have a strong support system that includes family, friends, and healthcare professionals who can provide guidance, empathy, and encouragement. Remember, seeking help is a sign of strength, and with the right treatment and support, individuals with ADHD and depression can lead fulfilling and meaningful lives. 11.3 ADHD and learning disabilities. ADHD, or attention deficit hyperactivity disorder, is a neurodevelopmental disorder that affects both children and adults. It is characterized by symptoms of inattention, hyperactivity, and impulsivity. While ADHD can present its own set of challenges, it is not uncommon for individuals with ADHD to also have learning disabilities. In fact, research suggests that up to 50% of individuals with ADHD may also have a learning disability. Learning disabilities refer to a range of disorders that affect the acquisition and use of various academic skills. These disabilities can impact a person's ability to read, write, spell, solve math problems, or understand and use spoken language. When ADHD and learning disabilities coexist, it can create additional difficulties in academic settings and everyday life. 11.3.1 Understanding learning disabilities. Learning disabilities are neurological conditions that affect how the brain processes information. They are not related to intelligence or effort, but rather to the way the brain receives, processes, and communicates information. There are different types of learning disabilities, including dyslexia, dyscalculia, dysgraphia, and auditory processing disorder. Dyslexia. Dyslexia primarily affects reading and language processing. Individuals with dyslexia may have difficulty with reading fluency, decoding words, spelling, and understanding written text. Dyscalculia. Dyscalculia is a learning disability that affects mathematical abilities. Individuals with dyscalculia may struggle with number sense, understanding mathematical concepts, and performing calculations. Dysgraphia. Dysgraphia affects a person's ability to write coherently and legibly. It can make handwriting difficult, and individuals with dysgraphia may struggle with organizing their thoughts on paper. Auditory processing disorder. Auditory processing disorder affects how the brain processes auditory information. Individuals with this learning disability may have difficulty understanding and interpreting spoken language, following directions, and distinguishing between similar sounds. 11.3.2 The intersection of ADHD and learning disabilities. When ADHD and learning disabilities coexist, they can compound the challenges faced by individuals. The symptoms of ADHD, such as inattention and impulsivity, can make it harder for individuals to focus on tasks, follow instructions, and stay organized. This can further impact their ability to learn and perform academically. For example, a student with ADHD and dyslexia may struggle with reading comprehension due to both attention difficulties and difficulties with decoding words. Similarly, a student with ADHD and dyscalculia may have trouble focusing on math problems and understanding mathematical concepts. 11.3.3 Identifying and assessing learning disabilities. Identifying and assessing learning disabilities in individuals with ADHD is crucial for providing appropriate support and interventions. It is important to note that the symptoms of ADHD and learning disabilities can overlap, making it challenging to differentiate between the two. Therefore, a comprehensive evaluation by a qualified professional, such as a psychologist or educational specialist, is necessary. The assessment process typically involves a combination of interviews, observations, and standardized tests. The professional will gather information about the individual's developmental history, academic performance, and any difficulties experienced in various areas. They may also conduct assessments to measure cognitive abilities, academic skills, and specific areas related to the suspected learning disability. 11.3.4 Strategies for managing ADHD and learning disabilities. Once a learning disability has been identified in addition to ADHD, it is important to implement strategies and accommodations to support the individual's learning and overall well-being. Here are some strategies that can be helpful. Individualized Education Plan (IEP). If the individual is a student, an IEP can be developed to outline specific accommodations and modifications to support their learning needs. This may include extra time for assignments and tests, preferential seating, or the use of assistive technology. Multisensory learning. Incorporating multiple senses into the learning process can be beneficial for individuals with learning disabilities. Using visual aids, hands-on activities, and auditory cues can help reinforce learning and improve comprehension. Breaking tasks into smaller steps. Breaking down tasks into smaller, manageable steps can make them less overwhelming. This can help individuals with ADHD and learning disabilities stay focused and organized. Assistive technology. Utilizing assistive technology tools can support individuals with learning disabilities. Text-to-speech software, speech recognition software, and graphic organizers can assist with reading, writing, and organizing thoughts. Providing clear instructions. Clear and concise instructions can help individuals with ADHD and learning disabilities understand and complete tasks more effectively. Using visual cues, written instructions, and verbal reminders can enhance comprehension. Peer support and collaboration. Encouraging peer support and collaboration can create a supportive learning environment. Group work and cooperative learning activities can provide opportunities for individuals to learn from their peers and develop social skills. Emotional support. Individuals with ADHD and learning disabilities may experience frustration, anxiety, or low self-esteem. Providing emotional support and creating a safe and inclusive environment can help alleviate these challenges. 11.3.5 Seeking professional support. Managing ADHD and learning disabilities can be complex, and it is important to seek professional support when needed. Psychologists, educational specialists, and other professionals can provide guidance, develop individualized strategies, and offer interventions tailored to the specific needs of the individual. Additionally, involving parents, teachers, and other caregivers in the support process is crucial. Open communication and collaboration between all parties involved can ensure consistency and maximize the individual's potential for success. Remember, individuals with ADHD and learning disabilities have unique strengths and talents. With the right support, accommodations, and strategies in place, they can thrive academically and in other areas of life. 11.4 ADHD and substance abuse. Individuals with ADHD are at a higher risk of developing substance abuse issues compared to those without the condition. The impulsivity, inattention, and hyperactivity associated with ADHD can make individuals more susceptible to engaging in risky behaviors, including substance abuse. It is crucial to understand the relationship between ADHD and substance abuse and to develop strategies to address and manage these coexisting conditions effectively. 11.4.1 Understanding the link between ADHD and substance abuse. Research has consistently shown a strong correlation between ADHD and substance abuse. Studies have found that individuals with ADHD are more likely to start using substances at an earlier age and have a higher likelihood of developing substance use disorders. The reasons for this link are multifaceted. 11.4.1.1 Self-medication. One possible explanation for the connection between ADHD and substance abuse is the concept of self-medication. Individuals with ADHD may turn to substances as a way to cope with the challenges and symptoms of their condition. They may use substances to temporarily alleviate feelings of restlessness, impulsivity, or difficulty focusing. However, this self-medication approach can quickly lead to dependence and addiction. 11.4.1.2 Impulsivity and risk-taking behavior. The impulsivity and risk-taking behavior associated with ADHD can also contribute to substance abuse. Individuals with ADHD may be more likely to engage in impulsive actions without considering the potential consequences. This impulsivity can lead to experimentation with drugs or alcohol, increasing the risk of developing substance abuse problems. 11.4.1.3 Neurological factors. There are also neurological factors that contribute to the link between ADHD and substance abuse. Both conditions involve dysregulation of the brain's reward system, which can make individuals more susceptible to seeking out pleasurable experiences, including substance use. The dopamine system, which plays a crucial role in reward and motivation, is often dysregulated in individuals with ADHD, making them more vulnerable to the addictive properties of substances. 11.4.2 Recognizing the signs of substance abuse in individuals with ADHD. It is essential for individuals with ADHD and their loved ones to be aware of the signs and symptoms of substance abuse. Recognizing these signs early on can help in seeking appropriate support and intervention. Some common signs of substance abuse in individuals with ADHD include increased secrecy and withdrawal from family and friends, decline in academic or work performance, changes in sleep patterns, sudden changes in mood or behavior, financial difficulties or unexplained expenses, neglecting responsibilities and obligations, legal issues related to substance use. Physical symptoms such as bloodshot eyes, weight loss or gain, and poor hygiene. If you suspect that you or someone you know with ADHD is struggling with substance abuse, it is crucial to seek professional help from a healthcare provider or addiction specialist. 11.4.3 Treating coexisting ADHD and substance abuse. Treating coexisting ADHD and substance abuse requires a comprehensive approach that addresses both conditions simultaneously. It is essential to work with healthcare professionals experienced in treating individuals with dual diagnoses. The following strategies can be helpful in managing ADHD and substance abuse. 11.4.3.1 Integrated treatment. Integrated treatment involves addressing both ADHD and substance abuse concurrently. This approach may include a combination of medication, therapy, and behavioral interventions. Medications such as stimulants, non-stimulants, or antidepressants may be prescribed to manage ADHD symptoms, while therapy can help individuals develop coping strategies and address underlying emotional issues contributing to substance abuse. 11.4.3.2 Behavioral therapy. Behavioral therapy, such as cognitive behavioral therapy, CBT, can be beneficial in treating both ADHD and substance abuse. CBT helps individuals identify and change negative thought patterns and behaviors associated with substance use. It also provides tools and techniques to manage impulsivity, improve decision-making skills, and develop healthier coping mechanisms. 11.4.3.3 Support groups. Participating in support groups specifically designed for individuals with ADHD and substance abuse can provide a sense of community and understanding. These groups offer a safe space to share experiences, learn from others, and receive support from individuals facing similar challenges. Support groups can be found through local community organizations, treatment centers, or online platforms. 11.4.3.4 Lifestyle changes. Making positive lifestyle changes can significantly impact both ADHD symptoms and substance abuse. Engaging in regular exercise, practicing stress reduction techniques such as mindfulness or meditation, and maintaining a healthy diet can improve overall well-being and reduce the risk of relapse. It is also important to establish a structured daily routine and prioritize self-care activities. 11.4.4 Preventing substance abuse in individuals with ADHD. Prevention is key in reducing the risk of substance abuse in individuals with ADHD. Here are some strategies that can help prevent substance abuse. 11.4.4.1 Education and awareness. Educating individuals with ADHD, their families, and their support networks about the increased risk of substance abuse is crucial. Understanding the link between ADHD and substance abuse can help individuals make informed decisions and seek appropriate support when needed. 11.4.4.2 Building resilience and coping skills. Teaching individuals with ADHD effective coping skills and resilience-building techniques can help them manage their symptoms and reduce the likelihood of turning to substances as a means of self-medication. This can include stress management techniques, problem-solving strategies, and healthy ways of managing emotions. 11.4.4.3 Creating a supportive environment. Creating a supportive and understanding environment is essential in preventing substance abuse in individuals with ADHD. This includes open communication, setting clear expectations, and providing positive reinforcement for healthy behaviors. Building strong relationships and fostering a sense of belonging can also reduce the risk of substance abuse. 11.4.4.4 Monitoring and supervision. Regular monitoring and supervision can help identify any early signs of substance abuse in individuals with ADHD. This can involve maintaining open lines of communication, checking in regularly, and being aware of any changes in behavior or mood. By understanding the link between ADHD and substance abuse, recognizing the signs, and implementing appropriate prevention and treatment strategies, individuals with ADHD can effectively manage both conditions and lead fulfilling, healthy lives. 12. Thriving with ADHD. 12.1 Embracing strengths and talents. Living with ADHD can present many challenges, but it is important to remember that individuals with ADHD also possess unique strengths and talents. Embracing these strengths and talents can not only help individuals with ADHD thrive but also enhance their overall well-being and self-esteem. In this section, we will explore some of the common strengths and talents associated with ADHD and discuss how to harness them to lead a fulfilling life. 12.1.1 Creativity and innovation. One of the most notable strengths of individuals with ADHD is their creativity and ability to think outside the box. Many individuals with ADHD have a natural inclination towards creative pursuits such as art, music, writing, and problem-solving. Their ability to see connections and patterns that others may overlook can lead to innovative ideas and solutions. To embrace this strength, individuals with ADHD can explore different creative outlets that resonate with them. Engaging in activities such as painting, playing a musical instrument, writing, or participating in theater can provide a sense of fulfillment and allow for self-expression. Additionally, individuals with ADHD can channel their creativity into problem-solving by seeking out challenging projects or brainstorming new ideas. 12.1.2 Hyperfocus and intense passion. While individuals with ADHD may struggle with maintaining focus in certain situations, they also have the ability to experience hyperfocus. Hyperfocus refers to the intense concentration and absorption in a task or activity that is of great interest to them. During these periods of hyperfocus, individuals with ADHD can demonstrate exceptional productivity and creativity. To harness this strength, individuals with ADHD can identify their areas of passion and interest. By aligning their goals and activities with their passions, they can tap into their hyperfocus and achieve remarkable results. It is important to create an environment that supports and nurtures this intense focus, allowing individuals with ADHD to fully immerse themselves in their chosen pursuits. 12.1.3 High energy and enthusiasm. Individuals with ADHD often possess high levels of energy and enthusiasm. While this energy can sometimes be challenging to manage, it can also be a valuable asset. Their enthusiasm and zest for life can inspire and motivate others, making them natural leaders and influencers. To embrace this strength, individuals with ADHD can seek out activities that allow them to channel their energy in a positive and productive way. Engaging in physical exercise, sports, or other high-energy activities can help individuals with ADHD release excess energy and improve focus. Additionally, they can use their enthusiasm to inspire and motivate others, whether it be through mentoring, coaching, or advocating for causes they believe in. 12.1.4 Ability to multitask and adapt. Individuals with ADHD often have a unique ability to multitask and adapt to changing situations. While multitasking may not always be efficient, individuals with ADHD can excel in environments that require flexibility and quick thinking. Their ability to juggle multiple tasks and adapt to new circumstances can be a valuable asset in various professional and personal settings. To embrace this strength, individuals with ADHD can seek out opportunities that allow them to utilize their multitasking and adaptability skills. They can explore careers that involve managing multiple projects or roles simultaneously, such as event planning, project management, or entrepreneurship. Additionally, individuals with ADHD can develop strategies to prioritize tasks and manage their time effectively, ensuring that they can adapt to changing demands without feeling overwhelmed. 12.1.5 Outside the box thinking. Individuals with ADHD often possess a unique perspective and the ability to think outside the box. They can approach problems and challenges from unconventional angles, leading to innovative solutions. This ability to think creatively and differently can be a valuable asset in various fields, including entrepreneurship, research, and problem solving. To embrace this strength, individuals with ADHD can actively seek out opportunities that allow them to utilize their outside-the-box thinking. They can engage in activities that encourage creative problem solving, such as puzzles, brain teasers, or strategy games. Additionally, individuals with ADHD can explore careers or hobbies that value innovative thinking and provide an environment that nurtures their unique perspective. 12.1.6 Building on strengths for success. Embracing strengths and talents is not only about recognizing them but also about leveraging them to achieve success and fulfillment. By focusing on their strengths, individuals with ADHD can build a foundation for personal growth and development. It is important to remember that everyone has their own unique set of strengths and talents, and embracing them can lead to a more positive and empowered life with ADHD. To build on strengths, individuals with ADHD can set goals that align with their strengths and passions. Seek out opportunities that allow them to utilize their strengths. Surround themselves with a supportive network that appreciates and encourages their talents. Practice self-compassion and celebrate their achievements, no matter how small. Continuously learn and develop skills related to their strengths. By embracing their strengths and talents, individuals with ADHD can not only overcome challenges but also thrive in all aspects of life. It is important to remember that ADHD is not a limitation but rather a unique way of experiencing the world. By embracing their strengths, individuals with ADHD can lead fulfilling and successful lives while making a positive impact on those around them. 12.2 Setting and achieving life goals. Setting and achieving life goals can be a challenging task for individuals with ADHD. The symptoms of ADHD, such as impulsivity, distractibility, and difficulty with organization, can make it difficult to stay focused and motivated towards long-term goals. However, with the right strategies and mindset, individuals with ADHD can learn to set realistic goals and take steps towards achieving them. 12.2.1 Understanding the importance of goal setting. Goal setting is a crucial aspect of personal growth and development. It provides a sense of direction and purpose, helps prioritize tasks, and gives a sense of accomplishment when goals are achieved. For individuals with ADHD, setting goals can be particularly beneficial as it provides structure and helps manage time effectively. When setting goals, it is important to consider both short-term and long-term objectives. Short-term goals are smaller, more manageable tasks that can be accomplished within a shorter time frame, while long-term goals are larger aspirations that require more time and effort. By breaking down long-term goals into smaller, achievable steps, individuals with ADHD can maintain focus and motivation throughout the process. 12.2.2 Setting realistic and specific goals. One of the keys to successful goal setting is ensuring that the goals are realistic and specific. Setting unrealistic goals can lead to frustration and disappointment, which can negatively impact motivation. It is important to consider one's abilities, resources, and limitations when setting goals. Specificity is also crucial when setting goals. Vague goals such as, get better at something, or, be more successful, can be overwhelming and difficult to measure progress. Instead, goals should be specific and measurable. For example, instead of setting a goal to be more organized, a specific goal could be, create a daily schedule and stick to it. 12.2.3 Breaking goals into manageable steps. For individuals with ADHD, breaking goals into smaller, manageable steps is essential. This approach helps to prevent overwhelm and allows for a more systematic approach to achieving goals. By breaking down goals into smaller tasks, individuals can focus on one step at a time, making progress more tangible and achievable. To break goals into manageable steps, it can be helpful to create a to-do list or an action plan. This plan should outline the specific tasks required to achieve the goal and include deadlines or timelines for each step. Breaking down goals into smaller steps also allows for regular checkpoints and adjustments if necessary. 12.2.4 Prioritizing and time management. Effective time management is crucial for individuals with ADHD when it comes to setting and achieving life goals. ADHD can make it challenging to prioritize tasks and manage time effectively. However, there are strategies that can help individuals with ADHD stay organized and on track. One effective strategy is to use a planner or a digital calendar to schedule tasks and allocate specific time slots for each activity. This helps create structure and provides a visual representation of how time is being utilized. Prioritizing tasks based on importance and urgency can also help individuals with ADHD stay focused and avoid procrastination. 12.2.5 Managing distractions and maintaining focus. Distractions can be a significant challenge for individuals with ADHD when it comes to goal setting and achievement. It is important to identify and minimize distractions to maintain focus and productivity. This may involve creating a dedicated workspace, turning off notifications on electronic devices, or using noise-canceling headphones. Additionally, implementing strategies such as the Pomodoro technique can be helpful. This technique involves working in focused bursts of time, typically 25 minutes, followed by a short break. This helps individuals with ADHD stay engaged and motivated while also allowing for regular breaks to prevent burnout. 12.2.6 Seeking support and accountability. Seeking support and accountability can greatly enhance the goal-setting and achievement process for individuals with ADHD. This can involve sharing goals with a trusted friend, family member, or mentor who can provide encouragement and hold them accountable. Joining support groups or seeking professional coaching can also provide valuable guidance and motivation. It is important to remember that setbacks and challenges are a normal part of the goal-setting process. Individuals with ADHD may face obstacles along the way, but with perseverance and the right strategies, they can overcome these challenges and continue working towards their goals. By setting realistic and specific goals, breaking them into manageable steps, managing time effectively, minimizing distractions, and seeking support, individuals with ADHD can set themselves up for success in achieving their life goals. With determination and the right strategies in place, individuals with ADHD can thrive and accomplish great things. 12.3 Maintaining a healthy lifestyle. Living with ADHD can present unique challenges, but maintaining a healthy lifestyle can greatly improve your overall well-being and help manage your symptoms. By incorporating healthy habits into your daily routine, you can enhance your physical and mental health, increase your focus and attention, and improve your overall quality of life. In this section, we will explore various aspects of maintaining a healthy lifestyle with ADHD. 12.3.1 Exercise and physical activity. Regular exercise and physical activity have been shown to have numerous benefits for individuals with ADHD. Engaging in physical activity helps release endorphins, which are natural mood boosters and can help reduce symptoms of anxiety and depression often associated with ADHD. Exercise also increases blood flow to the brain, improving cognitive function and enhancing focus and attention. Finding an exercise routine that you enjoy is key to maintaining consistency. Consider activities such as walking, jogging, swimming, cycling, or participating in team sports. Aim for at least 30 minutes of moderate intensity exercise most days of the week. If you struggle with motivation, try finding an exercise buddy or joining a group class to make it more enjoyable and hold yourself accountable. 12.3.2 Healthy eating habits. Proper nutrition plays a crucial role in managing ADHD symptoms. While there is no specific ADHD diet, adopting healthy eating habits can support your overall well-being. Focus on consuming a balanced diet that includes a variety of fruits, vegetables, whole grains, lean proteins, and healthy fats. Avoid excessive consumption of sugary foods and drinks, as they can lead to energy crashes and difficulty concentrating. Instead, opt for foods that provide sustained energy, such as complex carbohydrates and protein. Additionally, omega-3 fatty acids found in fish, flax seeds, and walnuts have been shown to have potential benefits for individuals with ADHD. It's also important to stay hydrated by drinking plenty of water throughout the day. Dehydration can contribute to fatigue and decreased cognitive function, so make it a habit to carry a water bottle with you and sip on water regularly. 12.3.3 Sufficient sleep. Getting enough quality sleep is essential for individuals with ADHD. Lack of sleep can exacerbate symptoms of inattention, hyperactivity, and impulsivity. Establishing a consistent sleep routine can help regulate your body's internal clock and improve your overall sleep quality. Create a relaxing bedtime routine that includes activities such as reading, taking a warm bath, or practicing relaxation techniques like deep breathing or meditation. Avoid stimulating activities and electronic devices close to bedtime, as they can interfere with your ability to fall asleep. Ensure that your sleep environment is conducive to restful sleep. Keep your bedroom cool, dark, and quiet, and invest in a comfortable mattress and pillows. If you struggle with sleep difficulties, consider speaking with a healthcare professional who can provide guidance and support. 12.3.4 Stress management. Stress can significantly impact individuals with ADHD, making it crucial to develop effective stress management techniques. Chronic stress can worsen ADHD symptoms and lead to difficulties with focus, attention, and emotional regulation. Find healthy outlets for stress relief that work for you. This may include engaging in activities such as yoga, meditation, deep breathing exercises, or journaling. Regular exercise, as mentioned earlier, is also an excellent way to reduce stress levels. It's important to identify and address the sources of stress in your life. This may involve setting boundaries, learning to say no when necessary, and seeking support from friends, family, or a therapist. Additionally, practicing time management techniques and prioritizing self-care can help reduce stress and improve overall well-being. 12.3.5 Mindfulness and Meditation. Incorporating mindfulness and meditation practices into your daily routine can be beneficial for individuals with ADHD. Mindfulness involves paying attention to the present moment without judgment, while meditation focuses on training the mind to achieve a state of calm and relaxation. Practicing mindfulness and meditation can help improve focus, attention, and emotional regulation. It can also enhance self-awareness, allowing you to better understand your thoughts, feelings, and reactions to different situations. Start by dedicating a few minutes each day to mindfulness or meditation. Find a quiet and comfortable space, close your eyes, and focus on your breath or a specific object. If your mind wanders, gently bring your attention back to the present moment. Over time, you can gradually increase the duration of your practice. 12.3.6 Social Support and Connection. Building a strong support network is essential for individuals with ADHD. Surrounding yourself with understanding and supportive individuals can provide emotional support, practical assistance, and a sense of belonging. Seek out support groups or online communities specifically for individuals with ADHD. These platforms can offer a safe space to share experiences, exchange coping strategies, and receive encouragement from others who understand the challenges of living with ADHD. Additionally, maintaining healthy relationships with family and friends can provide a valuable support system. Communicate openly with your loved ones about your ADHD and educate them about the condition. This can help foster understanding and empathy, and they can offer support when needed. 12.3.7 Seeking professional help. While maintaining a healthy lifestyle can significantly improve ADHD symptoms, it's important to remember that everyone's journey is unique. If you find that your symptoms are significantly impacting your daily life and functioning, it may be beneficial to seek professional help. A healthcare professional, such as a psychiatrist or psychologist specializing in ADHD, can provide a comprehensive assessment and develop an individualized treatment plan. They may recommend medication, therapy, or a combination of both to help manage your symptoms effectively. Remember, managing ADHD is a lifelong process, and it's essential to be patient and kind to yourself. By incorporating healthy lifestyle habits, seeking support, and utilizing appropriate treatment options, you can thrive with ADHD and lead a fulfilling life. 12.4 Finding support and community. Living with ADHD can be challenging, but you don't have to face it alone. Finding support and connecting with a community of individuals who understand your experiences can make a significant difference in managing ADHD effectively. In this section, we will explore various ways to find support and build a strong network of people who can provide guidance, encouragement, and understanding. 12.4.1 Joining support groups. One of the most valuable resources for individuals with ADHD is support groups. These groups bring together people who share similar challenges and provide a safe space to discuss their experiences, seek advice, and offer support to one another. Support groups can be found in various formats, including in-person meetings, online forums, and social media groups. When searching for a support group, consider your specific needs and preferences. Some groups may focus on general ADHD topics, while others may cater to specific age groups, such as children, adolescents, or adults. Additionally, some support groups may specialize in addressing coexisting conditions or specific challenges related to ADHD, such as time management or emotional regulation. 12.4.2 Online communities and forums. In today's digital age, online communities and forums have become a popular way for individuals with ADHD to connect and share their experiences. These platforms provide a convenient and accessible space to seek advice, share strategies, and find support from people all around the world. When joining online communities or forums, it's essential to choose reputable platforms that prioritize respectful and constructive discussions. Look for communities that have active moderation to ensure a safe and supportive environment. Engaging in online discussions can provide a sense of belonging and help you gain insights from others who have faced similar challenges. 12.4.3 Seeking professional support. While support from peers is valuable, it's also crucial to seek professional support when managing ADHD. Mental health professionals, such as psychologists, psychiatrists, and therapists, can provide guidance, therapy, and medication management when necessary. They can help you develop coping strategies, address coexisting conditions, and navigate the various aspects of your life affected by ADHD. When choosing a mental health professional, consider their experience and expertise in working with individuals with ADHD. It's essential to find someone who understands the unique challenges associated with ADHD and can tailor their approach to meet your specific needs. Don't hesitate to ask questions during the initial consultation to ensure a good fit. 12.4.4 Building a supportive network. In addition to joining support groups and seeking professional help, building a supportive network of family, friends, and loved ones is crucial in managing ADHD. These individuals can provide emotional support, understanding, and encouragement during challenging times. Educate them about ADHD, its symptoms, and how it affects your daily life to foster empathy and effective communication. Communicate your needs and challenges openly with your support network, and let them know how they can assist you. This may include reminding you of important tasks, helping you stay organized, or providing a listening ear when you need to talk. Having a strong support system can make a significant difference in your overall well-being and ability to manage ADHD effectively. 12.4.5 Participating in ADHD coaching. ADHD coaching is a specialized form of coaching that focuses on helping individuals with ADHD develop strategies and skills to manage their symptoms and improve their overall functioning. ADHD coaches work collaboratively with their clients to set goals, create action plans, and provide ongoing support and accountability. Working with an ADHD coach can be highly beneficial, as they understand the unique challenges associated with ADHD and can provide personalized guidance tailored to your specific needs. They can help you develop strategies for time management, organization, and goal setting, as well as provide support in areas such as emotional regulation and self-esteem. 12.4.6 Engaging in ADHD advocacy. Engaging in ADHD advocacy can be a powerful way to find support and make a positive impact in the ADHD community. Advocacy involves raising awareness about ADHD, promoting understanding, and advocating for improved resources, accommodations, and support for individuals with ADHD. You can get involved in advocacy by joining local or national ADHD organizations, participating in awareness campaigns, sharing your story, and advocating for policy changes that benefit individuals with ADHD. By becoming an advocate, you not only contribute to the community but also gain a sense of purpose and empowerment in managing your own ADHD. 12.4.7 Attending ADHD conferences and events. Attending ADHD conferences and events can provide a unique opportunity to connect with experts, professionals, and individuals with ADHD. These gatherings often feature workshops, presentations, and panel discussions on various topics related to ADHD. They offer a chance to learn from experts, gain new insights, and connect with like-minded individuals. Look for local or national conferences and events focused on ADHD and related topics. These events can provide a wealth of information, resources, and networking opportunities. Engaging in conversations with experts and fellow attendees can help you expand your knowledge, find inspiration, and build lasting connections within the ADHD community. 12.4.8 Utilizing online resources. The Internet offers a vast array of resources specifically designed for individuals with ADHD. From informative websites and blogs to podcasts and YouTube channels, there is a wealth of information available at your fingertips. These resources can provide valuable insights, practical tips, and personal stories that can inspire and support you on your ADHD journey. When utilizing online resources, it's important to critically evaluate the information and ensure that it comes from reputable sources. Look for content created by experts in the field, such as psychologists, psychiatrists, or individuals with professional experience in ADHD. Engage with the content mindfully, taking what resonates with you and applying it to your own life. Finding support and community is an essential part of thriving with ADHD. By connecting with others who understand your experiences, seeking professional help, and building a supportive network, you can navigate the challenges of ADHD more effectively and lead a fulfilling life. Remember, you are not alone, and there are resources and people available to support you every step of the way.